Good morning. I am Dr. Vivek Jain, and here we come to the final last punch for your FMG PSM Marathon Mission 200 Plus FMG January 2026. Welcome everyone, friends. Mission 200 Plus program students. Friends, this is your lab 3. You have already done the complete PSM course in 40 hours in lab 1. You have also done the revision lab 2. We had live ENDs also. I'm presuming you have done all the late night PYQs. You have done everything. GTs, mocks you have given. Now it is time for a final revision. Also joining us today is YouTube Live, where students will be joining this session. Chat box as usual will be open in both the online session in the app as well as YouTube also. And let us try to cover as many questions as possible. Idea is to cover 100% of course in today's class. So good morning, everyone. Let us not waste time. Let us start PSM with Cerebellum Academy, me, Dr. Vivek Jain. Let us start with epidemiology. Epidemiology. Look at the question. It will be a mix of theory and question, 100% course coverage. You have to find relative risk. How do we calculate relative risk, friends? If a question comes in your exam, I am looking at the chat box. Yes, incidence in exposed divided by incidence in non-exposed. Look carefully at the screen. 100 vaccinated, 6 develop the disease. So out of 100 vaccinated, 6 develop the disease. Out of 100 non-vaccinated, 12 develop the disease. Out of 100 not exposed to vaccine, 12 people develop. So relative risk is 0.5. Choice number A. Absolutely right you are. Yes, Dr. Tanuj, Dr. Raj, you are right. Dr. Amitabh Bachchan is also here. Dr. Malvika is here. Dr. Love Kiledar, Dr. DNA027, all of you are right. Now, friends, whenever relative risk is more than 1, we declare association is present, equal to 1, no association, less than 1. This is also association, but it is inverse or negative. Many times during stress in the exam, students less than 1 mark as no association. No, this is also association, negative inverse, risk factor is beneficial. What is the expected relative risk between OCPs and thromboembolism? More than 1, equal to 1, less than 1. OCPs and thromboembolism. More than 1. Smoking and ulcerative colitis. Smoking and ulcerative colitis. Less than 1 because it is protective. Milk consumption lung cancer. Milk consumption lung cancer. Equal to 1. There is no association. Condom usage and HIV transmission. In a district or a country, if you look at condom usage, HIV transmission. Less than 1. More the condom usage, lesser the HIV transmission. So any example they ask you directly, you should be able to answer. They'll ask common examples which we use in different aspects of medicine. Now, can you identify this first study design, friends? This one. Let us look at this. What is this? Yes, you are right. This is a cohort study. Why this is a cohort study, friends? The hallmark of cohort study is its forward direction. Two groups, exposed, non-exposed, and we get incidence in exposed, incidence in non-exposed, which we have already discussed, is given by the formula relative risk. Can anyone tell me what is the other name of relative risk? Yes, Dr. Joshita is also right. Dr. Pragya Paneri is also right. Yes, risk ratio. So another name is risk ratio. So forward looking prospective cohort studies, cause to effect study, follow-up study, also known as incidence study. Now compare and contrast with second image on the right side. This is a type of, let me enlarge. You will not have the facility to zoom in the exam, but here I have the facility. This is a type of case control study. Why you are saying it is a case control study, friends? Because case control is exactly opposite in direction to cohort study. Look at the screen carefully. You can see it is going in a backward direction and it is mentioned in the question. We are starting from cases control. Again, look carefully. Everything is mentioned. We are looking backward. Study starts with disease and healthy people. In a case control study, you do not get number of new cases or incidents every year. It is a backward looking retrospective study. How do you calculate strength of association? What is the strength of association? What is the formula? And what is its other name? Three questions I ask. What is the strength of association? Dr. Siddharth, Dr. Shruti, Dr. Daisy, all of you are right. That is odds ratio, very right. And what is the formula? What is its other name? Odds ratio is given by the formula. That Rocky Vlog 7011 is also right. DNA OT 27 is right. Yes, that is AD by BC. AD by BC is also known as cross product ratio. Now, suppose when you are appearing in the FMG exam, there is so much of stress. Your mind tells you AD by BC is not correct. AC by BD is correct. So is one correct or two correct? This is how doubt comes in the mind when you are attempting the paper, friends. Which is correct? Yes, your original hunch is always correct. So focus on the questions. Do not overanalyze the questions. 50 to 70% questions are going to be very, very easy. Let's stick to easy part, right? Okay. Calculate the strength of association in this case control study. In the exam, you will not have the liberty of rough sheet. In the mind, you will have to think. This is A, this is B, this is C, this is D. So, AD by BC. Formula you will have to remember. Of course, you have online calculators with you. So, odds ratio in this study will be 3. Right? So, Dr. Rahman Dakat is also here. He is right. Amitabh Bachchan, Dr. Lakshita, Dr. Gopala. In the chat box, all of you are right. On the YouTube, Dr. Love Kiledar is right. Dr. Human Hit. कोई भी अपना असली नाम क्यों नहीं यूज करता भाई तुम? So it is odds ratio 3. Interpretation more than one. Definitely association is present between asbestos exposure in the past and occurrence of lung cancer currently. Lung cancer currently. Yes, you can do without table also. If in the diagram here they write what is A, C, B and D values, then also you can do. That's right. Odds ratio is also known as cross product ratio. So other name of odds ratio is cross product ratio because you're doing cross multiplication. Meaning is same. More than 1, equal to 1, less than 1. Great. Let's move further. Can you organize the steps of case control study in sequence? Recently, quite a few questions have appeared in national board exams on the steps of a study design. So just have to think logically, go slowly. What is the correct answer? See, whenever you do case control study, first you have to select cases, then you do matching. You match. Now the both groups are exactly similar to each other. Now you measure their exposure by asking history in the past. There may be some recall bias, but you can measure. And finally, make a table, calculate odds ratio, analyze, interpret your result. So look carefully. 4, 2, 1 and 3. Choice number C. Yes, Dr. KL Rahul is right. Dr. Ayush Bishnoi is right. Dr. Bansi, Dr. Abhi, Dr. Rupali, Dr. Chandra Sekhar, you are right. Dr. Mohit, Dr. Anvesh Yadav, Dr. Pragya Paneri, all of you are right. Good. It tells me all of you seem very well prepared for the upcoming exam. That's a very good sign. Which is prevalence study? Which is prevalence study, friends? Prevalence study is cross-sectional. What is incidence study? What is incidence study? Cohort study. Good. Now, can you tell me if I use a ecological study, How will I differentiate it from cross-sectional study? One is cross-sectional gives me prevalence. Ecological is used in nutritional surveys. But what is the technical epidemiological difference between these two study designs? Can anyone tell me? Yes, Dr. Raj is absolutely right. Dr. Abhishek Singh is right, very right. Cross sectional is based on primary data collected by investigator himself. If examiner tells you in the question, investigator went house to collect data or blood samples of the patients. This is primary data cross sectional. Ecological is based on secondary data. You don't want to go house to house as an investigator. You go to hospital. OPD already some girls were tested for hemoglobin. You take their data. This is secondary data ecological study. Ecological study. Yes, good to see. YouTube also, all students are answering correctly. Majority of you. Good. Horizontal study is which study? This is a very old FMG question. All your today's class is based on last 10 years of FMG questions. Horizontal study is a study which is forward or backward in nature. So this will include cohort and case control study. Cohort study forward, case control backward. What about cross-sectional ecological? They are known as cross-sectional ecological are done at a point of time. So they are known as vertical study. Now similarly, they ask in your paper, longitudinal is horizontal or vertical? Longitudinal study is horizontal or vertical? Okay, Dr. Pranjal says, Dr. Virat says, Dr. Rotinon says horizontal is longitudinal. Is this correct, friends? Or is it they are telling us wrong? Is this correct? This is correct. Don't go by latitude or longitude of a globe. Horizontal studies, longitudinal studies are those which have a direction. Studies which don't have a direction forward, backward at a point of time. Vertical studies are non-longitudinal, right? Okay, good. Let's move further. Look at this question carefully. A study was done in 3 districts to measure mean blood pressure. Health workers visited each house of the 3 districts to measure the blood pressure. This is cross-sectional study. Answer comes from what you have already told me earlier. This is primary data collected by investigator himself. Now suppose same question comes like this. A study was done in 3 districts by going to their hospital. In the OPD, we checked the records and we came to know about the blood pressure of the patients visiting the OPD. And we calculate how much hypertension is present in that population. Now this becomes secondary data. Pre-existing data is being used by investigator. This becomes ecological study. So I'll again repeat. Cross-sectional, ecological, both can give prevalence, but cross-sectional mainly gives prevalence. It is primary data. Ecological mainly used in nutritional studies, secondary data. Secondary data. Good. Confounding factor or confounding is associated with, is it exposure? Is it outcome? Definition based questions will come a lot in the paper this time. Confounding is associated with exposure, outcome, both or none. It is with both. Yes, you are right. Confounding is removed by, what is the method we generally use for removal of confounding? That is matching. I am telling you a statement, tell me true or false. Matching distributes confounding factor equally in both the groups. Matching distributes confounding factor equally in both the groups. That is a correct statement. So confounder is unequally distributed. We match it and distribute it equally. When you come for PG, I will tell you there are many more methods to remove confounding. Overall, stratified randomization is best. But for your exam FMG, remember matching is removed. Matching is the method used for removal of confounding. What is Bergsonian bias? Definition based question. What is Bergsonian bias, friends? Yes, Different rates of hospital admissions. Suppose your hospital is giving very good pediatric care. More pediatric patients start coming to your hospital. If I look at this data and say that pediatric problems are increasing in the society, this wrong error or interpretation is known as Burkesonian bias. Pediatric problems are not increasing. You are giving better services, more such patients are coming to your hospital. Can you now tell me Burkesonian bias is subject bias, investigator bias, or analyzer bias? Subject bias, investigator bias, or analyzer bias? Investigator bias. Which type of investigator bias this is? If you remember in our live classes, we discussed many types of biases. Which type of investigator? Yes, Dr. SS is right. This is a selection bias. As an investigator, I have selected a wrong hospital to study pediatric problems. I was not aware this hospital is giving very good services, so more pediatric problems are coming to this hospital. So this is a type of investigatory selection bias. Dr. Pragya Paneri is also right. Dr. Ashish, Dr. Rohit Vinay Kumar is also right. Good. Double blinding. Who is blinded? Double blinding. Who is blinded? Dr. Abhi is right. Yes, both subject as well as investigator. So it will remove both type of biases. Which is best type of blinding? Which will remove all types of biases. That is triple. But triple means more money is required. So most commonly done in the world by the investigator is double. ये दो अलग क्वेश्चंस हैं. These are two different questions. Best ideal is triple, most common is double. And what if there is complete absence of blinding? Full of biases. Such type of useless study is known as anyone? Yes, Dr. Ashish, Dr. Panashri is all right. That is open trial or open study. Open study is described as complete absence of blinding, neither triple nor double nor single, and it is full of biases. Full of biases. Full of biases. Right. Dr. Paresh Chaudhary is also right. Let's move further. What is heart of RCT known as? A randomized controlled trial. We have randomization, controlled or the comparison group, trial of a new drug or vaccine. Most important is randomization. It is more important than comparison controlled group, even more important than the trial of the new drug or vaccine. And what is the essential purpose of randomization? Anyone? Single best answer? Yes, Dr. Abhi, Dr. Malvika, Dr. Pranjal. No, Dr. Pranjal, it won't be the correct answer. I am asking best single answer. Which bias? Which bias, Dr. Alisha? Yes, that is selection bias. So, removal of selection bias. Yes, it distributes all confounding factor also equally. It makes sure both groups are similar in prognostic factors. Clinical trials. What is the unit of study? Clinical trial phase 1. What is the unit of study? Dr. Rupali is right. That is healthy human volunteers. Can you tell me which other phase of clinical trial healthy human volunteer is the unit of study? No, it is not phase 3. It is phase 0. Phase 0. Right? नहीं, healthy patient word we will not use DNA OT27. Healthy patient दोनों word इकट्ठे कैसे हो सकते हैं? Healthy human volunteer. He is not having the disease. So healthy person is the unit of study. Clinical trial is which phase represented as a RCT, which is the only phase which has got a comparison group. That is phase number 3. Therefore, RCT is one of the most superior study design. Only if your drug clears phase 3, then only you can launch it in the market. Launch it in the market. Yes, Dr. Pragya is right. Banumati is also right. Correct. Post marketing surveillance. Answer lies in the word itself. Surveillance of side effects after marketing the drug. So marketing is done after phase 3. So post marketing is going to be phase 4, and it is for rare side effects or long term side effects. What should I mark? Rare or long term side effects? Both are correct. Good. But which is a single better answer? If both are given in separate choice, examiner ask me, mark only one answer. What should I mark? Phase 4. Rare or long term? See in the choice chat box, I'm getting both the answer. Just think. Think first. Yes, majority of you are right. It is long term side effects. See, ultimately, phase 4 is a never ending phase, infinite, minimum 10 to 25 years for each drug. So it is mainly used for not rare, mainly for long. Even on YouTube, Dr. Mohit is right, Dr. Bhanumati is right, right? It is for long term side effects. Maximum tolerated dose of a drug is found in which phase? Maximum tolerated dose. This is your older PYQ. Phase 1. What is phase 0 for? This has recently been introduced. Prior to phase 1, on a small number of healthy human volunteers, we give 1/10 of the dose. This is microdosing. So I'll repeat, 1/10 of the dose in a very small number of healthy human volunteers, generally 1, 2, or 3. 1, 2, or 3. Right. Dr. Anjali Raut is also right. Correct. Let's move further. Take this question. Relative risk 0.65. What should be the correct interpretation between green tea and obesity? Less than 1. So it decreases the risk of obesity according to this study. Actually, green tea won't until you go to the mountain and bring green tea by plucking the leaves yourself. I don't think green tea consumption can reduce so much the risk of obesity, right? But don't go by logic, go by your exam question. Less than 1 is protective. Yes, you are right, Dr. Mohit, right? So this is 0.65. Let's move further. Read question carefully. Aniline dye exposure, development of bladder cancer, case control study. What should be the study groups? Aniline dye exposure, development of bladder cancer. What should be the study groups? Okay, here we are getting confused. Many students are saying C, many students are saying D. This you have to read carefully, friend. It is a case control study. So you will start with cases and controls. Correct answer is choice C. Bladder cancer, healthy people, ask history of aniline dye exposure 10 years ago. What will be the two groups? If I want to establish association, same example using cohort study, then your answer will be D. Exposed to aniline dye factory workers exposure, non exposure working in some other factory or elsewhere, not exposed to aniline dye. So please read the question carefully. Which study design are they asking? Right? Okay. Read this question. Duration of exposure was obtained from past records of employment. See, if I take aniline dye exposure today, go forward 10 years, bladder cancer occurs, cohort study. If I take bladder cancer today, ask history of exposure in the past to aniline dye exposure, case control study. Now what I'm doing, first I go back, find out exposed, non-exposed, those who were there at the time 15 years ago in the factory from their records of employment. I find aniline dye exposed, non-exposed. Then I come to current time and see how many of them have developed the disease. This is retrospective cohort study. Please remember, in cohort study, you go forward. Aniline died to bladder cancer for 15 years or 10 years. In case control study, cancer patient you ask history of aniline dye exposure. Retrospective cohort study. First you go backward. Hospital records, employment records you find. aniline dye exposure, non-dye exposure, then come to current time and see how many of them have developed. So wherever you find this word, hospital records, employment records, answer has to be retrospective cohort study. Why it is cohort? Because although we are going backward, but we are still starting from exposure, right? We are starting from aniline dye exposure, coming to current time to see how many of them have developed the disease, right? Okay. When you come for PG exam, then I will tell you about mixed cohort, nested case control, and higher study designs. But as of now, you should be masters of prospective cohort case control, formula calculation, and you should know retrospective cohort because it came for the first time in your paper. High chances this question will be repeated as it is in your upcoming exam also. Which study design is depicted in the image? Which study design is this, friends? RCT. What is this? Yes, this is randomization. Can you tell me what is the meaning of random in RCT? What is the meaning of random in sampling also? Yes, it means equal and known chance. So examiner will try to confuse you. Equal unknown, unequal known, unequal unknown. It is equal and known. We know how much it is, and everyone has equal chance also, right? Okay. Yes, it is correct. Dr. Pragya is right. Correct. A gymnasium owner found people drank iced tea while exercising in his gym. He mentioned weight loss was due to iced tea. This is a type of spurious or false association. People are not reducing weight due to his iced tea. They are reducing weight because they are exercising in the gym. He wants to shut down his gym. So he is attributing it wrongly to another factor, that is drinking iced tea. One classical example which appeared in other exams of spurious association was there is increased MMR for hospital deliveries in England. Now in England, in 1960s, people were very fond of home deliveries. No problem. Whenever problem occurred, obstruction of labor, PPH, they will immediately refer the woman to the hospital. Only severe complicated cases were raising and they were dying. Someone did a study. He found if you go to hospital for delivery, you will die. Chances of death will increase. This wrong association is known as spurious association. Spurious association. Increase altitude leads to goiter. This is a type of direct, indirect, or spurious association. See, if you or me start climbing up the mountain, we will not develop goiter. Ki when we reach the top of the mountain, we develop goiter. No, this is because iodine deficiency. As you go up the altitude, iodine becomes progressively deficient in soil. If you eat fruit, vegetables for many years grown in that soil, goiter may occur. So this is a type of indirect association, which is the most common element deficiency in Himalayan population. Which is the most common element deficiency in Himalayan population? Yes, Dr. Shivani, Dr. Rohit, Dr. Raj, all of you are right. Yes, absolutely. Correct answer is boron. So, iodine deficiency does not exist now much because of iodized salt. Boron deficiency has now become most common in Himalayan population. Can you tell me what is the level of salt iodization? I will keep on asking random questions also. Iodization at production level, consumer level. What is the level of salt iodization? Both levels I need in the same answer, in the same. Yes, Dr. Malvika is given the correct answer. Dr. Rohit, Dr. Hacker, Dr. iPad, all of you are right. 30 parts per million, 15 parts per million. 30 parts per million, 15 parts per million. Iodine deficiency. What is the most common cause of mental retardation? It's not iodine deficiency, that is Down syndrome. And what is the most common cause of hypothyroidism? What is the most common cause of hypothyroidism? That is autoimmune disorders. Yes, Dr. Dhani Janardhan is also right. Autoimmune disorders like Hashimoto thyroiditis. Thyroiditis, right. Identify which model of disease causation is represented in the diagram. Web of causation. It was given by, very old question, it was given by McMahon and Pook. Latest question. What is the main role of web of causation? Is it finding the multiple risk factors, how they are related to each other? Yes, but that is not the major in use. Yes, Dr. Rupali is right. Major use to give possible places for intervention. See, what is multifactorial causation? Multiple factors can cause a disease. How they are related to each other like a spider's web of causation. It tells you what are the possible places of intervention. Diet to obesity, hardening of arteries, how can we prevent stroke? How can physical activity reduce or prevent hypertension? How can cutting down smoking prevent heart disease? Possible places of intervention it can tell us, right? Yes, Bright Moon 2404 is also correct. Correct. Can you identify your Shah Rukh Khan, Amir Khan, Salman Khan, and Hrithik Roshan correctly? All the four. Number one is Edward Jenner. Number two, Jon Snow. Number three, Louis Pasteur. All of you are writing correctly. And number four, anyone? James Lind. Yes, all of you are actually writing correctly. That's good to see. What is the contribution of Edward Jenner? Edward Jenner. He discovered first vaccine smallpox. It became first disease to be eradicated. He coined the term vaccination also. John Snow, father of epidemiology, father of modern epidemiology. He worked on the disease cholera. Cholera came to be known as father of public health. Louis Pasteur, he gave the term vaccine. He developed two important vaccines. He developed more vaccines, but two important vaccines were rabies vaccine, anthrax vaccine. He also gave the concept of pasteurization. Also, he was given by him only. Yes, pasteurization of milk. James Lind, question was asked, what is its exact contribution? Many students marked the wrong answer. He did not discover vitamin C. He did not discover scurvy. What was his actual contribution? Anyone? Yes, few of you are right that citrus fruits can prevent scurvy. So they can prevent and cure scurvy. Vitamin C was discovered many years later that its deficiency leads to scurvy. So very specific questions are asked in the paper. Specific answers we have to mark. Vaccines cold chain. Mark carefully. Mark carefully this answer, friends. All are passive immunity except. Okay, most of you are saying C, but some students are writing B also. Which is correct? It is C. See, please remember vaccines and natural infections. They stimulate your immune system. Antibodies are produced, active immunity. Whereas immunoglobulins, vertical transmission, ready-made antibodies, passive immunity. So you can check in the question: immunoglobulin, antitoxin, antibodies, ready-made. Make it a passive immunity. So read the question carefully in the paper. Right? Okay. Yes, Dr. Sagori Kadasa is also right. Read the question. Mark the answer. Which concept are we talking of when such a question comes in your paper? We are looking at open vial policy. So let us first mark the answer, then we'll discuss the question. You are right. It is discard BCG, use OPV. Discard BCG, use OPV. Dr. Panik is right. Dr. Kamlesh Patil, you have to correct your answer. Dr. Pragya is right. Same similar question appeared in your exam earlier also. What is the correct answer now? Discard MR, use pentavalent. Yes, Dr. Monica, Dr. Nobita, Dr. Ben, Dr. Mahmood, Dr. Sishti, Dr. Sachiv, Dr. Rotavirus, all of you are right. So let us quickly look at open vial policy. It is applicable on T series of vaccines. Which group of vaccines are T series? DPT, DT, TT, TD, pentavalent containing Haemophilus influenza B and hepatitis B. It is also applicable on OPV, IPV, pneumococcal conjugate vaccine. It is not applicable on lyophilized vaccines. Which are lyophilized freeze-dried vaccines? BCG, measles, MR, MMR. Not applicable on JE vaccine, COVID vaccine. Now, rotaviral vaccine appear in both the groups. Appear in both the groups. If vaccine vial monitor is on top of the vial, not applicable. If on the side of the vial, it is applicable. So depends on the location of vaccine vial monitor. How long open vial policy is permissible? How long you can bring back the vaccine in cold chain even if doses are left? 4 hours, nahi, that is for use of lyophilized vaccine after reconstitution. This is up to 28 days. 28 days, right? Okay, good. Let's move further. Can you quickly mark answers to the question written on the screen? This is which type of vaccine? What is the strain? Covaxin is 100% whole virion inactivated. Killed vaccine. It has a strain National Institute of Virology 2020 770. Yes, Dr. Rotinon is correct. Dr. Rohit Sharma is also right. Dose 0.5 ml, 2 doses, 4 to 6 weeks gap, intramuscular, deltoid. Can anyone tell me what is the unique feature of this vaccine? Yes, good. It is 100% indigenous vaccine prepared by Bharat Biotech. Bharat Biotech. Can you tell me Covishield is which group of vaccine? Covishield belongs to which group of vaccines, friend? Viral vector base. Yes, Dr. Shepherd is right. Yes, all of you are right. Viral vector based vaccine. Can you tell me these questions? Look at the vaccine. It is measles vaccine. This is live attenuated lyophilized 0.5 ml subcutaneous right arm. See, we have discussed in our mission classes all intradermal left half of the body, all subcutaneous right half of the body. What is the strain, anyone? What is the strain, anyone? Yes, Edmonston Zagreb. We also have Suarez strain, Moreton strain, but India is using, please remember, India is using Edmonston Zagreb. Efficacy 90% with one dose, two doses take it above 99%, also known as armor strategy. Accelerated measles mortality reduction strategy. Accelerated measles mortality reduction strategy. Yes, if delayed, Dr. Ginny, you are right. We can use it for 5 years. Up to 5 years, delayed immunization of measles vaccine is permitted. What is the most common complication of measles disease? Can anyone tell me? What is the most common complication of measles disease? Randomly asking. Not vaccine, disease. Yes, serous otitis media. Serous otitis media. What is the life-threatening complication of measles vaccine? Life-threatening complication of measles vaccine. Toxic shock syndrome if used 4 hours beyond reconstitution. Good. Type of vaccine, strain, diluent. Look at this carefully. JE vaccine. This is a type of live attenuated lyophilized. Strain is a very popular question, friends. What is the strain? In the National Immunization Schedule, SA 14-14-2, diluent of this vaccine is phosphate buffer saline. No, it is not normal saline. Normal saline is for BCG. BCG. No, Danish 1331, Dr. Kamlesh, is the strain of BCG. J is SA 14-14-2. Dr. Lakshita is right. See, you don't have the option of zooming in. If image is very clear on the screen on the computer, many times you will find the answer also. Many times you will find something on the slide also, right? Identify, then tell me what is the schedule for NIS, National Immunization Schedule for this. Nakayama was the older strain. That was the older killed vaccine strain, which we don't use in India now. Yes, we give 9 months, 1 lakh. Then every 6 months, we give 2 lakh. We are talking of vitamin A solution. This spoons help in that. There is a unique feature of this spoon. It has a outer margin and an inner mark. Inner mark is 1 ml, which is equal to 1 lakh international units. Outer margin is 2 ml, which is equal to 2 lakh international units. Now, even an illiterate health worker who has no idea about lack of international units can directly give. 1 साल से कम बच्चा हो तो inner mark, 1 साल से ज़्यादा बच्चा हो तो complete teaspoon. This type of apparatus is known as, which can be used by any person, even a non-medico. Dr. Rohit is right. Field instrument. Anyone can use. And what is the total dose of vitamin A in the program? 9 months, 1 lakh. Then 6 months, 2 lakh up to 5 years. 8 times you are giving 2 lakh. 1 plus 16. Yes, 17 lakh international units. Now, a new question. If you have opened vitamin A bottle today in immunization session, how long you should use this bottle? Once opened, vitamin A solution bottle should be used up till good 8 weeks. Good. Up to 8 weeks. Dr. Ashish, Dr. Rohit, Dr. Sumit Sharma, Dr. Abhi, Dr. Pushkar, Dr. Rupali. All of you are right. Good. 8 weeks. It should be done. Good. Identify and answer these five simple questions. This is ice lined refrigerator. Most important component of cold chain. Most important component of cold chain. Kept at PHC. Temperature for all the vaccine is 2 to 8. Storage duration at a PHC. Anyone? What is the storage duration? It goes up to 1 month. Good. Minimum electricity 8 hours a day. Without electricity up to 5 days. Can you tell me which vaccine should be kept at bottom here? OPV. Because it is the only vaccine which can be frozen also. So it is very comfortable at temperature close to 2 degree also. Look at lower image. This one. This is a dial thermometer. Principle on which dial thermometer works, you are right, thermocouple. Once a day it is used, twice a day, once a week, twice a week. This was the question. Yes, twice a day. Morning, evening, we make a chart. Correct. This is a vaccine carrier. Number of vials, we can keep it maximum is 16 to 20. Storage duration, 12 to 24 hours. Can you keep it at sub center overnight? Due to some reason, team is not able to bring it back to PHC. Can we keep it at the sub center overnight? Yes, because minimum it can maintain is 12 to 24 hours. Right. Dr. Panik is also right. Okay. Read the question. Generally, after BCG administration, there is macule, papule, ulceration, scab, scar formation. Suppose it is not there scar. What should be done? Nothing else is required. How will you confirm from the mother that BCG vaccine was taken? Best is immunization card. If it is not there, then how will you confirm from the mother? History, how will you ask? Ask her, was any vaccine given at birth? Suppose she says yes. How will you cross check? Where it was given. The moment she says here, it means it is BCG. Right? Hospital delivery is not a guarantee. You have to ask where it was given. She will distinctly remember कि हाथ में लगा था. So that means BCG has been taken. BCG has been taken. Right? Okay. Rabies vaccination. What is the SN regimen? SN regimen is intramuscular. Yes, Dr. Abdul Moiz is right. 1 dash 1 dash 1 dash 1. So rabies vaccine is given 5 doses 1 month apart. 5 doses 1 month apart. What about Thai updated Red Cross intradermal regimen? Dr. Daisy, Dr. Catherine, Dr. Vipul, Dr. Malaika, Malvika, all of you are right. 22202. 22202. All of you are right. So please remember these are SN and Thai updated. Which level of prevention this is, although we'll discuss that. Anyone? Yes, this is primary level. Specific protection. All vaccines are. Can you tell me dose of human rabies immunoglobulin? Yes, Dr. Brightmoon is also right. Dr. Rupesh Sharma is also right. 20 international units per kilogram. Where is human rabies immunoglobulin administered? Where is human rabies immunoglobulin? Equine is 40, you are right. Where is this immunoglobulin administered? 100% around the wound. infiltrate 100% around the wound itself. How long you should wash with soap and water? Suturing should be done or not? Antibiotic should be used or not? If used, which one? Local antiseptic should be used or not? Let us look at these answers. Soap and water is minimum 15 to 20 minutes. Suturing is generally not done. If there is a big wound, then under local anti-serum cover you can do. Antibiotic, which one is given? Anyone? Amoxicillin clavulanic. Correct. Augmentin. Local antiseptic should be applied on the site or not? No, 10 minute, 20 minute is not correct. Minimum we say 15 to 20 minute. Yes, local antiseptic should be applied at the site. Rabies immunoglobulin should not be used after how many days of starting the vaccine? Best answer for time is 15 to 20 minutes in the program. Rabies immunoglobulin should not be used after how many days of starting vaccine? Dr. Ginny, Dr. Abhi, you are right. It is 7 days. 7 days of starting vaccine first dose. Do not give immunoglobulin. Absolutely right. Human papilloma virus strains. When we look at Cervarix, it is bivalent. Gardasil quadrivalent. Gardasil 9 nonavalent. India has launched their own vaccine, Cervavac. This is quadrivalent, which becomes India's first state to introduce Cervavac in national immunization schedule, free for everyone, free for all the girls. That is Tamil Nadu. It has also started at AIMS Delhi. Recently, it has also started at AIMS Delhi. So, Cervavac vaccine will come in national program maybe maximum this year or next year, but it has already started. Now, please tell me what is the commonest human papilloma viral strain which is common in India? Yes, HPV 1618. Which is the second most common? Quadrivalent will contain that also. 611. What is the third most common? Is 3133. No, 10 minutes is not correct. Minimum 15 to 20 minutes. Running water with soap should be used for washing the wound, any animal dog bite. Yes, then 45, 50 to 58. Anti-cervical cancer vaccines ideally should be given in which age group? Yes, ideally 9 to 26 years. Private sector, they are going up to 45 years of age. Going up to 45 years of age, right? Single answer. Out of 16, 18, which is more common? Out of 16, 18, 15 to 20 minutes. 16. Program, we have an Indian program, National Rabies Prophylaxis programs categorically says wash with soap and running water for 15 to 20 minutes minimum, right? Okay. Arrange the vaccine vial monitor in correct sequence. Can I say A, B, C, D? Can I say A, B, C, D? No. So write it correctly. Okay, many students are saying B, D, C, A. Is this correct? B, D, C, A. Yes, this is correct. Grade 1, grade 2, grade 3, grade 4. Based on WHO guidelines of VVM, a vial is usable up till which grade? A vial is usable up till which grade? Grade 2. If inner square becomes same color or darker, discard the vial. If inner square becomes same color or darker, discard the vial. It is a indicator of best answer I need. Can I say expiry, efficacy, Viability? No. It is cold chain maintenance in the past. So it does not tell you expiry, it's printed on the vaccine. Viability, efficacy, you can only check later in the lab. It is an indirect marker of potency. Second best answer. Chemical used. P-toluene sulfonate. Nowadays we use diacetylenes more commonly. P-toluene sulfonate, diacetylenes we are using. Correct. What is E here and how much is the observation time? Effect नहीं होता. Adverse events following immunization observed for 30 minutes. So clinical questions will be asked in the paper. Examiner will make a lengthy question using chat GPT. He will ask, after immunization, a child comes back with Guillain-Barré syndrome. Which vaccine must be responsible? So when we look at Guillain-Barré syndrome, we are looking at which vaccine, friends? Influenza, live or killed? Killed influenza. If killed influenza is not in the choice, killed swine flu, that is also a influenza vaccine. Vaccine associated paralytic polio, VAP, vaccine derived poliovirus. Both are due to OPV, oral polio vaccine. This is the advantage of IPV. It is not associated with paralysis. Most common VAP reason P3, VDPV, CP2, community subtype of poliovirus type 2. Toxic shock syndrome can occur due to lyophilized vaccines. Which vaccine is most commonly associated with development of toxic shock syndrome? We have discussed 5 minutes ago. Measles. Shock. We are not talking of toxic shock syndrome. We are talking of shock. Anaphylactic shock. Hypersensitivity. Very good. Most common is with hepatitis B. Hepatitis B. Correct. Good. Read the question. In your exam, easy questions will come. Do not think something there is a catch in the question. 10 years, 16 years, pregnancy. Tetanus toxoid has now been replaced with TD vaccine. TD vaccine. So Dr. Neeraj Sharma is correct. Dr. Jain is correct. Dr. Rohit Vinay Kumar is correct. Rotavirus is given at 6, 10 and 14 weeks. Doc, rotavirus 3 doses are given. Dr. Sumit Sharma is right. 6 weeks, 10 weeks, 14 weeks it is given. Yes, YouTube also. Everyone is answering correctly for this question. Great. What is the serology of IPV vaccine strains in India? PYQ. Serology of IPV vaccine strains. It is type 1, type 2, type 3. Can I say OPV vaccine is same? If not, same choices, what will be the answer? Same choices, what will be the answer? If I ask about OPV, that is bivalent. Earlier, OPV also used to be trivalent. What happened in 25th April 2016 was the global program of switch. When was the national validation day of switch in India? National validation day, anyone remembers? Yes, right. 9th of May, Dr. Daisy is right. 9th of May 2016. Good. Health and disease. Take your time. Don't worry, Dr. Ginny. In the exam, if you're not able to remember the dates, when choices will come, you'll be able to find out. Don't worry. All three. Life expectancy at birth, literacy, income. HDI lies between 0 to +1. Yes, Dr. Chiranjeev Malik is also right. Dr. Bansi, Dr. Ashish is also right. Correct. Can you mark this answer? Read the question. Yes, less than 2400 kilocalories a day. 2100. As we discussed in the class, this is affordability or consumption. This is affordability or consumption. This is a type of. Okay, students are 50-50 divided between affordability and consumption. This is affordability. Consumption is by choice. If you are on fasting today by choice, you will not go below poverty line today. So whether a person can consume does not depend. Whether a person can afford so many kilocalories in a day to buy 3 meals, that is the criteria to define rural area or urban area poverty. Look at this. You are doing counseling for TB in HIV positive. TB is the commonest opportunistic infection of HIV in the India. So HIV positive risk is present. You are counseling him so that he can specifically protect against TB. Counseling, primary. Screening is secondary. It is for disease detection. Choice number B. Choice number B. That is correct. Yes, all of you are correct. Dr. Rupesh, Dr. Riddhi, Dr. Lakshita. Yes. Can you tell me? You can write 0, 1, 2, 3 in the chat box. Measles vaccine. Measles vaccine. Primary level. Rabies vaccine post exposure. Okay, many are saying primary, many are saying secondary. There is a golden rule. All vaccines are only taken when a risk factor is present. All vaccines by default are primary level specific protection. Only exception to this rule is when BCG is used in treatment of bladder cancer. Then BCG becomes secondary level of prevention. I'll repeat. All vaccines including BCG primary specific except BCG in bladder cancer becomes secondary. Spectacles, tertiary. Disability limitation, rehabilitation, both. Disability limitation, rehabilitation, or is it both? Yes, Dr. Sharma is right. Dr. Neeraj Sharma is right. It is both. Category 2 dots. Category 2 dots. Directly observed treatment. Treatment is secondary level. Monitoring of blood pressure. Many students got confused. Monitoring of blood pressure. Again, we are getting different answers, primary, secondary. If you monitor BP of, I told you, Salman Khan on a daily basis, can you prevent hypertension in Salman Khan's body? No. If you cannot prevent hypertension, why you are monitoring BP? Monitoring BP is finding or detecting the disease early. Yes, सलमान भाई का बीपी तो लॉरेंस बिश्नोई को देख के भी बढ़ सकता है, राइट? So this is monitoring of blood pressure is early detection of disease, secondary level of prevention. Source reduction. What is source reduction? Do not allow water accumulation, no water accumulation, no mosquito larva breeding, no malaria. This is primordial, primordial level of prevention. Preserving traditional lifestyle. What is traditional lifestyle? No one is a born smoker. No one is a born alcoholic. Do not start smoking. Do not start alcoholism. Primordial. Now listen to the language of the question, friends. I slightly change the question. Changing lifestyle. Changing lifestyle. Primary. Why will I ask you to change lifestyle? I can see some risk factor. So when I ask you to change lifestyle, primary health promotion. If you actually change lifestyle to prevent some outcome, primary specific protection. So preserving traditional lifestyle is primordial. Changing lifestyle is primary. Seat belt helmet. Seat belt helmet. Primary. It is not going to prevent accident. Problem in accident is head injury leads to all the death. It is a specific protection against head injury. When you are driving a vehicle, you are at risk of accident. What will be primordial level of prevention for this? Just think theoretically. Theoretically, it's not possible, but do not drive. Do not come out on road, right? Do not come out of your house. So that will be primordial level of prevention. Which is the best level of prevention? Primordial, primary, secondary, or tertiary? Best level of prevention overall. Okay, students are confused between primordial and primary. Best is primordial. Do not start smoking. I will not say कि 10 साल enjoy कर लो then stop smoking. So primordial is better than primary is better than secondary is better than tertiary, right? Okay. Prevent emergence of risk factor if possible, right? Taking insurance is primary level. Why are you taking insurance? Risk factor is present, right? Pseudo carrier. What is pseudo carrier? Checking BP is secondary. You are diagnosing the disease, Dr. Pushpa. If it is present, it cannot prevent. Pseudo carrier. A virulent organism. So it can transmit the organism, but nothing to worry. We will not develop any manifestation. Any manifestation. Index case. We are discussing FMG questions of last 10 years through this revision program. No, index is not primary case. Yes, Dr. Rohit is right. First case. Dr. Rupesh is also right. Rupesh Sharma is also right. First case coming to notice of investigator. First case coming to notice of investigator. Serial interval is interval or gap between dash and dash. Primary case, secondary case. Interval between two successive cases. Serial interval between FMG exam is 6 months. So two successive cases. Gap in between is known as serial interval. Serial interval. This is to remind you, no matter what, you have to clear the exam this time only. Do not think of anything else. Make a target. I have to score 200 plus. Easily you'll clear the exam this time only. Right? Okay. Read this question. This is, yes, influenza. Because 5 diseases do not show iceberg phenomena. Measles, rubella, rabies, tetanus, and plus minus pertussis. Which disease show best iceberg phenomena? Influenza shows very good. HIV shows very good. But best iceberg phenomena in India is shown by a disease like malnutrition. 50 to 70% population is mild malnourished. But we don't know because we don't have any problem. We don't even go for testing. All of you medical students go for testing. At least 10-20% will be mild anemic. But we never get it tested. So 5 diseases without iceberg phenomena are these. First type of epidemic. Sudden rise, sudden fall, clustering of cases in one incubation period. Red bar at the bottom. This is point sources of two types. This is single exposure point source epidemic. Single exposure point source epidemic. Point source is also known as common source epidemic. Compare it with this now. Here, no doubt, rise is sudden, but fall is interrupted by multiple peaks. Look at the bottom, multiple incubation period, because population is getting exposed multiple times. So this is multiple exposure from the same point source. Multiple exposure point source epidemic. These yellow lines are known as secondary peaks or secondary waves. These are known as secondary peaks or secondary waves. Third type of epidemic, slow rise, slow fall, propagated epidemic. Can you tell me quickly now? Bhopal gas tragedy is a type of single exposure point source, contaminated well, multiple exposure point source, tuberculosis, HIV. Tuberculosis and HIV, friends, will be. Yes, Dr. Chirag is right. Dr. Rohit is right. Propagated. Yes, Dr. Pragya Paneri is also right. What about HIV through a commercial sex worker? Another question of your exam. Where should I mark? Multiple exposure point source. Right? Which type of epidemic you have to create in upcoming FMG exam? सिंगल एक्सपोजर, एक ही बार में सबको क्लियर करके बाहर निकल जाना है. लेट नेशनल बोर्ड बी सरप्राइज दिस टाइम. सो सिंगल एक्सपोजर पॉइंट सोर्स, मेजॉरिटी अक्कर विद इन अ स्मॉल टाइम फ्रेम. मेजॉरिटी अक्कर विद इन अ स्मॉल टाइम फ्रेम. गुड. Read the question. Examiner is using Chat GPT to make your questions. Don't worry, read the question calmly. Focus always on the last line. That is the actual question. Onset of symptoms is indicated by which of the following? A, B, C, or D? This is such a easy question. Clinical disease is here, subclinical is here. Onset of symptoms marks the onset of clinical disease. C is the answer. What is this diagram known as? What is this diagram known as, friends? Natural history of disease. Progression of a disease without any intervention. You are right, Dr. Vadir, but let's hope. Right? Natural history of disease. Right. Now, this is a calculatory question. Incidence is given by the formula new cases divided by total population at risk into 1000. Prevalence is total cases upon total population into 100. Do not simply mark the answer. Do not simply mark the answer just based on your memory. Even if you know the answer, take 30 seconds to calculate the answer on the rough sheet you are having with you. I want you to calculate this answer manually, even if you know the answer. I will give 30 seconds break to my throat, but I want you to calculate this correctly. Please calculate. रफ शीट एग्जाम में नहीं होगी, but I want you to comprehend the formula. That is why I am writing like this. Okay, let me start with you. Incidence is total population at risk, 10,000. In this year, new cases which developed, 20 in 2000. So this is 2 cases per 1000 population. Prevalence is total cases. Total cases are 100 were having the disease earlier, old cases, 20 develop new out of 10,000 population into 100. So that is 120 upon 10,000 into 100. 1.20 2%. So let us look at the answers. 2 per thousand, 1.2%. So 1.2% is 1.2 by 100, 0.012. Yes, Amitabh Bachchan's family is roaming around. Amitabh Bachchan is here. Rekha ji is here. Jaya Bachchan must be hiding somewhere, right? So this is 2 per thousand incidence, 1.2% prevalence you have to remember. 1.2%. Friends, in exam, I know you have a problem that you don't have the rough sheet, but examiner has given you online calculator. He's taking advantage of that. Yes, I deliberately avoided one thing. Please remember, when you are calculating incidence or prevalence, cure deaths do not make a difference. But still, I have calculated one thing wrong. Can you tell me? See, incidence for that year is how many new cases occurred that year. Whether they cured or died later doesn't matter. But 20 recorded cases in that city that year. Old cases plus new cases. If 100 of them were already old, they cannot be in the denominator. Technically speaking, this number should have been 10,000 minus 100 older. But I avoided it so that you don't get confused in the paper. Total population at risk was only 9,900. Prevalence is a proportion, multiplier is 100. Incidence is a rate, multiplier is 1000. This is clear to everyone? Yes. Okay, so let's move forward. Screening. National health programs. What is the diagnostic test of TB? You have to mark one answer. Listen to my question carefully. You have to mark one answer. Good. It is sputum smear, acid fast bacilli, Zn stain. Pulmonary tuberculosis is the most common TB in the country. What is the second most commonly used test? If you are asked multiple response. Sputum smear, number one, microscopy. Number two is CB-NAT. Cartridge based nucleic acid amplification test. Malaria. Diagnosis in the country. Peripheral blood smear. What is the name of the stain that we use in Indian program? Yes, Dr. Karthik Agrawal is right. Jaswant Singh Bhattacharya stain. Yes, Dr. Anuj Sharma, you are also right for TB. Jaswant Singh Bhattacharya stain. We are also using rapid diagnostic kit, HIV. What is the major test for diagnosis under National AIDS Control Program? One test is mainly used. Western blot assay. DNA based, RNA based, protein based. Dr. Ishant Goel is also right. Dr. Jiraya, Dr. Lakshita, Dr. Rotavirus is also right. Rotavirus has joined the class. Okay. HIV, what is the screening test in India? Direct questions are asked in your paper. They'll make lengthy question, but at least. ELISA is again correct, but may be wrong because answer could be all of the above. Dr. Catherine has given correct answer. ELISA rapid simple. Three tests are used. ELISA rapid simple, known as ERS battery. Breast cancer screening. I want only one answer. Only one answer. Mammography. Young females. I want one answer. Breast cancer screening. Young females. I want one answer. Ultrasound is galat. Wrong answer. MRI is the most sensitive test. MRI is the most sensitive test to detect breast cancer in younger females. Ultrasound is a second best option in developing countries like India. Cervical cancer. I want one answer. You have to mark only best answer. Again, pap smear is a wrong answer. This has already been asked in your papers also, friends. We cannot go wrong. Wire test. Better test. More cost effective. developing countries can be done at subcenter PHC level. We are actually doing at subcenter PHC level. No doubt, pap smear is also done. But if they ask you which is the test of choice, it is visual inspection of cervix with 5% acetic acid, not pap smear. Please be very careful. Dr. Paresh Chaudhary is right. Can you identify test, disease, cutoff? Test, disease, cutoff. Disease is diabetes. Test used is oral glucose tolerance test. And what is the cutoff? At 2 hours, if value is more than 200 milligram per deciliter, this is venous plasma or capillary value. 200 milligram per deciliter is venous plasma or capillary glucose. This is venous plasma glucose. Good. Look at patient number 1, patient number 2, patient number 3, who will be diagnosed as diabetes in this three cases. Yes, this is diabetes because this is the cutoff. Above this at 2 hours, diabetes. Below this is non-diabetes. How much oral glucose is taken? How much oral glucose is taken for OGTT? 75 grams of oral glucose. Dr. Anuj Sharma is right. Dr. Chiranjeev Malik is also right. Okay, let me mark it A. Okay, not ABCD, it's already written. 1, 2, 3, 4. This is final critical point. This is disease onset. Can you tell me which of them is lead time? Can you tell me, friends, which of them is lead time? 1, 2, 3, 4. Please be very careful. Many of you are writing 2, many of you are writing 3. You have to look at the image very, very carefully to mark the correct answer. Which of them is lead time? Many are saying 4 also. Friends, how it is possible? What is lead time? If you don't use screening test, person will be diagnosed later. Usual time of diagnosis. With screening, how much earlier you can detect? Answer is 3. Without screening, you will detect later. With screening, how earlier you can detect? That is lead time. What is 1? What is 1? Yes, good. This is screening time. Yes, Dr. Ajit Singh, Dr. Sachivji is also here. Dr. Abdul Moiz is also correct. Also correct is Dr. Pragya. But friends, many of us are mixing the answers. Please be careful. Lead time is without screening. When will you detect? With screening, how much you can detect earlier? How much you are leading the time of diagnosis of the disease, detection of the disease. Which cancer has highest survival after screening? Which cancer has highest survival after screening? That is colonic cancer. Highest 5-year survival rate is with colonic cancer after screening. Familial adenomatous polyposis. Dr. Akansha Singh is right. Dr. Monica Rawat. No, Dr. Leo, papillary nahi. Papillary to it's not good. Colonic cancer has more than 95% survival. Dr. Rohit is right also. Now, friends, when we look at screening test table, you tell me if I write A, B, C, D, is this correct? Dr. Anush Sharma is correct. Is this correct? A, B, C, D. No. What is wrong in this? What is wrong in this? Yes. A, B, C, D. Now, when the table comes to you in the exam, examiner will not write true positive, true negative, A, B, C, D. Numbers will be written. You will have to think in your mind. You will have to think in your mind. Then online calculator comes into picture. HPV DNA is not in the program. HPV DNA is not in the program. Indian program, VIA is the better test. It is used in National Cancer Program. Sensitivity, A upon A plus C into 100. Specificity, D upon B plus D into 100. Positive predictive value, you tell me by writing in the chat box. Let us see how many of us can remember correctly. Dr. Abdul is correct. Dr. Chirag is correct. Rotavirus, Doremi, Vedangi is correct. Pavan Kumar, Amitabh Bachchan, Rekha Amitabh Bachchan, Dhania is also correct. आसिफ, पेंगुइन, सचिव जी, कैसे कैसे नाम रखे हुए तुम सबने. ऑल ऑफ यू आर करेक्ट. गुड टू सी. इट इज ए अपॉन ए प्लस बी इंटू 100. YouTube is slightly streaming of YouTube is around 10 seconds behind the app. Therefore, in on YouTube, Ishant Goyal is correct. Dr. Anuj Sharma is also correct for positive predictive value. Negative predictive value. Now, some of you are using genuine names. Negative predictive value is D upon C plus D. Exam will not give time more than this. In 1 minute, you have to read question, understand कि examiner पूछना क्या चाहता है, remember the formula in your mind, calculate using calculator, remember God, mark the answer. Everything has to be done in 60 seconds, rather before 60 seconds. So you have to be very, very fast in the paper. Formula should be on your tips. In exam, you cannot take 30 seconds to memorize the formula. 5 seconds to remember the formula and move forward with the answer. Which of them is usefulness of a screening test? Which of them is diagnostic power of a screening test? Usefulness, sensitivity, diagnostic power, positive predictive value. Yes, YouTube also almost 90% students are giving correct answer. So cerebellum, YouTube, you have to give 90% result minimum in the actual exam also. Now, I told you sometimes it happens. Examiner thinks we are superhuman. Without having a rough sheet, we can calculate with calculator only. This was actually one such difficult question. It is not me. It is your examiner who gave such a question. We cannot help it. So can you quickly mark the answer? What is the answer? Sometimes you know the answer. That is the best scenario. Then we will solve the question. Yes, good. Everyone knows the answer. Are you sure in this question I have not changed the values? You have आपने रट लिया, I know. But are you sure I have not changed any value in the question? Yes. So let us see how to solve this question. Disease present, disease absent, screening test positive, screening test negative, A, B, C, D. In this question, you have to make the format of table in your mind. In your mind, you have to remember A, B, C, D in your mind. Everything is in your mind. I don't know why examiner asked this question. Total 2000 patients were assessed, but 200 were diagnosed positive. That means only 200 were having the disease, 1800 were not having the disease. Read the second statement. 260 came positive, 130 only had the disease. These are your positive. Total positive 260, out of which 130 had the disease. This is given in the question. All other values you have to calculate. Look at A and C. A is 130, so C has to be 70. Look at B for Bombay. A is 130, so this will be 130. D will be 1870. Specificity. Now your calculator will come, but you will have to reach this stage. Now your calculator will come, but for that you will have to reach this stage, 1670. So 1670 upon 1800 into 100. That will come 92.77%. Right? How many of you can solve this question mentally without using a rough sheet? If they change the values to 450 and 120, none of us can calculate. So either you are superhuman or you know the question which is going to come in the FMG paper. You already know, please share it with everyone, right? Okay. So 93%. Can anyone tell me what is the sensitivity of this test? Let us see how many of us can mark this answer. What is the sensitivity of this test? Anyone? So what is the answer? I want answer. Amitabh Bachchan and Rekha ji all both are answering together. What is the answer? It is 65%. 130 upon 200 into 100. What is the positive predictive value of this test? ये तो आपको you don't even need calculator for PPV. PPV you don't even need calculator. Yes, A upon A plus B into 100. So that is 50%. So I am telling you, please be careful. This time, same question. Examiner can ask you sensitivity or PPV. Do not be in a hurry to mark 93% कि मैंने तो रटा हुआ है. You have to look at the question also. Is he asking specificity, sensitivity, or positive predictive value? Positive predictive value is more easy to calculate. He can ask you that question this time, right? So be careful in the exam also. Good. Dr. Anuj, Dr. Aditya Naval, you are calculating correctly. Dr. Sumitra Devi, also you are correct. Okay. One of the student on YouTube is using his name as Narakka Dwarpal. नेशनल बोर्ड के द्वारपाल हो क्या? ओके, व्हाट इज दिस? व्हाट इज दिस? व्हाट इज दिस? यस, दिस इज सीबी नेट, cartridge based nucleic acid amplification test. Older name is actually mentioned on the diagram. Gene expert MTB rift test. Gene expert MTB rift test. It has two uses. It has two uses in public health. YouTube students, please don't get hassled. Me and students keep on joking throughout the class because reactions are on in the chat box, right? So don't get hassled. CBNAT has two uses. One is diagnosis of tuberculosis and diagnosis of rifampicin resistance. Second best test. Okay, can you tell me in which situation CBNAT is the best test? In which situation CBNAT is the best test? No, I'm not asking TB or rifampicin resistance. I'm asking which type of TB patient. Yes, if it is a extra pulmonary case, then pulmonary lungs will be of no use, sputum will be of no use. Extra pulmonary cases, CBNAT becomes the method of choice. Method of choice, right? Starve your distractions, feed your focus. How many days are left for the exam, friends? How many days are left? 5 days. 5 days, many of your friends will try to make sure you fall into FOMO. Delete your friend till last minute of the exam. Sixth day, you can talk to your friend. Do not listen to anyone कि तूने ये नहीं किया है, ये नहीं किया है, वो नहीं किया है. Whatever you have done is sufficient. Just next 5 days, keep on revising everything. Keep on practicing questions. Actually, you have to keep yourself busy. Whatever can keep you busy and you can revise maximum fastest, that should be done. Yes, this is a photo of seagull I took in Australia few years ago. Focus like this. Till the last minute of the exam, carry your focus inside the examination hall. You have come so far not to come only so far. इतनी मेहनत की है. You have to deliver in the exam also, friends. Please remember. Communicable diseases. Rekha ji, Amitabh Bachchan, stay more than 1 meter away. Interperson distance for respiratory diseases to transmit is 1 meter. Older FMG question. What is the droplet size for respiratory infections, friend? Ideally, for better transmission, it should be less than. No, 0.5 is wrong. Many of you are confusing it with pneumoconiosis. I am not saying pneumoconiosis. Respiratory infections transmit maximum if particle diameter size is below 5 micron. Please remember for pneumoconiosis it is 0.5 to 3 micron. Two things we cannot. Two things we cannot. No, Dr. Bhavna, what has not been asked in FMG will not go into those topics. Pathfinder survey index group calculations. Never asked. Never asked. Right? So this is less than 5 micron diameter. Inter-person distance less than 1 meter makes respiratory infections maximum chances of transmission. Right? Incubation periods. Let us see how many of us can remember. COVID-19, 1 to 14 days. I'm writing you, revise with me. If it is not in the choice, 5 to 6 days. If they ask you a single answer, median value, 5.1 days. Influenza, 18 to 72 hours. Diphtheria and yellow fever are same, 2 to 6 days. What is the quarantine period of yellow fever, friends? Yellow fever. Maximum incubation period 6 days. 6 days. Good. Dr. Anuj Sharma is right. Cholera 1 to 2 days. Hepatitis A 15 to 45 days. 2 to 6 weeks. Hepatitis B 45 to 180 days. 6 weeks to 6 months. Measles 10 to 14 days. In one of your FMG questions, they gave choices like this. What is the single best answer for 10 to 14 days? What should I mark? 10, 12, 14, 16. Different answers we are getting. Friends, all other diseases, it is a range minimum to maximum. In measles, it is not a range of minimum to maximum. On 10th day, fever starts. 14th day, rash starts. Incubation period is appearance of first sign or symptom. PYQs you have to see in this question, majority of students both in the app and YouTube have marked wrong answer. 10 days is the correct answer we have discussed in the class. Please be correct, friends. Dr. Shruti is right. HIV, which ranges from months to years, median incubation period was asked is 10 years. Median incubation. What is 8th day disease, friends? Anyone? Older FMG question. Which disease incubation period is 8 days? Yes, be more correct, Dr. John. Be more correct. Neonatal tetanus. Same question asked in FMG in different language. Which of the following disease cannot manifest on first day of the life of newborn? Neonatal tetanus. First symptoms appear on 8 days. Other choices were jaundice. Jaundice can appear on first day. Right? So please remember neonatal tetanus is known as 8th day disease. Possibacillary leprosy, how do I diagnose? How many drugs are used in treatment? What is the duration of treatment, duration of follow-up? So diagnosis, drugs, treatment, follow-up. Can you quickly tell me these answers in a single message in the chat box, friends? It diagnosis is done by 1 to 5 skin lesions. Drugs we use are 3: Dapsone, rifampicin, clofazimine. 6 months treatment, 2 years follow-up. More than 5 skin lesions, multibacillary leprosy treatment. 3 drugs, 12 months treatment, 5 years follow-up. Leprosy is most commonly classified by using which classification? Leprosy is classified by using which classification most commonly? That is Ridley-Joplin. It is a type of immunohistological classification. It is not clinico-bacterial. It is not operational. So I'll repeat. Ridley-Joplin classification most commonly used. It is a immunohistological. 5 types are there. Which is most common in India? Most common subtype of leprosy in India is borderline tuberculoid. Nerve involvement is 0 hair, minimum 1 hair. As per the new guidelines of 2025 April, Possibacillary zero nerve, multibacillary minimum one. Ulnar is the most common nerve involved. Cord-like thickening. Cord-like thickening. What is the definition of MDR TB? Resistance to both two most important drugs, HNR, XDR TB. First, you have to tell me what is X. Extensive, extensively, extreme, extremely. Such idiotic questions also come, but you have to mark the answer. Extensive, extensively, extreme, extremely. This is extensively drug resistant tuberculosis. Extensively drug resistant tuberculosis. It includes MDR TB, H&R plus anyone fluoroquinolone, ciproflox, ofloxacin, sparfloxacin plus anyone second line injectable out of kanamycin, amikacin, capreomycin. Now this definition has been expanded to include linezolid and bedaquiline also. So kanamycin, amikacin, capreomycin, linezolid, bedaquiline, any one of these resistance is also included. All three should be present. MDR, fluoroquinolone, and second line injectables. Good. All of you have marked this answer correct across the platforms. Is this correct that this is chickenpox and this is smallpox? Please look at the image carefully. Is this correct? No. What is wrong? It should be interchanged. So I focus on chickenpox. It has got three important properties of its rash, which are asked in your paper. Number one, as you can see in the image, it is centripetal. This one is chickenpox. Look at image number 2. This one. Dewdrop on rose petal appearance. Characteristic of chickenpox vesicle. And number 3, it shows pleomorphism. Please be careful. It's not polymorphism. Pleomorphism. What is pleomorphism? All stages of rash seen on same person's body at the same time. At the same time. Right? Okay, good. Can you identify what is shown in the image? That will help you make a diagnosis of the disease. Yes, this is Koplik spots. These are bluish white. These are bluish white raised projections. Where they are located in the oral cavity? Yes, opposite second molar. Pathognomic clinical feature of measles. Why they are not seen in clinical practice? Yes, Dr. Webhav is also correct. Dr. Shubh is also correct. Why they are not seen in clinical practice? Because they disappear 2 days prior to appearance of rash. See, mother will notice something is wrong in child only when rash appears, but by that time they have disappeared. Most common complication of measles. Most common complication of measles is serous otitis media. Least common complication. Older question of FMG. Least common complication. Subacute sclerosing panencephalitis. It is very rare also. Subacute sclerosing panencephalitis. Most common cause of death in children of measles. When we look at India, measles causes highest deaths among all the vaccine preventable diseases. Pneumonia, wrong answer. Meningitis, wrong answer. Dr. Chandrasekhar has given correct answer. Secondary bacterial infections. Number 1. Pneumonia is second most common cause of death in measles. So please be very careful. If secondary bacterial infection is mentioned in the choice, like Dr. Neeraj has marked correct answer, you have to mark correct answer. It's not in the choice, then go for pneumonia. In pneumonia also, pneumonia never kills the child. It is the secondary bacterial infection over pneumonia which kills the child. Which kills the child. Yes, it is associated with cold coryza. Rash starts behind the ear pinna. Then it comes to face. Then it comes lower towards the body. Retroauricular origin of rash. Diagnose the disease. What is the most common complication? This disease is mumps. Why you are saying mumps? Most common body part affected is salivary glands, especially parotid. Most common complication of mumps. Yes, many of you are writing correctly. Orchitis is a wrong answer. Orchitis is in adolescents. Mumps is mainly a disease of children. Aseptic meningitis. Please be very careful, friends. I'll again repeat. Overall, most common complication of mumps is aseptic meningitis because this is a disease of children. When it affects adolescents, then orchitis in males, oophorytis in females. So please be very careful. Overall, it is aseptic meningitis. Vaccine strain. Yes, all of you are right. Gerilin strain. Vaccine strain is Gerilin strain. Dr. Ruku T9F is also correct. Can you make a diagnosis of the disorder first? Then we will discuss. This is congenital rubella syndrome, which is characterized by a classical triad: sensory neural deafness, heart defect, patent ductus arteriosus, cataract. What is the first priority group of this vaccination? If you have to suppose pick up one group in the country to give rubella vaccine today, which group will you pick up? Yes, it cannot be pregnant females. No, that is not correct. Because pregnancy rubella live vaccine is contraindicated. You have to give it, not adolescent girls, prior to pregnancy. So that is known as non-pregnant, non-lactating, reproductive age group females. So please be careful. It should be given to all the females, but first priority group is non-pregnant, non-lactating, reproductive age group females. Let me ask you a very old question of NEET PG. If a non-pregnant female has taken rubella vaccine today, for next how much time she should avoid pregnancy? If a non-pregnant female has taken rubella vaccine today, for how long she should avoid pregnancy? Okay, this is surprising. Everyone is saying 1 month, which is actually not correct. It is minimum 2 months. Many literature even mentions 3 months. So minimum 2 months or 8 weeks pregnancy should be avoided. Should be avoided. What is based on Indian guidelines in the program? Okay, if Dr. Anna ma'am has told, let's go by gynae ops. That is more likely to be accurate. So avoid pregnancy ideally for next 2 to 3 months according to Indian documents. Maybe in the corporate sector they have changed it to 1 month, right? Okay. Gynae ops wants deliveries to take place non-stop, right? Okay. So this is non-pregnant, non-lactating, reproductive age group females. I'll discuss this question with Dr. Rana ma'am as well. Identify disease, stain, classical appearance which is visible in the images also, friends. Images also, friends. Yes, disease is diphtheria. Stain is Albert stain, which gives green color. And what is the classical appearance, anyone? Dr. Anuj, Dr. Mangesh, Dr. Rupesh Sharma. Yes, it is Chinese letter cuneiform arrangement. X form, V form, L form. What is the immunity status test? Yes, Dr. Ishant Goyal, Dr. Pragya Paneri is also correct. Schick test, Dr. Rohit is correct. Dr. Rahman is also correct. सबके फेक नेम्स हैं आज. Chinese cuneiform. Please appear in the FMG exam with your real names, right? Okay. Diagnose the disease. What is the stain? What is this appearance? You cannot do mistake in this because it has been asked multiple times. Very right. Tuberculosis, Zn stain, acid fast bacilli, which have a classical beaded appearance. And this is beaded appearance due to mycolic acid pockets. Montu test, immunity status test for tuberculosis. Can you mark these answers without a mistake? Antigen, purified protein derivative. How much is the dose? All these are former FMG questions. 1 tuberculin unit in 0.1 ml. Very carefully read the choices. 1 TU, zero point 0.1 ml. Strain. We are not asking BCG. Don't say Danish 1331. We are asking purified protein derivative strain. That is RT23 with tween 80. Reading is taken after 72 hours. More than 9 millimeter positive, infected. Less than 6 millimeter, never infected. Type of hypersensitivity, this is fourth type. Delayed hypersensitivity. Delayed hypersensitivity. Just a second. This is delayed hypersensitivity. Type 4 you have studied in pathology as well as microbiology, right? Okay. Make a diagnosis of the disease and then you tell me based on which appearance you made this diagnosis. This is mucormycosis called as black fungus. It's not boyfriend black fungus. Its classical appearance, what you can see is a septate hyphae branch at 90 degree. And what is the characteristic appearance? This is known as anyone. Yes, Dr. Mangesh Kumar has answered correctly. It is antlers on moose appearance. Antlers on moose appearance. Drug of choice is, yes, liposomal amphotericin B. Which other disease in Indian programs liposomal amphotericin B is the drug of choice? Kalazar is correct. Great. CT will show mucosal thickening, bone erosion. MRI will show nasal turbinate sign. So in radiology, just have a look at Google search, do for MRI of mucormycosis nasal turbinate sign. CT shows mucosal thickening and bony erosions. Good. Can you tell me in hepatitis B serum markers, what is the sequence of antigens appearance? What is the sequence of antibody appearance? Antigens, surface, core, envelope, antibody, core, envelope, surface. Please check if I have marked correctly. Surface, core, envelope, surface. This is correct. Epidemiological marker is HBsAg. This is also known as HBsAg is also known as Australia antigen. Marker of infectivity, popular question of FMG, is E antigen. Why E antigen is the marker, friends? Anyone? Why E antigen is the marker? It indicates active viral replication. Yes, absolutely active viral replication. Good prognosis. If its antibody appears, anti-HBe, that means active viral replication has stopped. Now patient will recover. If anti-HBs appears, end of communicability also, vaccinated also, which is a marker of acute hepatitis B, friends, anyone? Which is a marker of acute hepatitis B, anti-HBC, but which type? IgM. Chronic is through IgG. Chronic is through IgG. Hepatitis B serum markers are frequently asked in the paper. Dr. Ishant, you are also right. Mark these questions very carefully in the exam. Okay. I think sometimes such easy questions come that students don't believe their eyes. Which is waterborne? Is A. Besides A, E is also waterborne. B, C, D are sexual, parental, blood and blood syringes. Yes, this time also you'll find 60 to 70% questions of the paper are going to be very, very easy. Can you tell me in ORS How much is sodium chloride, potassium chloride? 2.6 gram, 1.5 gram. Then we have sodium citrate 2.9, glucose 13.5, total is 20.5 gram. Medical discovery of last century discovered by Dilip Mahalanobis. ORS should be dissolved in 1 liter of water used within 24 hours. Sodium osmolar concentration 75 millimoles per liter. Potassium 20, citrate 10, chloride 65, glucose 75. 245 total millimoles per liter. In your FMG, these four values have been asked. You don't have the option of zoom. Otherwise, every answer is written on the image also many times. Right? So, this is ORS. Make a diagnosis of the disease, which is through penetration of skin of foot, larva migrans, hookworm. It is associated with which disorder? Iron deficiency anemia and low albumin also. Measurement index Chandler. Can you tell me what is Chandler index exactly? What is Chandler index exactly? Anyone? It is number of eggs per gram of community stool. Please be careful. It is not for one person. It is calculated as an average of the community stool. Cat-o-cats technique. Drug of choice, friends. What is the drug of choice? Even roundworm has the same drug of choice. L-bendazole. When do we have National Deworming Day? Older FMG question. National Deworming Day is on 10th February. Repeat round 10th August. Otherwise, it could be undertaken 10th date of any month. Two, you have to remember, important public health problem is above 300. Potential danger is 200 to 250. Chandler index makes it a major public health problem if it is above 300. Okay. Malaria control. Let us look at all the questions. Most sophisticated, best measure of malaria control. Answer to this question is annual parasitic incidence. Operational efficiency. How good your program is going on. Operational efficiency. This is through annual blood examination rate. How many slides you are preparing? Ideally, it should be minimum 10% of the all fever cases. Recent transmission. Most popular question asked recently also. It is infant parasite rate. Check for disease in infant's body. If it is present parasite, that means last 12 months it was transmitting. Endemicity, spleen rate. Degree of anthrophilism is a vector index. Anyone? What is the answer? Latest question. How much they like human blood? We find by human blood index. Cut down the stomach of Anopheles mosquito and find human blood to calculate human blood index. Degree of anthrophilism. So, five indicators which come from malaria program frequently. Disease, amplifier host, vector. Diseases. Japanese encephalitis good. Who is the actual host of this? Actual host is water birds. Ducks, fowls, herons. Ducks, fowls, herons. Amplifier host is pigs. If you look carefully, it's written also. Amplifier host is pigs. Accidental host. So man everywhere unnecessarily pokes his nose. Accidental host is man. Horses, cattle are mosquito attractants. Vector is frequently asked in FMG paper. Can you tell me the complete name? Dr. Rohit, Dr. Daisy is right. Culex tritinyorhynchus. Culex tritinyorhynchus. Good. Can you diagnose disease based on its geographical distribution shown in the image? This is a Distribution of Kalazar. Just to see how much you know, can I ask you, if I show a distribution like this, which disease are we talking of present in 70% of our country? 70% of our country. Japanese encephalitis, good. Can you tell me which disease is darkest present here? Highest color is present in East and Northeast India. East and Northeast. Malaria. Which disease will have darkest color in three northeastern states and South Indian these states? Three northeastern states and four states of South India. HIV. Great. So everyone knows, that is wonderful. Read the question. A person shifted his job from Nigeria to USA. He's going from Africa to USA. Which of the following certificate he needs to carry? 17D yellow fever vaccination certificate. Africa, right? वैसे तो in USA, if you are an immigrant, you don't need to carry anything. You just have to carry yourself. But it is 17D yellow vaccination certificate. Now, based on this, can you tell me yellow fever is which type of vaccine, diluent, strain, validity of vaccination certificate? Let's quickly go through this. Yes, good. Live attenuated, lyophilized. I'm looking at the chat box. Wherever you give maximum wrong answer, I'll slow down there. Diluent is cold physiological saline. You can call it saline also. Sodium chloride, cold physiological. Strain, very frequently asked. 17D. D is Dakar antigen units. Validity 10 days to lifelong. Incubation period 2 to 6 days. 6 days is the quarantine period. Quarantine was first applied for which disease? What is the meaning of the word quarantine? Quarantine was first applied for the disease plague, and it actually means 40-day detention. 40-day detention. Dr. Anush, Dr. Adarsh, Dr. Mangesh, you are right. Diagnose the disease. Can you friends diagnose this particular disease? Yes, trachoma. How did you identify? What are the identification features of trachoma? Sorry. Field diagnosis is based if there are minimum 2 out of 4 conditions. One is large follicles on upper tarsal conjunctiva. Second is these. What are these, friends? Herbert pits, limbal follicles. Third is scarring. Fourth is pannus formation. Any 2 out of these 4, even a medical officer of a PHC can diagnose. Can you tell me the drug of choice? It is single dose azithromycin 20 milligram per kg. Can you tell me what is the status of trachoma in India along with the date? Trachoma was eliminated on. Can you tell me the date, friends? Because it was the last disease to be eliminated, they can definitely ask you. 8th of October 2024. Can you tell me what is the major clinical differential diagnosis of trachoma in India? Major clinical differential diagnosis of the question. Dr. Shizuka is right. Vernal keratoconjunctivitis. You have to differentiate from trachoma. किस में रोपी डिस्चार्ज होता है, किस में नहीं होता. So trachoma versus vernal keratoconjunctivitis, you should definitely know. What is the prevention and control strategy? I know I'm asking very fast, but I want to cover as much as possible. Is safe strategy. Can you tell me in safe strategy, surgery is done for which 2 conditions? In safe strategy, surgery is done for which 2 conditions? It is trichiasis and entropion. Trichiasis and entropion. Now comes a question which always comes in your exam. So safe we know, surgery, antibiotic, face wash, and environmental modification. Type of wound for tetanus immunization. You divide wound into two categories. Less than 6 are clean wound, more than 6 are dirty wound. Then patients also are divided into four categories A, B, C, D. A. Last 5 years you have taken either complete course or booster. You took it 5 to 10 years. More than 10 years, never taken, not remember. You have to remember. Now let us go through. Category A wound, where if you have taken either vaccine or booster in last 5 years, don't worry, nothing else is required. So even if someone gets an injury today, last 5 years he has taken booster or the complete course, don't do anything, simply wash the wound, take antibiotic, that's it. But if it is 5 to 10 years, then you require one dose of TT in both type of wounds. Learn systematically, you will never forget. If you took it more than 10 years ago, clean wounds, one dose of TT is sufficient. But dirty wounds, it is better to give additional protection through tetanus immune globulin. But if more than 10 years or you are no idea whether you took vaccine sometime or not, tetanus toxoid complete course here along with tetanus immune globulin. Can anyone tell me what is complete course of tetanus? Anyone? Because that may be asked, what do you mean by a complete course of toxoid? Dr. Rohit has answered correctly. Dr. Davis also has answered correctly. It is two doses 1 month apart. Two doses 1 month apart. Please remember. So complete course, like we do in pregnancy also. Two doses of tetanus diphtheria TD, two doses 1 month apart. Read the question. This is bathing is not done. Can you tell me what is the prevention and control strategy for tetanus known as? Like you told me, for trachoma, it is safe strategy. What is the prevention and control strategy for tetanus known as? Okay, take a screenshot. Take a screenshot of this. If you are not able to write, please take a screenshot. Otherwise, video will remain in the app. We will give you annotated PDF like always. We have already shared the unannotated PDF also. Yes, this is known as 5 cleans strategy. Now, 5 clean strategy, can you tell me includes what? This includes clean hands. Hands is of mother or the newborn. Clean hands is mother or the newborn. This is how examiner tricks you. I gave you two choices. Everyone is marking mother. No, it is clean hand of the person who is conducting the delivery. Doctor or the person who is conducting the delivery. Clean surface. So can I say clean cord surface? Can I say this is clean cord surface? एग्जाम में पूजा नहीं होनी चाहिए राइट सो क्लीन कॉट सरफेस इज नॉट दिस इज क्लीन डिलीवरी टेबल सरफेस क्लीन डिलीवरी टेबल सरफेस देन क्लीन कॉर्ड कट क्लीन कॉर्ड टाई clean cord stump. Cut it with a sterile blade or scissor. Tie with a sterile rubber band, or nowadays clips are also there. Clean cord stump. Nothing should be applied if possible. It has now been expanded to become 7 cleans. We have added clean water and clean towel. What is this clean water for? Who will drink this water? No one will drink this water. This is for baby. बेबी को वॉश करके न्यूनेटल टेटनस कैसे रुकेगा? दिस इज फॉर वॉशिंग द हैंड्स ऑफ द डॉक्टर और द पर्सन हु इज कंडक्टिंग द डिलीवरी. क्लीन टॉवेल. What is the use of clean towel? What is the purpose of clean towel? For mother. Wrapping the baby. बेबी को रैप करने से टेटनस कैसे रुकेगा? This is for mopping dry the hands of person who is conducting the delivery एग्जाम में जरूरत से ज्यादा नहीं सोचना है. क्वेश्चंस आर सिंपल, लॉजिक इज सिंपल, स्टे ऑन लॉजिक. Tetanus you cannot prevent by washing the baby, bathing the baby, it's not recommended. Tetanus you cannot prevent by wrapping the mother or newborn in towel. It is for mopping the hands clean, dry, for conducting the delivery. Right? Okay. STD color coded kits. First you check, is it in correct sequence or should I interchange two of them? First check, is it in correct sequence or should I? Chalo, good thing is app also, YouTube also. Students are answering same answer. Wrapping the baby, mopping the baby. Please think logically in the exam, friends. Yes, this sequence is correct. Gray, green, white, blue, red, yellow, black. Any mnemonic you can remember? Gray, green, white, blue, red, yellow, black. 8 is missing. We'll come to 8 later. First is gray. Here we have discharge, cervical discharge, urethral discharge, anorectal discharge, and scrotal swelling. 2 is green frothy vaginal discharge, trichomonas. White, blue, red, genito-ulcerative disease 3 and 4 are non-herpetic. 5 is herpetic. What is the difference between 3 and 4? Drugs you don't have to remember. What is the difference between 3 and 4? Fourth is allergic to penicillin. Sixth is lower abdominal pain, PID. Seventh is inguinal bubo black. Now, eighth brown has come, which is now taken separately. Which one? Eighth brown, yes. Anorectal discharge into a different category. Mostly drugs used in these kits are cefixime, doxycycline, and azithromycin combination. Drugs have never been asked till today. Till today, never drugs have been asked. Only number of the category or the color of the category has been asked. Genito-ulcerative disease, blue color is which category? Number 4. Lower abdominal pain in a woman, yellow colored kit. This is how question. If you have learnt nothing like it, if you have learnt, let's hope it comes this time then. STD color coded kits are based on which treatment approach? STD color coded kits do not have lab test. Clinical presentation helps you decide. Syndromic approach. Where will STD color coded kit be available? A patient comes to your clinic today. Where will you send the person? Older question of FMG. Suraksha Clinic. New name of STD clinic. Can you tell me the level of prevention of the disease? Level of prevention of the disease. This is secondary. Good. Can you identify the program? Then I will ask you the question. This is the logo of, it's written also TB. So you cannot go wrong. National TB Elimination Program. TB Mukt Bharat. Tagline is TB harega desh jeetega. Launched on 1st of January 2020. One day before 31st December, China gifted COVID to this planet. So program suffered a setback. Although we wanted to eliminate by preponing the target date to 2025. But now 2025 is over, right? We have to reduce incidence by 80%, mortality by 90%. In dots, no, it's not achieved. I think another 3 years may be required, so they'll change it to 2028. In dots, what is S? What is S? What is S? Short course is correct. It's not surveillance short course. Can you make a diagnosis of what is shown in the image? I'm looking at the chat box. Your answers come right. I move forward. This is CBNet. If you see Gene Expert MTB Rift test, second most commonly used test for diagnosis of TB in the country. It is the primary test in extrapulmonary tuberculosis. Okay. ICT based surveillance system. ICT based surveillance system is Nikshay. Why not DOTS 99? Why not DOTS 99? It is ICT based Adherence system, very good. Mobile number based free call. Why not Nishchay? Nishchay is totally unrelated to this program. It is a urine based pregnancy testing kit. Right? These all have been asked in the exam. We have to be careful. So, first one is DOTS 99 adherence system. After taking the medication, give a missed call which is toll free, and the number will come on the blister packet when you take out the tablet or the capsule, right? Second one, Nikshay, is the ICD enabled surveillance system. It is a software which monitors all DOTS clinic in the country. Based on Nikshay's success, we have launched Nikusht. If you check carefully, Hindi, Kshay Rog is tuberculosis, Kush Rog is leprosy. So answer lies in the word itself. No, they do not get money for calling. Otherwise, they'll keep on calling day and night, right? This is just to tell them that you have consumed the medication, you have to inform to the system also. What is the definition of blindness? In Indian program and WHO, it is same now, less than 3 by 60. Can you tell me most common cause of blindness, which is same as low vision and visual impairment in India? It is cataract. I'm going faster because here it is facts mainly. But ocular morbidity, uncorrected refractive errors. Prevalence of blindness in India is 0.36%. Visual impairment, they will not ask, 2.55%. This is the logo of National Program for Control of Blindness and Visual Impairment in India. Can you classify this person? Categorization is in front of you. 5 categories of visual impairment, now known as number also. Number 1, 2, 3, 4, 5 categories. Yes, LESMA. We have low vision, economic blindness, less than 6 by 60 to 3 by 60. Social blindness, less than 3 by 60 to 1 by 60. Manifest blindness, less than 1 by 60 to perception of light present. And absolute blindness. Perception of light is absent inside the building of national board. So that is absolute blindness. Economic blindness is work vision. Social blindness is walk vision. Now can you look at this question on the right side? Which is better eye? Because it is always in better eye, best possible correction. Which is better eye, friends? Right eye or left eye? Look carefully. Left eye is better. So this is a case of economic blindness, work vision. So left eye is less than 6 by 60, which is a better eye. So this will be a case of economic blindness. Always look in better eye. See, logically think. A person cannot see from one eye, only see from one eye. If he can see from one eye, he can see. So always look at better eye for deciding any cutoff, logically also. HIV become first case was found in 1981, Donald Trump. So USA was the country where first case was reported. India 1986, Chennai was the first city. Tamil Nadu became the highest number of cases. INI-CT question may come in your paper. When was HIV virus discovered? HIV virus was discovered in which year? Year was asked. Even INI-CT ask you years. Good, all of you know. 1983, Robert Gallo, Montagnier Sinossi. 3 people discovered. Robert Gallo must have done some cheating because Montagnier Sinossi got the Nobel Prize for that. Route of transmission, most common, is least efficient. That is sexual route. Whereas most dangerous is least common. That is blood. This is the paradox you have to remember. Can you tell me, besides HIV, which other 5 diseases are screened in a donated blood unit? Again, FMG question. Yes, HBV, HCV, And malaria is correct, syphilis is correct. So five diseases are detected. Which level of prevention this is? Which level of prevention this is? Yes, primary specific protection. It is not for donors benefit, it is recipients benefit. This is which type of screening? I know I'm jumping between the topics, but I want you to be fully prepared. Good. It is prospective screening. Prospective screening, all of you are right. Can you tell me, if you look at HIV, don't look at the slide, we have high risk group, bridge population, general population. Question was, truck drivers are high risk group, bridge population or general population? Yes, those are bridge population. So high risk group will include sex workers, homosexual men having sex with men, injecting drug users and traffic women. General population we know, those who are not directly in contact with HIV, women, children, youth, men. How they reach from high risk to general is to bridge. So logically, we have clients of sex workers, partners of injecting drug user, migrant laborer and truck driver also through commercial sex worker, population in conflict act as bridge population. Any PYQ repeated, doing it wrong is a blunder. You cannot do PYQ wrong. Your paper will be mostly based on PYQs this time also, 50 to 70% of the questions. Which type of testing is done? Which type of testing is done for HIV in National AIDS Control Program? Opt in, opt out, either of the above, none of the above. It is opt out. You take the sample, then tell the person we will test for HIV. He can now opt out. I'm telling you a sentence. Tell me true, false. In opt out HIV testing, there is no requirement of consent. True, false. In opt out, there is no requirement of consent. True, false. This is false. In India, you cannot do HIV testing without consent. Consent is there because after taking the sample, you are telling the person that, do you want to get tested now? I have already taken the blood sample. He can now say no also, right? So consent is always required. It's not like national board that they can increase fee without your consent, right? Consent is always required. Most common opportunistic infection in world, pneumocystis carinii pneumonia. India is tuberculosis, followed by candida, followed by pneumocystis carinii. Pneumocystis carinii is known as pneumocystis xerovasi pneumonia nowadays. ART is initiated at which? ART is initiated at which CD4? Any CD4. ASAP. So whenever a person is diagnosed today, start ATT, ART today. Mother to child transmission. Currently, the modality of choice has been triple ARV prophylaxis. Can you tell me which three drugs are used? More than 90% efficacy it carries. It is lamivudine, tenofovir, efavirenz. If efavirenz cannot be given, we give lopinavir, ritonavir. Post-exposure prophylaxis. What is the regimen? When it is started, how long it should be given? Post-exposure prophylaxis. Lamivudine, tenofovir, dolutegravir. Very right. It should be started ASAP within 2 hours, maximum within 72 hours. And how long you will give it, friends? How long you will continue? Yes, 28 days. Good. We are going faster because we have to cover everything. National vector-borne. Can you identify the mosquito? This sitting at 45 degree on the surface of your body is national board female anopheles, right? Malaria. What is the serological antigen for diagnosis? What is the serological diagnosis of malaria based on? Good. Histidine rich protein type 2 Plasmodium falciparum antigen. Dengue, a unique test which can come positive in first 3 days also. Dengue, NS1 antigen. Kala Azar, Kala Azar, older FMG question. Reverse kinesin, 39 antigen. Good. All of you know the three different questions of your exam. Very nice. Which of the following drug is not used for uncomplicated malaria? A question many students attempted wrongly. You have to attempt correctly. It is mentioned in the program. Artemisinin derivatives should never be given alone. It is always in a combination. ACT-SP for other parts of India, ACT-LM for Northeast India. Identify. This is Sapna, mascot for leprosy. Sapna is a older cured case, current case without treatment, current case with treatment, never suffered from leprosy. What is correct? Older cured case of leprosy, currently spreading awareness and reducing stigma and discrimination. Right. This we have discussed. I will skip. We have already discussed. Just have a look at the logo. Hand holding lotus sun in the background. This is not BJP. This is National Leprosy. Can you tell me, friends, what is E in this? E in the name of the program. National Leprosy. Complete the answer, friends. Eradication. Is eradication a correct term to use here? We have discussed the concept in lab 1. No. Elimination is for country, eradication is for world. Then why we are using? Because India has already eliminated it. December 2005. What is the level of elimination? FMG's popular question of examiner. Less than one case per 10,000 population. It is a prevalence rate. So you can multiply by 100, 0.01% also may be asked. Right? What is the first sensation lost in leprosy? First sensation lost in leprosy. Fine touch, cold temperature, hot temperature, vibration. It is temperature, cold temperature. Okay, right. Good. Prudent diet is a diet to prevent coronary heart disease. It has got 6 guidelines, but examiner has asked the goal and the first 3 in FMG. Let's focus on these 4. Goal is to reduce total cholesterol HDL ratio to less than. What is the answer, friends? Yes, Vladimir Putin is in the group. Less than 3.5. Total fat intake should be less than 30. Saturated 7. Salt intake less than 5 grams per day. So we have to know this, right? 3.5, 30, 7 and 5. 4 different questions of FMG. Which is the most dangerous type of cholesterol for coronary heart disease? HDL, LDL, VLDL, chylomicron. LDL, what is the cutoff for LDL we should target to prevent it? LDL, what is the outer limit? 250, नहीं 250 ज़्यादा हो जाएगा, 200 ज़्यादा हो जाएगा. LDL has always to be brought below 100 with diet, exercise or drugs. HDL should be minimum 40, LDL should be maximum 100. HDL should be minimum 40. LDL should be less than 100, right? Okay. Milligram per deciliter. Can you identify the phenomena and the disease? Identify the phenomena and the disease. This is a rule of half. We are talking of hypertension. Latest question. What is the innermost black circle? Yes, this is total population. At any time, 50% have hypertension. They may or may not be aware. Of those who have hypertension, 50% only develop symptoms. Of those who develop symptom, only 50% seek treatment. And of those who seek treatment, only 50% get adequate treatment was the answer. They can also show you this diagram this time as like this. So please don't get confused. It's not always a circle. It may be like this also, in a square form also. Rule of halves only shown by hypertension. Please be careful. This is identify again same disease tracking phenomena. Tracking phenomena says hypotensive BP increases in everyone, but hypotensive Mahendra Singh Dhoni, Rahul Dravid will always remain hypotensive through adulthood also. Virat Kohli, hypertensive, will remain hypertensive. Right? So BP follows like track of an athlete. Gautam Gambhir will be like this. He will come out of the graph also. So this is BP increases in everyone with age, but it tries to follow a track for a person. Right? Okay. Which program are we talking of when I depict regular surveillance? This logo also. Regular surveillance, sentinel surveillance, periodic surveys. Yes, IDSP. Integrated Disease Surveillance Program. Surveillance program. It's written also. Now, regular surveillance is done for common diseases. Malaria, dengue, waterborne diseases, typhoid, cholera, respiratory, TB, measles, URI, polio, road traffic accident, plague, and others. Your exam actually asks this. Which five components are covered under sentinel surveillance of IDSP? We'll directly have the lunch break. We have HIV, HBV, HCV, air quality, water quality. Friends, during the exam, when we are under severe stress, many times we forget IDSP is not only for diseases, air and water quality is also there. We have to remember. Periodic surveys is for non-communicable disease risk factors and anthropometry. YouTube students will realize that cerebellum students are used to having no break for 3 to 4 hours minimum when PSM class is going on. Which form is filled up by doctors? If you are a medical officer of PHC in IDSP, you will fill S form, P form, L form, FMG question. So we are focusing FMG question. If you have realized, everywhere I am using a pink highlighter to underline. That is your exam question. Exam question. Unannotated PDF has already been shared in the group, friends. Already morning I gave it. P form, presumptive diagnosis. Tarun Vikas managing the session. Please reshare it in the group. Please reshare it in the group. S form, syndromic diagnosis by health worker. P form, presumptive diagnosis is by you. Clinically, you will examine the patient, then make a presumptive diagnosis. Lab confirmed diagnosis will be through lab staff. What is sentinel surveillance used for? What is sentinel surveillance used for? Older FMG question. It is used to identify hidden or missing cases. So, examiner's brain while setting FMG questions, sentinel surveillance you can use, because ideally a screening test should be taken like a screening exam where 80-90% students can pass. Can you identify the program? Can you identify the program? What is the program here, friends? No, Pradhan Mantri Jan Arogya Yojana is a component of which program? Yes, this is Ayushman Bharat program. Its one component is this. Its other component is Health and Wellness Center. What is the new name of Health and Wellness Center? Question came by its new name. Yes, Ayushman Arogya Mandir. Who manages this health center, which is established at sub-center mostly? It is by community health officer who is a BSc nursing graduate or BAMS. All diagnostic services, all essential drugs are given. Specialist services are also given now at Arogya Mandir. Insurance cover for secondary tertiary level hospitalization is how much, friends? 5 lakh per family per year. Empanelment 10 beds. Government by default, private nursing home hospital if they have minimum 10 beds. Yes, Dr. Mangesh, Dr. Anuj is also right. Anemia Mukt Bharat, what is the strategy? 6 by 6 includes ministries? No, it includes beneficiaries, interventions, and institutional mechanisms. If you look carefully, we are asked in the paper iron and folic acid supplementation in all the groups separately. So please mark it correctly, friends. In children below 59 months or below 60 months, we have iron 20, folic acid 100. Children 5 to 9 years, keep on revising with me, 45, 400. All other groups, it is 60 milligram elemental iron, 500 microgram folic acid. How long you give in pregnancy lactation is for 180 days each. Can you tell me Anemia Mukt Bharat is slightly different from WIF's program where adolescents get how much iron folic acid? Latest question. Only in weekly iron folic acid supplementation, adolescents don't get 6500. They get, what is the answer, friends? Only in a different program they asked for the first time. It is a new question, 100 and 500. So I'll again repeat. You have to remember Anemia Mukt Bharat. Older program they asked in the exam, weekly iron folic acid supplementation, adolescent gets 100 iron, 500 folic acid. If someone is having moderate severe anemia, which formulation of IV is used? Iron, which formulation IV is used? We use ferric carboxymaltose and sucrose. Ferric carboxymaltose or IV sucrose. So ferric carboxymaltose or sucrose you have to remember. Dr. Anuj is right. Dr. Nilanjan Datta is also right. Easy question. Correct statement you have to put or pick regarding Anemia Mukt Bharat. Learn the art of MCQ solving in the exam. Try to rule out the wrong options. Only pregnancy, no. 100-day course, no. 180. It is given in lactation also. First trimester we don't give. We start from second. So whatever is left has to be correct. 6 months of pregnancy, 6 months of lactation. Total 12 months it is given. Total 12 months it is given. What is ninth in Pradhan Mantri Surakshit Matritva Abhiyan? What is done on ninth date of every month? What is done? That was asked. Yes, free antenatal checkup, but antenatal checkup is always free. This is by private practitioner. So they will get money from the Government of India JSSK scheme. It is done in second or third trimester, and because woman will get only one chance to interact with private practitioner before she reaches there, she should have got all the investigations plus ultrasound also. So there is only one contact with the private practitioner that should be utilized properly. Pradhan Mantri Matru Vandana Yojana, in case of first childbirth, gives two transactions. Total is 5,000. What is the division of 5,000? She gets 2,000. When she registers her pregnancy, 3,000. Minimum an antenatal visit, birth registration, and along with that, BCG, DPT, OPV, Hep B. Second childbirth. She gets 6,000 in a single tranche. But what is the rider attached with that? When will she get 6,000? Only girl. These are the latest guideline. In case you are having some older, please change. If there is a twin delivery, both are girl. If there is a twin delivery, both are girl, she will get 12,000. She will get 12,000. Right. Correct. All of you are automatically self motivated right now. So maintain this motivation till the last minute of the exam. Demography. Can you tell me what is B, friends? Can you tell me what is B? 6,000 is in second delivery and it is only for a girl child. A is crude birth rate. B is crude death rate. C is total population. Can you tell me India is in which stage? What is the name of the stage? What happens to birth rate, death rate? India is in stage 3, that is known as late expanding stage. Both birth rate and death rate are declining. Any country which has reached declining stage. Yes, European countries, France, Hungary, Germany. Here we have Japan, Singapore. Many countries are reducing year by year. What is stage 1 to stage 4 known as? High birth rate, death rate to low birth rate, death rate is known as? I'm looking at the chat box. Demographic transition. Good. Can you tell me in census of India, literacy rate definition? Literates. What is literates, friends? A person who can read, write, understand. All three. Don't expect with politicians. Read, write, understand. Out of total population is 7 years and above into 100. So that is 74% for India. Highest Kerala, lowest Bihar. 82% in males, 65% in females. Growth rate 1.64%. Can you tell me growth rate, what group India belongs to? Which phase of growth? Population doubling time. India is in very rapid growth phase and population will double in 35 to 47 years. Sex ratio, number of females divided by males into 1000, 943. Highest Kerala, lowest is Daman and Diu, not Haryana. Highest Kerala 1084, lowest is Daman and Diu. Child sex ratio, female children 0 to 6 year, male children 0 to 6 year. 919, highest is in Mizoram, lowest is in Haryana. Big divide in the census of India when population actually reduced only once from the previous census, 1921. India's population reduced from previous census only in 1921. Why sample registration system is most accurate? Anyone, friends? Why sample registration system is most accurate? Can you tell me? India's only dual record data collection system. Once every 6 months. Census every 10 years. This is every 6 months. What is the cutoff for registering births and deaths with the government in the country? Both should be registered within 21 days. This is the responsibility of hospital, parents, doctor, none of the above. Birth registration is the responsibility of hospitals. Parents, they just get delivery done and disappear till the next. Child born to NRI couple abroad, Virat Kohli, Anushka Sharma, then registration should be done within 60 days of arrival in the country. 60 days arrival in the country. Good. All of you are marking correct in these questions. Demography is very strong. TFR. Total fertility rate is total number of children produced. Out of them, how many are girl children? That is gross reproduction rate. Net reproduction rate is total girl children taking into account their mortality minus their deaths, taking into account their mortality. TFR is also known as completed family size. Crude birth rate is 8 times TFR plus 1. So TFR is also known as completed family size. Crude birth rate is 8 times TFR plus 1. Dependency ratio. Non-earning depend on how much earning for survival. Non-earning is taken as, this is a popular topic, will come in your upcoming exam also, very high chances. Less than 15 years, more than 65 years. Remaining is taken as earning population. Can we calculate in this question where they have given 30% children, 10% older people? So remaining will be 60%. So 0.66 I can write as 66 by 100. Now I can interpret 66 non-earning depend on 100 earning for survival. 66 non-earning depend on 100 earning for survival. Friends, anywhere you feel something you're not understanding, please ask, right? Because it's a revision session, I have to go fast. Rather than covering 10 questions, I want to cover at least 1000 to 2000 questions today. Maternal mortality ratio is per 1 lakh live births. Maternal mortality rate is per 1 lakh women in reproductive age group, Dr. Achal. Population pyramid. Generally, only shape is asked in your exam. If you look at developing country, it is a upright triangle having a broad base, narrow top. You have to remember these technical words I am using. Developing country, upright triangle, broad base, narrow top. Broad base because it is more children. Developed country is spindle shape, having a bulge in middle. High fertility in developing, low in developed. Span. Low life expectancy in India, 25 years. Higher life expectancy in Japan. Span is height. So Indian pyramid is less tall, developed is more. Symmetry. India is asymmetric because we have unfavorable sex ratio. Female feticide is done. Developed countries are symmetric. There is no female feticide, right? Okay. Can you mark this answer? Dependency ratio calculation. You'll have to read very, very carefully. How many are numerator? How many are denominator? No, I don't need the answer. Look at the question because answer you may have memorized. What I'm asking, how many is numerator? Numerator is 2. Less than 15, more than 65. How much is the denominator? Those who are 15 to 65. 3. 0.66, 66 by 100. There is no multiplier. It is never expressed in percentage. But your examiner gave a question like this. Mark B as the answer. So it is 66 non-earning which depend on 100 earning for survival, right? Okay. Family planning. Contraceptive failure and efficacy is assessed by Pearl index. Can you tell me what is its numerator and how do we express Pearl index? Numerator is number of accidental pregnancies, total months of usage into 1200 expressed per 100 women years. 100 women years. Eligible couple is where wife is in reproductive age. Can you tell me what is its rate in India? Who maintains the register where? Rate is 150 to 180 per 1000 population. Maintained at sub-center register by multi-purpose worker female. Couple protection rate. Protected couples by eligible couples into 100. Total protected couples means those who are using contraception. Can you tell me Mala and Malady, estrogen, progesterone? Very popular question. Estrogen, progesterone content. Estrogen is 30 microgram, progesterone is 150. Can you convert to milligram also, 0.03 and 0.15. Mala N is free. Mala D is at rupees 3 per packet cycle, highly subsidized cost, right? Last 7 pills, content composition of iron was asked in FMG. Can you tell me, friends? 60 milligram ferrous fumarate. In iron folic acid, salt is sulfate. Here it is fumarate. That you have to mark correctly. Dr. Anuj Sharma is also right. Okay. A female is using combined OCPs for contraception. Chances of which of the following cancer is not reduced? That means other three, it has a protective beneficial effect. It has no protective effect against cervical cancer. It has no protective effect against breast cancer also. But definitely it is protective against ovarian cancer, colorectal and endometrial cancer, which allows safe usage for combined OCP. We are nearing the lunch break. Don't worry, let's wrap it up. Yes, this is a contraindication. This is a contraindication. This is HIV allows safe usage, right? Okay. Which of them is used in RCH program? Can I say two only? Can I say two only? No, we have to use these two as the correct answer. Why? This is copper T380A, shelf life 10 years. This is copper T375 multi-load 5 years. What is this number 380, 375 tell you? It is surface area in millimeter square. Can you identify what is DMPA? Which group of contraceptive? Dipomedroxyprogesterone acetate. Dose, most common side effect. FMG question. Dose is 150 milligram once every 3 months. Most common side effect, irregularization of menstrual cycles. Irregularization of menstrual cycles. What is its new name in RCH? Dr. Anuj is correct. Dr. किसी का भी नाम जेन्युइन नहीं है आज तो. Okay. Dr. Karthik is correct. So, new name is Antra. So, rebranded, repackaged as Antra in RCH program, dipomedroxyprogesterone acetate. This is no scalpel vasectomy. Minimum length of vas cut 1 centimeter. Otherwise, spontaneous recanalization failure can occur. Most useful advice post vasectomy. A person is not sterile for 3 months. Barrier method for 3 months. Now, friends, when this question came recently, there was a choice that barrier methods 3 months, barrier method 3 months. After that, there should be semen analysis. Is this correct? That for 3 months barrier method used, it should be followed by semen analysis. That is correct. Most common cause of failure is surgical misidentification of vas deferens. So it's not non-usage of barrier method by the client or spontaneous recanalization. Surgical misidentification of vas deferens. Chaya is the new name of Chaya is the new name of older contraceptive Saheli, India's non-steroidal OCP, developed by Central Drug Research Institute, Lucknow. It is given once a week after 3 months. Antra is DMPA, and Nishchay we have discussed is urine-based pregnancy testing kit. IUD insertion presents with bleeding. Bleeding is a normal physiological phenomena. So if you keep on removing IUD, every case you will have to remove almost. So what we recommend, reassurance is not sufficient. Already 50% females are anemic. She will go into severe anemia. Iron supplementation should be done. Ferrous sulfate, 200 milligram TDS for 2 months. Generally, this bleeding subsides in 2 months. Still not subside. Immediately remove the IUD. Environment. Can you identify the apparatus and its use in public health? And what is the indicator? This is Horrocks apparatus. What is its use in public health? Environment. It is used for, can I say residual chlorine level? Can I say residual chlorine level? No, it is not. It is only for chlorine demand estimation. How much bleaching or chlorine powder is required for disinfection? Starch iodide indicator. When you come to PG, I will tell you there is a formula n into 2 grams for 455 liters of water. How to identify? One black cup, 6 white cups are there, right? Okay. This is used for residual chlorine. This is not Horrocks apparatus. This is chloroscope. Exam, do not be in a hurry. Don't mark it as Sahali's hemoglobinometer. Drinking water, it should be minimum zero point 0.5 milligram per liter. Minimum 1 in swimming pool. Minimum 2 to kill cyclops. Right? Contact period, 1 hour. Post disaster, this level should be 0.7. ppm and milligram per liter are same. ppm and milligram per liter are absolutely same. Water collection, bacteriological examination, which is correct statement. A is wrong. You have to use a tap which is not leaking, otherwise contamination will occur, which is in use. B is wrong. Why B is wrong? Because it is for 2 minutes. Water sample is kept close to avoid tap spillage. This is partly correct. You don't have to touch it. Better is the term that they use in the guidelines. Collect from a gentle stream of water, avoid splashing, right? So it is allowed to run waste for 2 minutes and then collect. Identify red bulb at the end. Carter thermometer used for cooling power of air earlier. But what is the answer now, friends? Low air velocity. Sling psychrometer, which is rotated like a Japanese fan. This is used for moisture content, air humidity. Two instruments you have to remember from air also. Okay, this is and given by National Air Quality Index will 100% come in your paper. Central Pollution Control Board. Good is 0 to 50. 51 to 100 is satisfactory. Moderate 100 to 200. 201 to 300 poor. 301 to 400. 401 to 500. Severe. After that, Delhi starts. So this is what you have to remember also is the possible health impact. First, we look at breathing discomfort. Breathing discomfort first occurs in sensitive people, then people with disease, and then all people. Respiratory illness will come on prolonged exposure, but ultimately healthy and serious. All will be affected, those who are having the disease. So you'll have to read it multiple times. Right? Okay. Sound. Just one question. What is the recommended sound level maximum for human ear? Tolerable sound level for human ear should be less than 90 decibel. And hospital ward should be quietest, which they never are. But what is the recommended value? Hospital wards of India, the sound level should be 20 to 35. Light. Can you tell me brightness of point source is measured by which SI unit of light? That is candela. Housing. Can you tell me three criteria of overcrowding with cutoff? If number of persons living per room is more than 2, floor space per person is less than 70 to 90 square feet, absence of sex separation above 9 years. Radiation. Can you tell me permissible radiation exposure for an adult man? Maximum 5 rad per person per year. What is the thickness of lead apron? What is the thickness of lead apron? It should be minimum. Point 0.5. What is the unit? Point 0.5. What point 0.5? Millimeter. Waste disposal. Can you tell me what is the most sanitary method for solid waste disposal? Refuse disposal. Landfill. Controlled tipping. Can you tell me, friends, what is the depth of water seal in RCA sanitary latrine? 2 centimeter. Can you tell me strong sewage? How much is BOD? 300. Good. All of you remember the value. That is so good to see because I'm asking randomly, right? Okay. This is which vector? Parallel, hunch, tiger. So we are talking of ADs. So what is the answer to this question? C. Only dengue. It can transmit chikungunya also. This is through Culex. This is through female anopheles. Right? Okay. Can you identify image number 1? 2 we have already done. 45-degree black spots on margins of wings. Female anopheles. What is the vector of rural malaria? What is the vector of urban malaria? Rural malaria, we have Culicifaces. Urban malaria, we have Stephen's hive. When it is not at 45, parallel with a hunch like ADs, but not tiger, this is Culex. What is the vector of West Nile fever? What is the vector of West Nile fever? Culex pipiens. Can you identify A and B? A is Anopheles, B is Culex. If suppose they ask you to differentiate, although they should not, between Culex and Aedes. So please remember, siphon tube is smaller in Aedes, bigger in Culex. But both images should be together, then only you will be able to identify. Right? So Anopheles rest parallel, Aedes Culex rest at an angle. Aedes has a shorter siphon tube, Culex has a bigger siphon tube. This is not a mosquito, sandfly. Which of them is sandfly? 1, 2, or 3? All 3. Features: legs 2 times longer than body, lanceolate flame shaped wing, hair on margin. Disease: Kala Azar. Let's wrap up this topic, then we'll go for a lunch break. Kala Azar, oriental sore. Quickly write the causative agent of both. Quickly write causative agent of both. It also transmits sandfly fever and Oriya fever. Kala Azar is through Leishmania donovani. Oriental sore is through Leishmania tropica. This is rat flea. Dorso-ventrally compressed, no wings. Diseases: endemic typhus and plague. It also plays a role in H. nana diminuta. Most dangerous is partially blocked, and potential explosiveness is through Chiopis index. Paris green powder, copper acetoarsenite. Your exam question. What should I mark? It is anti-larval stomach poison. Okay, if you want, we can continue or we can have the break. Lunch break is designated 1 to 2 p.m. today. Can we start early? Can we have lunch break till नहीं, 2 PM से तो करना ही आउटर लिमिट है, उससे पहले। ओके, लेट अस स्टार्ट एट 1:45, 40 minutes you have. We'll go, have our lunch and come back, and I will again try to cover rest of the course as much as possible within those 2 hours we are remaining with us. So let's quickly go for a lunch break. Thank you so much, friends. I'll again join at 1:45 Indian Standard Time. Thank you. Okay, friends, so everyone is back. Let us start preventive ops, peds and geriatric. Right, friends? Okay. So chat box again open. Keep on writing as much as you know. Anywhere you get stuck, let me know. Right? Okay. According to antenatal care, ideal number of antenatal visits. Focus on the number. Ideal. Just, just a second. Yes. Just a second, please. Yes. Whenever there is ideal number, we should go for 12 to 14. First 7 months, 7 visits, 8 months, 2 visits, 9 months onwards, once every week. So 7 plus 2 plus 4 to 5, 13 to 14 visits. If you are asked about their minimum visits, 4 according to RCH program, 8 according to WHO. But only if they ask you minimum word in that. Postnatal visits are undertaken by multi-purpose worker females separately, ASHA workers separately. So multi-purpose worker female ANM, they take 3 to 4 visits. ASHA worker undertakes 6 to 7 visits. 3 visits are day 3, 7, 42. Home visit, additional visit on day 1. In ASHA visits, institutional visits are day 3, 7, 14, 21, 28, 42. In home visit, additional visit on day 1. Asha, when she is taking the visit, that is known as program name home based newborn care. Home based newborn care. All visits have to finish by 42 days because most common cause of maternal mortality, postpartum hemorrhage. Maternal definition of maternal death include up to 48 days, right? Days, multiple readings will have to give. Almost every student is writing correctly, friends, so we have to. This is what one of the student was asking earlier. Maternal death per 1,000 women in reproductive age. This is. What is the answer, friends? Choice number C. In ratio, it is per 1 lakh live birth. So ratio is more commonly used per 1 lakh live births. Rate is per 1 lakh women in reproductive age group. All the MCH indicators, common denominator is live birth. Can I say all of them have same multiplier also? No. All of them have multiplier 1,000 except MMR, which we have discussed, has a multiplier of 1 lakh. Can you tell me the most common cause? Which of them? The most common cause is low birth weight, prematurity. Low birth weight and prematurity. Single answer, prematurity is the commonest cause of which of them? It is the commonest cause of infant deaths also, under 5 also, neonatal also, perinatal also. MMR is through PPH. Direct PPH, indirect anemia, still birth rate, maternal infections, abruptio placentae. Maternal infections, abruptio placentae. Then let us look at latest question. Best indicator to determine health status, health services utilization effectiveness. 4 older questions of your exam, they mixed into a single question, IMR. This is the best place to mix everything now. When we look at health services availability, IMR, health services utilization, effectiveness, health status, state failure, ASHA. All the 6 questions, answer is infant mortality rate. Socioeconomic development. Can you tell me, friends, which is the best indicator? I'm looking at the chat box. Yes, Dr. Pranjal, Dr. Rupali, you are right. Under 5 mortality rate. Under 5 mortality rate when we are looking at socio-economic development or social development. Right? So please be careful while marking this answer. Combined maternal newborn care. This is perinatal. All of us know perinatal is 28 weeks till 7 days. So both parts are included, maternal, newborn. Cost effectiveness of a health program is Kelly. These five we have discussed, I skip. Virulence or killing power, case fatality rate. Which disease has 100% case fatality? Which disease? Dr. Anuj is right. Dr. Mangesh Kumar Gupta is right. Which disease has 100% case fatality? Rabies. Communicability, secondary attack rate. Communicability of a disease is given by secondary attack rate. Now the calculation question. Neonatal mortality rate is given by the formula neonatal death upon live birth into 1000. When we look at the question, look at the live births, 4050 total and 50 are stillbirth. So 4050 total deaths minus stillbirth. Total live births are 4000. Then they're asking numerator 0 to 7 days, 8 to 20 days. Neonatal period is 0 to 28. Early plus late into 1000. So 200 upon 4000 into 1000. Answer is 50. This is the exact question of your paper. We have to mark it correctly, friends. Read the values carefully. Similarly, let us calculate ratio here. Maternal death upon live birth into 1 lakh. When we look at live birth, 4000. Multiplier we know. Only thing is you have to calculate numerator correctly. So 2 obstructed labor, 1 shock, 1 pph, 4 deaths. Snake bite electrocution are not related to maternity or its complication. That will not be included. So only when death occurs due to pregnancy or its complication, answer will be 100 per 1 lakh live births. This we have to remember. FIMNCI, two questions. Which age group and which 5 diseases? Age group is 0 to 5 years. 5 diseases are diarrhea, pneumonia, malaria, measles, malnutrition. RBSK, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. Target beneficiary and diseases covered. Target beneficiary is child 0 to 18 years. And 4 Ds. Diseases, deficiency, defect, disability, developmental delays. Total 32 diseases are covered under this. राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम. It is Kishore, adolescent, age group 10 to 19 years, having 7 C's. Any one of you who feel you remember all the 7 C's. We have discussed in detail in lab 1 also, revision in lab 2 also. Clinic, community, communication, content, convergence, coverage and counseling. Multiple readings we have to give. NSSK, Navjat Shishu Suraksha Karikram. This is a training program for healthcare people. Nutritional Rehabilitation Center. It is for below 5 years severe acute malnutrition. HBNC is postnatal visits by ASHA. Facility based newborn care, where we construct NBCC, NBSU, SNCU. Facility based newborn care, right? Okay. Birth weight. Can you tell me what is low birth weight, very low birth weight, extremely low birth weight? This is less than 2.5 kilogram on day of delivery, less than 1.5, less than 1. Moderately low birth weight is in between. Birth weight doubles in 5 months, triples in 1 year. Prevalence in India is 18.7%. 18.7%. Preterm in India is less than 36 weeks. They are always going to be low birth weight. Term is 37 to 42. Postterm is more than 42. By chance, if they are low birth weight, this is the definition of small for gestational age, small for date babies. It does not include preterm low birth weight. Most common cause IUGR, percentile definition of weight for gestational age less than 10%. Identify first and second instrument. First is Salter scale, birth weight or infant's weight. Second is infantometer, birth length or height we can measure. Exclusive breastfeeding is done till 6 months of age, continue till 2 years. Immunoglobulin most abundant in breast milk is secretory A, followed by D, followed by other types. Essential fatty acid exclusive to breast milk is docosahexaenoic acid. Vitamin most deficient in breast milk, we have discussed, there is no controversy. Vitamin D, followed by K, followed by B. Energy 65 kilocalories in 100 ml. Protein is 0.9 to 1.1 gram per 100 ml. Human milk is rich in, anyone remembers which nutrients human milk is rich in? Lactose, iron, water, calcium phosphorus ratio. Cow's milk is rich in protein, fats, energy, and individual amount of calcium phosphorus. Breastfeeding should be started after a normal vaginal delivery as soon as possible, but maximum within 1 hour, preferably at the delivery table. Caesarean section as soon as possible again. Not in the choice, then maximum within 4 hours. This we have to remember. Good. Wasting is which of them? Take your time. Wait for age, wait for height, height for age. Wasting. This represents acute malnutrition. Lesser height for age. Stunting. This represents chronic malnutrition. And if there is lesser weight for age, underweight, that represents acute on chronic malnutrition. Acute on chronic malnutrition. So these three we have to know, mark them correctly in the paper also, friends. So wasting and stunting. WHO growth chart, David Morley developed growth charts drawn between weight and age. Uppermost line is equal to only one question. NCHS standards uppermost line is 90th percentile of boys. No, it is 50th percentile of boys. Lower line, 2 standard deviations below, is 3rd percentile of girls. In between, this is road to health. Green area is road to health, NCHS. Only 4 IQ levels you have to tell me. Lowest IQ, idiot 0 to 24, imbecile 25 to 49, 50 to 69 is moron. We are only looking at your exam questions. Now, when you look beyond politicians, then normal suddenly becomes 90 to 109. In mental retardation classification is an exception where normal IQ is taken more than 70. 50 to 69 mild, 35 to 49 moderate, 21 to 34 severe, less than 20 profound. Mental retardation classification also you have to remember. This is ICDS. What is S here? This is midday meal program. Integrated child development. S is not scheme or strategy. It is services. Integrated child development services. This is covered under Ministry of Women and Child Development. We have children below 6 years, one beneficiary. Total 4 beneficiaries are there. We have non-pregnant, non-lactating, reproductive age group female, pregnant lactating female, and 11 to 18-year adolescent girls. Except adult male, everyone is important. Then one community development block comprises of 100 villages 1 lakh population. Heart of ICDS is Anganwadi. So heart of ICDS is Anganwadi. How much calories, how much proteins? In both the scheme, it is same actually. 1/3 calorie, 1/2 protein. Same here also. But here the ministry is Ministry of Education. Earlier HRD, now Ministry of Education it has converted to. 5 days you have to maintain your flight. Please remember 5 days, there should be nothing stopping you. Take sleep in 5 days also, so that on the exam morning you are fresh. It's not that 5 days you don't have to sleep, right? PYQs late night, keep on doing, keep on doing. Take break after every 2 hours at least for 5, 10 minutes, 15 minutes. Nutrition. What is the richest source of essential fatty acids? Linoleic acid, arachidonic acid, and PUFA. Safflower oil, followed by sunflower, corn, soybean. Proteins. What is the richest source of protein, friends? What is the answer, friends? Richest source of proteins. Egg is not correct. Egg is the quality of protein source. When we say richest, we are looking at quantity. That is soya bean. Vitamin C is amla, followed by guava. Vitamin D, richest source. Vitamin D, richest source is not sunlight. Like A, it is halibut fish, liver oil. Iron is dried pumpkin seeds. Saturated fats. Anyone? What is the richest source of saturated fat? It is coconut oil. So one word answers mostly from nutrition. Then energy requirements. If they don't specify the level of activity, mark sedentary for adult man, woman. Adult man 2100, here 1700. This is in kilocalories per day. Otherwise, it increases to 27 and 3500 in males, moderate heavy. Females correspondingly 21 and 2700. Protein requirement of all the adult Indian is same. In gram per kg per day, how much it is? Protein requirement of adult Indian man, woman in gram per kg per day is 0.83. Good. They asked absolute number also in grams per day. Then 54 and 45. Dr. Rohit is right. Dr. Symbiosis, Dr. Ashish, Dr. Neeraj also is right. Everyone is right. Dr. Rupali also is right. Good. Pregnancy, it increases by plus 350. In lactation, first half 600, second half 520. Infant 550 in first half, 670 in second half kilocalories per day. These all numbers have been asked in your paper. There is no shortcut here, friends. There is no shortcut here. Nutrition guidelines, we have been asked these values in your paper. Let us highlight. What is the energy, not energy, iron requirement intake suggested in a man woman pregnancy lactation? This is in milligram per day. 19, 29, 40, 23. 40 milligram per day a female should consume, because absorption is only 10%. Now she will get what she requires, 3 to 4 milligram. How much is the content in iron tablet, IFA tablet? To be on the safer side, we keep slightly higher, 60 milligram. So body needs 3 milligram. Intake we suggest 40 milligram. Tablet contains 60 for iron. Iodine. This is in microgram per day. Ask for all the groups separately. 150 per day in adults, 250 pregnancy, 280 lactation. We are talking of FMG questions. Vitamin A, microgram per day of retinol equivalent, 1000, 840, 900 and 950 microgram per day. Vitamin D is same for all, 600 international units per day. So go through these numbers once if possible after today's class also. Which disease, which vitamin, which group of people? Three questions. Disease, vitamin, group of people. Disease is pellagra. You can see Castle's necklace. B3, niacin deficiency, maize eaters. Otherwise, tryptophan 60 milligram is converted to niacin 1 milligram on a daily basis in a ratio of 60:1. Pathway is chi-urinin K pathway. Deficiency is tryptophan, but real problem is not deficiency, but excess of another amino acid. That is leucine. So leucine is known as pellagrogenic amino acid of India. It has earlier diarrhea, dermatitis, dementia, then death was added. So diarrhea, dermatitis, dementia, death. Then delirium, depression also have been added. So diarrhea, dermatitis, death. Sorry, diarrhea, dermatitis, dementia, 3Ds. Fourth D is death. Fifth D is delirium. Sixth D is depression. First changes of fluorine are seen in upper central incisor. When we talk of fluorine in drinking water, separate questions have been asked. Can you mark these five correctly? We are talking of milligram per liter or ppm in drinking water. Recommended level 0.5 to 0.8. 1 to 2 is acceptable. Dental above 1.5, skeletal 3 to 6. Crippling if level goes above 10 ppm. If level goes above 10 ppm. Yes, we are covering 100% course today. In egg, what does it contain? Composition wise, 6 gram fat, 6 gram protein, 30 milligram calcium, 1.5 milligram iron, 70 kilocalorie energy. An egg is the richest source of cholesterol, 250 milligram. These two values you have to remember separately also. Highest quality 96, making it the reference protein of India. Soya bean is highest in quantity, 43.2%. Energy by chance is exactly same, 432 kilocalories per 100 grams, right? Okay. This is easy. Thymine, which of them? Thymine, the major source is rice. So thymine deficiency is seen in polished rice eaters, which lead to berry. Dry berry is CNS. Wet berry is cardiovascular. Otherwise, thymine deficiency also leads to Wernicke-Korsakoff psychosis in chronic alcoholics. Neural tube defects. Preconception. A female should be advised to take how much folic acid? Can you tell me the quantum amount? Good. It is 4 milligram. Please be careful. It's not 5, it is 4 milligram. Which level of prevention this is? Primary. Prior history of neural tube defect means risk factor is present. We are affording specific protection. Specific protection. Yes, students are giving correct answer. This is conjunctival cirrhosis, dry eye, category 1A, 1B, white dot spots. It is a public health problem if night blindness is more than 1% or white dot spots is more than 0.5%. What is the characteristic appearance of conjunctival cirrhosis? What is the actual appearance of conjunctival cirrhosis? Yes, you can write abbreviations in the chat box. I'll understand. Receding banks after a C-tide appearance. So wavy lines like this. If you see carefully, wavy lines you can see. This is characteristic of conjunctival cirrhosis. Same village, multiple people coming with so many clues are given. Edema, mustard seed. So we are looking at edema, epidemic dropsy. What is the adulterant? Food item is mustard. What is the adulterant of mustard? Argemone oil. What is the toxin which leads to manifestations? Sanguinarine. Mechanism of action inhibits oxidation of pyruvic acid. Good. Stored groundnuts. Stored groundnuts are mostly associated with aflatoxicosis. Ergotism is with stored cereal grains. Ergotism is with stored cereal grains. One stick stage. A person is consuming rice and pulses only. We are talking of neuroletharism. Which vitamin is protective? Vitamin C. What is the toxin of letharism? Friends, what is the toxin of letharism? That is correct. That is BOA, beta oxalyl aminoalanine. Beta oxalyl aminoalanine. Yes, all of you are answering correctly. One stick stage, two stick stage, crawler stage, death. This is neuroletharism. Osteoletharism is in animals. Neuro is in humans. Ergotism, where purple colored, you can see, destroys the crops extensively, purple colored. You can make a diagnosis at home. You can separate ergot also by, Dr. Rohit is right, 20% brine solution or salt solution. 20% brine or salt solution can reduce. No, this is not fluorine. This is ergotism, 20% salt solution. Read question. Diarrhea, 15-month age, erythematous scaly pustular lesions, perioral area. So many clues they have given. Zinc deficiency. Copper deficiency mimics which other deficiency? Copper deficiency mimics which other deficiency? Similar to, presentation is similar to, not iron. It is vitamin C deficiency. Therefore, vitamin C deficiency is scurvy. Copper is pseudo scurvy. Selenium deficiency, endemic cardiomyopathy, is Cation's disease. And iodine deficiency has a wide presentation. Hypothyroidism, mental retardation, goiter, cretinism, abortion, stillbirth. Many presentations are there. Social sciences. In modified Kuppuswamy scale, which is for urban families, what are the three components to calculate socioeconomic status? In modified Kuppuswamy scale, urban families, we use three. These are education, income, occupation. Education, occupation is for head of the family. Then, what is the score of upper class? It is 26 to 29. You have to remember this. So, five categories: two lower, two middle, one upper. So, lower, lower, upper, lower, lower, middle, upper. Let's see. 26 to 29. Okay. Take your time. What is this? Take your time. Family cycle phase lasting from birth of last child to first child leaving home. This is, yes, complete extension. Let us try to understand. Formation is marriage till first childbirth. So this is from, this is to. Extension, first childbirth to last childbirth. Complete extension, Last childbirth to first child leaves home. This is what was asked in this question. Last childbirth to first child leaves home. First child leaves home to last child leaves home contraction. Last child leaves home to death of spouse. Death of spouse to death of survivor. Also known as extinction of the family is dissolution of the family. Please, in the question, you have to notice what has already passed. They are saying it lasts from birth of last child. Birth of last child has already taken place. So these two cannot be the answer. Till at the moment last childbirth occurs, family enters stage 3. Family enters stage 3. Nuclear family. One married couple with or without their kids. Rohit Sharma, Virat Kohli. Joint family. More than one married couple with or without their kids. Dharmendra, Sunny Deol, Bobby Deol family. Three generation family. Amitabh Bachchan family. Three successive generations. So we are having in the class also today. New family. Less than 10 years marriage duration. Communal family. Each member has a defined role. I told you in all these definitions, you have to focus on one key word. Broken family. ओके अभिषेक बच्चन नहीं है क्लास में. Okay, ठीक है. निम्रत कौर में भी नोइंग. Broken family is both parents not together due to death, divorce, or legal separation. Due to any reason, both are not together. Problem family lags in progress behind rest of the society. Technical words are asked, I told you. So it may be a poor family, a rich family. Health communication. This is lecture, also known as chalk and talk method. Is it one way, two way? One way, two way. This is one way. No question answering is permitted either during or after the lecture. So is it didactic, Socratic? Didactic, Socratic. This is didactic, one way. Socratic is two way. WHO recommends ideal group size should be less than 30 and 15 to 20 minutes is enough. Right? Then this is focus group discussion. Tell me the number of participants in a focus group discussion. Number of participants. It is 6 to 12 persons, including one group leader and a recorder. When this discussion is going on, the recorder has to make a diagram also, which shows interaction between participants, how they are interacting with each other. This diagram is known as sociogram. Good. Sociogram tells you interaction of participants in a focus group discussion. If it is balanced, it is better. Can I say this is also a focus group discussion? No. Why no? Because you can see it is a panel of 4 to 8 experts in front of audience. So when we have 4 to 8 experts in front of audience, is it didactic, Socratic? One way, two way. Audience can ask questions in the end, Socratic. Do they follow any specific order of speeches? No. It is like a news channel debate, right? Okay. Read question. This is again FMG question. Take your time. Can I say this is panel discussion? No. There is no discussion among the speakers. Experts only come one by one, give lecture. This is symposium. In a single word, can you tell me how symposium is different from lecture? In a single word, can you tell me how symposium is different from lecture? Okay, one student has understood the question. Lecture is didactic, symposium is Socratic. Lecture, you cannot ask questions. Symposium, there is a question answer round after all the experts or speakers have delivered their lecture. Yes, sequence is there. Yes, sequence is there. Good. Which health communication method you will employ if you have to teach women of urban slum about ORS preparation? FMG question. Demonstration. It is based on two principles. What are the two principles of demonstration which are used in the methodology? Seeing is believing, learning by doing. Very good. Seeing is believing, learning by doing. Where do we use Spike's technique? Communication of cancer diagnosis and prognosis. It can be used for any adverse news. What is K? S is setup interview. P, perception. I, invitation to explain. K, knowledge. E is emotion. S is summary. Gather approach, earlier known as cafeteria approach, is used for contraceptive counseling. What is H? What is H? Greet, ask, tell, help. Help them choose the better method. Explain, return visit. Good. Instilling a particular idea in people's mind, not affecting their thought process, is a type of health propaganda. Can you tell me which type of behavior is seen in health propaganda? Anyone remembers the answer? Behavior. Behavior. It is reflexive behavior. Health education, it is scientific, rational, thought process is present, skill development is present, it has reflective behavior. Health education appeals to reason, but health propaganda is appealing to emotions of the person. Emotions of the person, right? Read the question. Cannot understand few technical words. Can I call it language barrier? No. Language barrier is when you cannot understand the whole language. It is semantic barrier. I told you the example. You propose to a girl, she says, I don't love you, but your brain and ears are not able to hear this word. Don't. Selective few words get missed. That is known as semantic barrier. You are teaching a non-medico in English. In between, you use some technical medical terms. She will or he will not understand. This is semantic barrier, right? Okay. Okay. Tour guide, tourist group. This is a type of crowd, band, herd, or mob. Herd. What is the unique feature of crowd? Comes temporarily together, no leader, no organization. Mob. Temporary, but they have a leader and they are very emotional, ready to fight. Herd. They are having a leader and they follow leader without questioning. Band is a group of families living together following a way of life, right? So this is four types of group dynamics which are asked in your paper. National board and FMG aspirants is a, if we go by the strict technical definition, it is a herd. Family to nahi ho aap. It is a herd, right? Whatever they say, pay 10,000 fee, pay 7,000 fee, you will pay. Exam is on this day, you will pay, right? Occupational health. Which industry Which pneumoconiosis? Occupational health. Which industry? Is this is shipyard workers. Latest question are associated with development of asbestosis. Shipyard workers are industrially associated with pneumoconiosis, asbestosis. Sand mine, sand mine blasting, stone crushing, Kota Stone Factory, Rajasthan. We are talking of silicosis. They have given second clue also in the photograph, chest X-ray. What is the unique feature of this chest X-ray? What is the unique feature of this chest X-ray? Not sandstorm, snowstorm chest X-ray. So it confuses many times with tuberculosis, miliary tuberculosis, silicosis, snowstorm chest X-ray. It is found in glass industry also. It is found in cement industry also. Textile. Let's now match textile industry question when it came in your paper. Bicinosis, sugar mill, bagasosis, coal miners, anthracosis, glass industry workers, silicosis, cement industry workers, silicosis, bauxite miners, silicosis, shipyard workers, asbestosis. How many of you marked all the seven correctly? How many of you marked all the seven correctly? This is the accuracy desirable in your FMG exam also. Good. So many students have marked this correctly. Mesothelioma, clinical association maximum with asbestosis, so is lung cancer, silicosis with TB. Organism in bagasosis, thermoactinomyces. Organism in farmer's lung, micropolyspora. And what is in compost lung is aspergillus. Which of them are notifiable diseases? Which of them are notifiable? Are four commonest. I have written them in order. First four. So you can use the mnemonic SAB. Don't use SAAB because B is for bagasosis also. Don't use SAB. Use SAB. Silicosis, anthracosis, asbestosis and बिसिनोसिस. कार्डबोर्ड इंडस्ट्री में क्या होगा फ्रेंड्स? कार्डबोर्ड इंडस्ट्री, कार्डबोर्ड इंडस्ट्री अगेन बेगासोसिस, अगेन बेगासोसिस. डाई इंडस्ट्री, नाइट्रोजन डाई, एनिलीन डाई, बेंजीन. ट्रांजिशनल सेल कार्सिनोमा. विच इज द मोस्ट कॉमन ऑक्यूपेशनल कैंसर? मोस्ट कॉमन ऑक्यूपेशनल कैंसर. No, it is not transitional cell. It is not lung. It is skin. Squamous cell carcinoma skin. Most common. Make a diagnosis of the disease, source, mode, clinical features. This is lead poisoning, plumbism. It is through petrol, not through toys or lead pipes. We don't use them. It is through inhalation mode. Clinical features are perioral facial pallor, Burtonian line, lead sulfide. Then we have restore foot drop, classical presentation in emergency. Colic. These four are due to FMG question, inorganic lead exposure. Organic lead exposure leads to CNS, encephalopathy. Screening test of choice is coproporphyrin in urine. Diagnosis is by aminolevulinic acid in urine, lead levels in urine, lead levels in blood. Popular question, drug of choice. Can anyone tell me? Drug of choice. EDTA. It may be used along with dimercaprol ball. Second line is penicillamine. Peripheral blood smear. What is affected? Eosinophil or basophil? Eosinophil, basophil are not affected. There is a basophilic stippling of RBC. RBC are affected. Microcytic hypochromic anemia. So you can see basophilic stippling of RBC. We have to be careful in the paper. 25% burns. I cannot ask you to remember the whole list, but you have to know the answer. When we say this, we are talking of which benefit? Extended sickness benefit, which is actually covering 34 diseases. This is for a duration of 2 years. Sickness benefit is for 91 days. What is the duration of benefit for maternity benefit? Duration of benefit for maternity benefit is 26 weeks or 6 months. Good. Ministry of ESI, Employee State Insurance, is labor. Union Minister of Labor is the chairperson. He may not be aware himself, but Union Minister of Labor is the chairperson. Factory is where there is 10 or more people working with power or electricity. 20 or more without power of electricity is also covered. How much contribution employer gives? Employee gives. Yes, 3.25% of wages per month, 0.75% of wages. Enhanced sickness benefit is 100% wages, 7 days in vasectomy, 14 days in tubectomy. In case, in case there is, let us say, no nearby ESI facility, ESI pays money to registered medical practitioners to deliver free care. This is known as older question. Good, Dr. Virag is right. Indirect pattern medical benefit. So if there is no nearby facility, registered medical practitioners RMPs are given money by ESI to deliver free services to the beneficiary. Indirect pattern medical benefit is the name of this benefit. Factory Act per capita space 500. What is the recommended per capita space in a school class? In a school class, let's combine three questions together. Dr. Sam is right, 10 square feet. And in a house, a person should get Gautam Nagar. Yes, 70 to 90 square feet per person. 70 to 90 square feet per person. One safety officer is per 1000. Welfare per 500. Work hour duration 9 hours a day, maximum 48 hours a week. With overtime, it can go up to 60 hours a week. According to Factory Act, who is child, who is adolescent? According to Factory Act, I am saying child is 0 to 18 otherwise, but here it is 0 to 14. Adolescent is 15 to 18 here, otherwise adolescent is 10 to 19. Healthcare system. What is this? And it is an example of. Complete the answer. Good. This is standpipe, which is an example of which principle of primary healthcare? Wonderful. Everyone is giving correct answer. Appropriate technology. So make a tap at the center of the village on a raised platform. People can come and take water to their home. Community participation. What is the best example from India? Asha selected from the same village. And who are Chinese barefoot doctors? Actually, rice farmers. Appropriate technology, ORS, exclusive breastfeeding, kangaroo mother care, standpipe are very good examples. So, Chinese barefoot doctors are rice farmers. When you look at primary level of healthcare, it is first contact, secondary is first referral, tertiary is second referral. Which health center delivers primary level of healthcare? Suppose a question comes, which health center delivers primary level of healthcare? Yes, it is both PHC subcenter, CHC secondary, medical college hospital is tertiary. Then we have been asked whatever I am underlining, there is no shortcut here, friends. You have to know. So, can you quickly tell me what are the numbers for subcenter plain hilly, PHC plain hilly, CHC? This is 1 per 5,000, 1 per 3,000 subcenter, 30,000, 20,000 PHC, 1,20,000, 80,000 CHC. How many of you knew about all the six numbers correctly? How many of you knew about all the six numbers? Yes, Dr. Rekha, अमिताभ बच्चन तो आज बिल्कुल सिक्सर मार रहे हैं. Yes, so most of you remembered correct. Numbers 25,000 PHCs in the country. Beds at subcenter 0 to 2. Then we have 4 to 6 at PHC. And we have 30 bedded at CHC. Staff 3 to 4, 13 to 21, 46 to 52. Have a look at this table. High chances. Numbers, yes, subcenters are 1,55,000. Sorry, PHCs are 25,000. PHCs was asked. Let me underline this. And CHC, they are 5,500. 5,500. How do you divide subcenters as type A, type B? It is on the basis of delivery facility. It is present in type B. PHC, type A, type B is on the basis of deliveries per month up to 20, more than 20. Type A, type B. Arogya Mandir. Friends, one good thing is in last three papers of FMG, many questions have come logical. This question you can mark logically. Health and Wellness Center will not provide you with laundry services. Like you wash your own clothes when you do foreign medical graduation. When you get married, then also you'll have to wash it yourself. So nutrition, potable water, health services make sense. Different health programs which are covered through healthcare system, right? Okay. Grassroots level workers, start marking the answers I am underlining, the questions of your exam. These are 10-12 questions of your exam which have been asked in different papers. When we look at accredited social health activist, village, multi-purpose worker subcenter, village health guide TBA village, Anganwadi worker Anganwadi center. Population norm of ASHA. How many ASHA is for how much population, friends? 1 per 1,000 is not correct. That is the older answer. 2 per 1,000. 2 per village. MPW is per 5,000. Village we always take as 1,000. Anganwadi is for 400 to 800. What is the minimum educational qualification for ASHA? 10th. But if not available, it can be relaxed to 8th, 5th or even lower. MPW 12th. Village health guide 6th. And Anganwadi worker 10th. Training duration 23 day for ASHA, 1 month for TBA, 12 month MPW, 3 month VHG and 4 month Anganwadi. How many of you remember this whole table correctly? Not even a single mistake you have done while I was writing it. Okay, good. See, this should be the level of confidence you have to take inside the exam also, right? Okay. See, despite everything, one or two mistakes will occur in the paper. Don't worry. Target 200 plus so that you land up minimum 180 to 200, right? Usha, urban social health activist, is 1 per 1,000 to 2,500 population. Pharmacist, lab technician, 1 per 10,000. Health assistant at PHC, plains 30,000. Hilly areas, 20,000. So this is plain, this is hilly. Doctor population ratio already we have achieved in the country. Nurse population 3 nurses per 1 doctor. Ophthalmologist either 1 per 5 lakh population or 1 per 5 CHCs. These are minimum which are included. Now here doctor mean actually by the norm means allopathic only. By the norm here it means allopathic only, right? This is what I was saying. Shoot for the moon. Even if you miss a bit, you will land among the stars. Moon is 200 plus. Stars is clearing the exam. You have to score 150. But if you aim for 200, minimum you will score 180 to 190. Right? Health planning. 3 million plan. Who was 3 million planner? Bhor committee. He also gave four more recommendations which are asked in your exam. Primary health center 1 per 40,000, social physician, school health, comprehensive health care. Jangalwala committee, integration of health services, ban on private practice by government doctors, equal pay for equal work. Shri Vastava committee, Rome scheme, reorientation of medical education, village health guide, health assistant, referral services complex, bands of semi-professional and para-professional health workers, high-level expert group, universal health coverage, and 3.5 year rural graduate MBBS course, which is Bachelor of Rural Healthcare. Health management. What is cost effectiveness analysis, friends? Can you tell me? Yes, PSM internship of 3 months is social physicians. Dr. Deep, you are right. Cost effectiveness. What is effectiveness? No, this is not money. This is results. This is the mistake we have to prevent in the exam. When you look at money, that is cost benefit analysis. So, benefit is money, effectiveness is result. How do you measure cost effectiveness? Kelly, quality adjusted life year. Systems analysis. Anyone, friends? What is systems analysis? Yes, comparison of two or more cost effective alternatives. Sputum smear 90% correct, only 10 rupees. PCR 100% correct, 2000 per patient. So when we compare 10 rupees versus 2000 per patient, sputum smear 90% is very good as compared to 100%. We choose sputum smear in TB program. Network analysis, two parts, PERT and CPM. PERT is sequence of activities, program evaluation and review technique. CPM, critical path method. What is critical path, friends? Anyone? Longest, shortest, fastest. It is longest in terms of duration. Longest in terms of duration. Read the question. Management wants to know how much time each doctor is spending with patient. They want to decrease number of doctors as per requirement. Sampling to assess quality of work in a hospital. Work sampling. This is not focus group discussion, which is a round table. This is not systems analysis where we have PERT and CPM. Comparison of two or more cost effective alternatives. This is not network analysis where we have PERT and CPM. Work sampling. So learn the art of MCQ solving. Wrong options you should be able to exclude. Then you will arrive at the correct answer. Okay. Let's go word by word first. Can you tell me what is this diagram known as? First question. Diagram. Don't look at the question. Diagram. Good. This is sequence of activities part. Second part of network analysis is critical path. Critical is longest. Which is taking longest time? Equipment installation. Answer is A. Even if you knew that this is network analysis, you can mark the answer. You don't have to look at the second part of the question to find out critical path also. Instead of equipment, in the choices they used machinery. See, look at the diagram. Longest path is equipment installation. That becomes critical path. So this is your critical path method, right? Okay. International health. Identify agency number one which did nothing in COVID-19. That is World Health Organization, Geneva, Switzerland. Comfortably they were sitting. UNICEF is located in New York. Quickly, can you tell me WHO questions? Established, Constitution came into force. Established 1945, Constitution 7th April 1948. Therefore, 7th April is World Health Day. Can you quickly tell me anti-TB day? Anti-TB day. Anti-TB day, friends. Okay, everyone has forgotten. Dr. Rukku is right only. 24th of March. No tobacco day. No tobacco day is on 31st of May. World AIDS Day. World AIDS Day. 1st of December. Eye donation fortnight. 25th September to 25th August to first week of September. Breastfeeding Awareness Week. Breastfeeding Awareness Week. First week of August. Right. Applied Nutrition Program. What is the contribution of UNICEF? Applied Nutrition Program. What is the contribution of UNICEF? All of you are answering correctly in the chat box. Therefore, I am moving faster. Applied Nutrition Program. Yes, it provided seeds, manure to school children. UNICEF. What is C? Child Children Care Compassion. C is children. What is O in Gobi Triple F campaign? Growth monitoring, ORS, breastfeeding, immunization. What are these? What are these? Sustainable Development Goals. Definitely one question comes from Sustainable Development Goals given by target year, total goals. How many goals are directly health related? Given by United Nations to be achieved by December 31st, 2030. 17 goals. You can check. A total of 17 goals are there. But if you look carefully, only one goal is directly related to health. That is goal number 3. Target 3.1 and 2 parts of 3.2 come in your paper. MMR should be brought up to 70. Under 5 mortality rate 25. Neonatal mortality rate 12. Wonderful. All of you have memorized the answers correctly. That is so good to see. Can you tell me 6 category A bioterrorism agents? Don't look at notes. You don't have time. I'm asking so fast. Just think. It includes smallpox, which is most dangerous, most common anthrax, most lethal botulism. Beside this, we have plague, Yersinia pestis. Tularemia is caused by. Tularemia is caused by anyone? Micro, please integrate with PSM. Tularemia is caused by Francisella. And which viral hemorrhagic fevers are included in category A? Which viral hemorrhagic fevers are included? Ebola, Marburg, Lassa, brucellosis, glanders, melioidosis, psittacosis, food, water safety, Clostridium perfringens, epidemic typhus, Q fever, all toxin, ricin included, all poisonings, staph included, viral encephalitis. Category C, Nipah and Hanta. COVID-19 is not a bioterrorism agent, right? So 6 category A, 2 category C. You have to remember. What is BSL? biosafety labs. Based on how dangerous organisms you are dealing with in labs. Labs have been four categories: yellow, orange, dark orange, red. This logo is similar to logo of. This logo is similar to logo of biohazard. Biohazard, biomedical waste. See, first is not dangerous. You can directly go into the lab. Non-pathogenic strains of E. coli and staph. But now you need protective clothing when you look at Hep A, Hep B, Hep C, HIV, Salmonella, malaria. This is C, and then this is D. Two questions of your paper, three questions rather. First, I start with tuberculosis, latest question. Tuberculosis belongs to biosafety level 1, 2, 3, 4. Good. Tuberculosis is biosafety level 3. Ebola was asked. Ebola. Even if you think about Ebola, you can mark the correct answer. Category 4, it is most dangerous. Ebola, Marburg, Lassa, Hendra, Nipah, these are most dangerous. COVID-19 is in 2 also, 3 also. Which is a better answer for COVID-19? SARS-CoV-2, COVID-19, biosafety level 3. Right? Okay. Colombo plan. It has two contributions in Indian healthcare system. What is the answer? Some are saying PET scan unit, some are saying chemotherapy, some are saying cobalt therapy. Cobalt therapy. What is their other contribution to India? Establishment of AIMS at Delhi with the help of New Zealand. Establishment of AIMS at Delhi with the help of New Zealand. Immediately notifiable diseases are how many? Which diseases and within how much time? 4. You can remember the mnemonic PES within 24 hours. You have to notify polio, influenza, human influenza, wild polio, SARS, which does not occur, smallpox, which has been eradicated. Air travel in pregnancy is permitted up to 36 weeks period of gestation. Twin pregnancy 32 weeks. EDD must be carried after 28. EDD certificate must be carried after 28 weeks. Study of health of international travelers is known as very old question of FMG because all of you are international travelers. Therefore, they ask this question. Study of health of international travelers. Emporiatrics. Twins, it is 32 weeks. For twin pregnancy, 32 weeks. Emporiatrics. Biomedical waste. Can you identify logo 1, 2, 3? Logo 1. Biomedical waste. Biohazard. Generally for any type of hospital infectious waste. Number 2. Radiation hazard symbol. X-ray lab, CT scan lab. What is the radius of the inner circle? What is the radius of the outer circle? Inner circle 1.5 r, outer circle 5 r. Angle subtended between the three leaves 60 degree each. So your examiner asks such questions, we cannot help it. Third is recycling. Can you tell me, friends, now what is this a logo of? This. It appeared as one of the choices. This is a logo of flood hazard. So what is the answer to the question given now? A. You can see biohazard, right? So others we have discussed. Mercury spills. What will you do? Mercury spills. What will you do, friends? If paper or cardboard is not there, you can use plastic syringe. Remove the needle, use the plastic syringe. Put it in any cup, container, bottle, plastic which contains water. And what is the final disposal mechanism? Where will you send it by? 3R. Recollect, final disposal mechanism, recycle, reuse. Can you tell me, besides mercury, what else is recycled in India? Besides mercury, what is recycled? Now tell me the color of the bag. Color of the bag. It is blue bag. And also e-waste, electronic waste. Cotton swab, pus stained, yellow category. Then examiner thought, let me confuse FMG students. Cotton swab, yellow, non-chlorinated. Chlorinated bags are no longer used. They contain dioxins, furans. They are not used. Banned since 2018 now. So yellow, non-chlorinated. Blue. Which waste goes into blue? Which waste goes into blue? Two types of waste. Yes, glass and metallic implants. Pacemaker was asked. Final disposal mechanism, recycle. Red bag. Which waste goes in red bag? It is contaminated recyclable plastic rubber waste. Final disposal mechanism of red bag. After autoclaving, hydroclaving, microwaving, destruction, shredding, it is sent for road making. What goes into white puncture proof container? Blue is cardboard box, white is plastic. Waste sharp. After you do autoclaving, dry heat, then shredding, destruction, final disposal mechanism. Iron foundry is good. All other waste goes into yellow. So can you list which waste goes into yellow? Anatomical waste, animal waste, soiled waste, chemical waste, cytotoxic drug discarded medicines, liquid waste, microbiological, biotechnological, bed linen and mattresses. All waste except liquid. Final disposal mechanism of yellow. Incineration. Eurobag. Eurobag. Eurobag will go into red. Eurobag containing blood. Eurobag containing blood. Yellow. Vacutainer. Vacutainer. Vacutainer goes into red. Placenta after delivery. Placenta after delivery. Placenta after delivery cannot be incinerated at a PHC. So we go for deep burial. Dr. Shardul is right. Read the question. She has used cotton syringe needle. Which is the correct statement? Yes, even if you know your PYQ, your answer is done. Others are not correct because syringe goes into white plastic. Sorry, syringe goes into plastic red. The needle metallic part goes into white. What is the use of black? It is for municipal waste, not in biomedical waste. Vial is glass, goes into blue. Syringe goes into red. Right? Okay. So biomedical waste management. Incineration temperature principle. 1200 high temperature dry oxidation. Autoclaving 121 15 minute, sorry, 15 psi 45 minute. Steam under pressure. Hydroclaving is at 132. How do you check sufficiency of autoclaving and hydroclaving? Popular question of FMG. Autoclaving, Geobacillus styrothermophilus. Hydroclaving, Bacillus subtilis. Geobacillus styrothermophilus spores are used for autoclaving. Hydroclaving spores of Bacillus subtilis. Good. FMG favorite topic. How can you convert large volume of toxic waste directly into non-toxic? No, 15 minutes is wrong. India, we take two types of autoclaves in hospital, gravity or vacuum. 45 minutes is minimum. 15 तो बहुत पुराना concept है. We have inertization. Please be careful. It's not incineration. We are making the material inert. What do we add for inertization? Inertization. Yes, good. 15% cement, 15% lime, mix 65% biomedical waste, 5% water. So you have to become like a Dexter to complete this process. So 15% cement, 15% lime, 65% biomedical waste, 5% of water. Disaster management. Read the question. Example I had taught you, by chance question came on the same example. Ensure structures can withstand earthquake. This is mitigation, prevention of conversion of hazard or risk into disaster. Arrange disaster cycle in sequence. Although it has more steps, but they only used 4 steps in the choices. We cannot help it. It is a PYQ. 100% of you is right. First, impact, response, rehabilitation, mitigation. Now, can you mark side by side this answer also? Recovery phase of disaster is by the mnemonic. I told you RRR. 3R. Response, rehabilitation, reconstruction. Basically, you have to memorize this diagram. Recovery phase is having 3 components. RRR. It is risk reduction phase, which is having mitigation preparedness. So best is to memorize this diagram correctly. Memorize this diagram correctly, right? Try this categorization of, can I say types of disasters? No. It is victims of disaster. It is based on, can I say severity of injury of the person who is affected by the earthquake or disaster? Is it based on severity of injury? Answer is strictly no. It is on likelihood of survival. When we look at red, highest priority, it includes patients who require immediate resuscitation or limb oblique life-saving surgery in 0 to 6 hours. If you don't do the surgery immediately, person will die or some serious complication will occur. Resuscitation surgery, but patient can wait for 6 to 24 hours. High priority yellow, green, minor injury. So what is the characteristic of these patients? They are ambulatory. They can walk from one place to another. And black includes dead and moribund patients. Moribund patients are about to die. Now, friends, always this classification used to come directly. Last 2 papers, what they have done, they will describe a patient or a victim, and then they will ask you where to classify. If you have to take immediate action, red. Big injury, but you can wait, yellow. Ambulatory minor injury, green. Pelvic crush injury, severe injury, you cannot save the person, moribund. You have to remember. Look at this question. Severe swelling on foot, painful laceration. It will go into. See, already we are getting different answers. How it is possible, friends? This is yellow. If I add in this list severe swelling on foot, painful laceration, massive blood loss, she is going into shock. It will become red. Third question, swelling on foot with a laceration, small, but she is able to walk, green. So depending on the language of the question, wonderful, this is how you have to classify the patient. Very nice. Most common disease after a disaster: acute gastroenteritis, diarrhea, typhoid, cholera. Most common vitamin deficiency: xerophthalmia, more common than pellagra or scurvy. Vaccination is contraindicated, especially typhoid, cholera, tetanus, but these three are mandatory in doctors: typhoid, cholera, tetanus. And what do we give actually to the population is only exception in contraindication is measles because it can form protection faster. Most important preliminary step: chlorination level of restore should be 0.7 minimum. Genetics. Can you identify this law? Then I will ask you questions. Good. Hardy-Weinberg law. First question, what is the definition? It is a law of population genetics which say frequency of genes remain constant from one generation to another. It is applicable on three conditions: large population, static population, random mating. Any other situation it is not applicable. Small population, dynamic, non-random mating, assortative, selective mating, gene drift, gene flow, mutation, Charles Darwin's natural selection theory, and migration. Its mathematical formula is a square plus b square is a square b square plus 2ab. 2ab तो आप जानते ही हो. All of us are 2ab actually. What is this second diagram? This is Punnett square. What is the use of Punnett square in public health? What do we come to know through Punnett square? Yes, absolutely. In Mendelian crossbreeding experiments, you can predict the genotype of offspring. तो अगर आप सोचो राखी सावंत हो एक तरफ और रणवीर कपूर हो एक तरफ, तो predicting the genotype of offspring is the role of Punnett square, right? Okay. So this we have discussed. Can you tell me what is the answer to this question? Universal donor, O negative. Who is universal recipient? Who is universal recipient? AB positive. Mental health. Most common mental health disorder in India, besides pursuing medicine, is depression, unipolar, bipolar. Is unipolar. Followed by number 2 is alcohol disorders. Number 3 is schizophrenia. Number 4 is bipolar. Most common substance abused, which FMGs never use, tobacco. Most common narcotic substance abused, cannabis, which as FMGs never use. They are so busy with diacetyl morphine. So this is tobacco and cannabis, commonest substance and narcotic. Suicide rate in India per 1 lakh population 1 year, 12.4. Most common mode as we read in newspapers, movie stars, when we come to know, yes, it has reduced, but I'm not changing the value. It is hanging. So it has reduced, yes, to less than 12.4, but not yet appeared in any book. Hanging. They'll not give very close choices, don't worry. They'll give far off choices. Biostats. New question. Nominal scale. Answer lies in the word itself, norm. Ordinal scale as order, metric scale as measurement. So if it is based on names, order, measurement. Which scale should be used for weight, height, hemoglobin? Weight, height, hemoglobin, blood sugar, serum cholesterol, BMI, mid-arm circumference, degree Celsius temperature, everything goes into metric. Sex of a newborn child, nominal, ABO blood group, RH, any disease, TNM staging of cancer, TNM staging cancer is ordinal. TNM staging of cancer is ordinal. Now read this question. All are nominal scale except क्या होना चाहिए? Why D? Because this is nominal. Do you have pain? Yes or no? What is your vaccination status? Done or not? Gender, male, female, transgender. Severity, mild, moderate, severe. An order is present. Right. This is the formula of standard deviation. How can 100% of you be wrong? How can 100% of you be wrong? Are you not looking at this also? This is chi-square. एग्जाम में गलती नहीं करनी है. Standard deviation is RMST. Value minus mean value. Deviation, squares of deviation, total sum by sample size. Mean of squares of deviation under the root. Root of mean of square of deviation. This is your standard deviation. Question asked was chi-square. Chi-square. This is, what is this, friends? Histogram. Which type of data is represented in histogram? Can you mark? Continuous quantitative data, right? This is frequency polygon because you can see a polygon is constructed by joining straight lines. So this will become frequency curve. So all three have same data, plain histogram, polygon constructed on top of histogram, curve constructed on top of histogram. These are line chart. What is the main use of line chart? It is used for dash. Complete the answer. Popular question of FMG trend. Right? Okay. This is scatter diagram. What does it tell you? Correlation. If you look at upper two diagrams, they are different from lower two diagrams. Upper diagram line has a positive slope. Positive correlation. Correlation coefficient R lies between. In positive correlation, correlation coefficient R lies between 0 to +1. Look at bottom two graphs. Both have negative slope, negative correlation. If you increase one variable, other will decrease. R will lie between -1 to 0. Look at the middle graph. Change in one does not lead to change in another. No correlation, absent correlation. R will lie between. R will be exactly 0. These are the three possibilities in any relationship. When you do a study, if you increase one variable, other may increase, decrease, or remain same. Therefore, overall, R lies between. Yes, Dr. Upali is right. -1 to plus 1, minus 1 to plus 1. These are bar chart. Bar chart is of three types. Look at first one, simple. Second is frequently asked in your paper, component. Third is multiple. How do you identify it is not a histogram, it is a bar chart, friends? How do we identify? There is gap between the bars. Can you answer this question in statistical language? This is discontinuous, discrete, qualitative data. So non-continuous or discontinuous is known as discrete data. Discrete qualitative data. Component is asked in your FMG papers. This is pie chart. Is it the ideal diagram to teach balanced diet to a female or family with low literacy? Yes. Is this pie chart of balanced diet showing correct proportion? Is this pie chart showing correct proportion? Yes. Proteins should be roughly 10 to 15%. Fat should be 15 to 30, and rest 50 to 70% should be carbohydrates. So approximately it is showing correctly, right? Okay. Calculate now. You are allowed to use mobile calculator because online calculators are given in your exam. So just start calculating. Mean is sum by number of observation. Total observations are 6. What is the total sum? Total sum 46 plus 48, 300. So mean comes 50. Median is middle value in ascending order. Here you have two middle values. What will you do if you have two middle values? Take its average. Mode is most frequent value. Look carefully. All three are 50. Can you interpret this data? Good, Dr. Malvika is right. It is normal distribution where mean, median, mode coincide. All three are equal. Normal distribution, how many values lie within one standard deviation? Mean plus minus one standard deviation, plus minus two standard deviation, plus minus 3. 68.3, 95.4, 99.7. Choice number A. One standard deviation 68%, 2 covers 95, 3 covers 99. Shape of this normal distribution. Bilaterally symmetrical, bell shaped. Central tendency coincide. Formula we have discussed, right? Okay. Now calculate. Let us check our calculation. Please calculate all the three. 68% will lie between dash and dash. 95% will lie between dash and dash. 99% will lie between dash and dash. Look carefully. In this question, your mean is 105, standard deviation is 10. So when we look at 68%, mean plus minus 1 standard deviation, 105 plus minus 1 into 10. So 95 to 115. Mean plus minus 2 standard deviation, 95%. 105 plus minus 2 into 10, 105 plus minus 20, 85 to 125. 3 standard deviation. Mean plus minus 105 plus minus 3 into 10, 105 plus minus 30. This is 75, 135. They have asked 95%. Answer is B. How many of you got this answer correct? This is how exactly question will come in your paper, friends. You will have no option of using a rough sheet. You'll have to think in your mind, but online calculators are there if you require. That should be kept in mind. This is standard deviation, most commonly used type of dispersion. Can you tell me relative deviate formula? Z score. Let's see how many of us remember. Relative deviate Z score formula. Yes, Dr. Dhananjay is right. X minus mu upon sigma. Given value minus mean value divided by standard deviation. Right? Okay, good. P value is actually type 1 error. Its maximum threshold is alpha. Alpha is globally taken to be 5%. So P value should be less than alpha to make it significant. So popular question of your paper, if you can keep your error below 5%, okay, sorry, read the name wrongly. It's not Dhananjay, it is Dr. Dhania. Okay. What is the adulterant of Dhania? Anyone? What is the adulterant of Dhania? Older FMG question, very old FMG question. Adulterant. पुदीना कैसे हो सकता है भाई? Dr. Asif is right. Cow dung used to be the adulterant of coriander powder in the country, right? So within 5 minutes, you'll see now he'll change his name, right? Okay. P value is significant if it is less than 5%, 5 by 100, 0.05, 0.05. When do we have type 1 error, friends? When do we have type 1 errors? What should be the answer? Type 1 error. Definition. No, definition. It is given by p value. I need the definition. Dr. Ellison is right. Null hypothesis true, but based on our study results, it is rejected. Null hypothesis is true. Based on our study results, it is rejected. Right? Okay. Statistical test. Statistical test. Look at the keyword mean weight. You are comparing in two different groups. Which test of significance we will use? This is unpaired student t-test. Paired is used when you compare means in one group of people before after. Paired data before and after an intervention. Unpaired is used when you compare means in two groups. ANOVA is used when you compare means in three or more groups. Sign test is used when you compare percentage or fractions in one group. And chi-square is used when you compare percentage fractions in two or more groups. One group always is before after paired data. I hope this concept is absolutely clear because you will be asked to identify the test. Trick वही है paired, unpaired ANOVA. One group, two group, three or more groups. This is when mean is given. If percentage or fraction is given, one group sign, two or more groups chi-square. These five you have to remember, right? Okay. So friends, that brings us to the end of today's session. Thank you so much for giving your time. This is the fastest we could have gone. I wanted to cover everything as much as possible in the 5 hours allotted to us. And I hope we have covered almost everything. Exam, don't get disappointed. If there will be around 30 to 35 questions in your paper from PSM, 25 minimum you have to attempt correctly. There is no shortcut. If there are 30, 25. If there are 35, 28 to 29, you have to attempt correctly. That should be kept in mind. Do not think too much. Next 5 days, keep your mind relaxed. I know it is easy to say. Keep on studying. Keep your brain engaged in something. Do one liners, do late night PYQ sessions, give older GTs, revise your notes, look at your weaker subjects. If you get bored, shift to questions. Get bored, shift to your stronger subjects. Idea is to 5 days keep your brain in an active mode. Active mode. Yes, what I will do is I will share the PDF right now and I'll ask the team to share also right now. But you have done everything today almost on YouTube also or in the app also. 100% of students were giving almost correct answers everywhere. So that means you are well prepared with PSM. What I will suggest, any weak topic you have in any subject that you can practice over next 1 or 2 days. But keep on doing a mixture of all the 19 subjects over next 5 days. Next 5 days. Liquid waste. That is for liquid waste, Dr. Rohit, not chemical. Liquid waste is treated and thrown into drain. Bhulna is normal, Dr. Das. Anyone has any question, you can ask. I am looking at this YouTube also. Thank you, Dr. Prayag Paneri. Recent toxin is category B. Recent toxin is category B. Bioterrorism agent. पास तो आप सब हो ही जाओगे, उसमें सोचना क्या है, बस अगले 5 days पढ़ते रहना. Yes, all of us will meet at Seribelham. This time we are going to book a stadium. Looking at the group sizes in our FMG batches and the number of students who are going to clear the exam, we know is going to be huge. Keep on studying. There is no shortcut to success. All of us know. आशीर्वाद सबके साथ है दोस्तों. Earlier we used to have classes in auditoriums. This is Gautam Nagar Father Ignal School. When we used to have classes, now we have shifted to online. It becomes easy to cover more number of students. Now students are scoring higher in the exam also, right? Write it on your board. No need to WhatsApp. If you want, you can WhatsApp me also. I'll store it. That you are going to maintain your focus till the last minute of the exam. Your exam is on 17th January, right? I've written the date correctly. Just maintain the focus till the last minute. Don't fall into any FOMO. You have done enough. Whatever you have done till now, just keep on revising. Don't take anything new in next 4 days. Don't fall into FOMO. That should be kept in mind. Good luck. Owls are considered very good for luck. So I wish all of you clear the exam. Let this time result be 70, 80, 90%. Even if it is not, let us say result is 30, 40%. Make sure you are in that 30-40%. बाकियों से फर्क नहीं पड़ता. That should be kept in mind. इस वक्त स्कोर्स को मत देखो, ना जीटी के ना लेट नाइट पीवाईक्यू के. नाउ इज द टाइम टू प्रैक्टिस. टाइम टू प्रैक्टिस एज मेनी एज पॉसिबल. So keep on studying. Best of luck, dil se. Any question you have, you can ask right now also. Yes, Dr. Ankit Prajapati, I'm 100% sure you'll crack exam with a very good score this time. Dr. Love Kiledar, thank you so much for being a part of this session. Notes revision or questions, what I will suggest, friends, make a mixture of that. Make a mixture of that. I'll ask team if it is possible, tech team. If it can increase to 75. Thank you, Dr. Rupali, for being a part of this session. एग्जाम देने के बाद थोड़ा ब्रेक ले लेना. टेक रेस्ट. एंजॉय टाइम विद योर फ्रेंड्स एंड फैमिली. उसके बाद टाइम नहीं मिलेगा. Once you clear the exam, you'll be running around for PG and other problems. Okay, best wishes, Dr. Humanit. See, why I'm not able to reply to every message on the app also? Because so many students are there when they write, na, Messages on my screen scroll like this very fast. So many messages I have to miss. I cannot help it. Cerebellum will be after your FMG result. We are waiting for FMG result. After that, PDF is enough. Yes, if you have attended all the classes, just revise from wherever you have attended the classes. Paper will be like mock. Paper will be like mock. See you in Cerebellum, Dr. Kapil, Dr. Rupali, Dr. Ingadam, Dr. Akriti. Yes, I will remember your name, Dr. Neeraj, Dr. Amitabh Bachchan also. Dr. Humanit, please contact Cerebellum team. You can write a mail. I think they should help. Numericals के लिए what I will suggest is go through formulas once. Take a rough sheet side. First write formulae without looking at the notes. If you can look at those 10-20 formulae. Epidemiology, biostats, demography, MCH indicator. Easily it is solvable. Yes, Dr. Tanu, I will remember you. Don't worry. Thank you, Dr. Nandarani. Sorry, your names are moving so fast. I'm missing almost so many names. Yes, my prayers, my ashirwad, my best wishes, best luck is with you. You have to just maintain your focus. No one can stop me from clearing the exam. Just think about this. I have come so far. I have put in so much effort. I have to clear. बचा ही नहीं है कुछ. See you soon. Aishwarya Rai Bachchan is telling me see you soon. Abhishek will be worried. Okay, धन्यवाद. Thank you. Definitely we will meet soon at Cerebellum. Otherwise भी मिलेंगे. Those of you who live in Delhi, most welcome at my home in Pitampura, Delhi. Whenever you are free, most welcome. Narendra Modi is asking my address. Address I will share on WhatsApp with you. Narendra Modi ji is flying kites today. Happy Makar Sankranti, everyone. Yes, 16th. I will try to come live on app. 16th we have meetings. Cerebellum, all the founders have multiple meetings. But we will come on. ऐसा तो हो नहीं सकता कि हम ना आए. We will definitely come. Mock 2 और 3 दोनों कर लो. Mock test 2 also, 3 also. What to do in 2.5 hour break in exam? Don't talk to your friends. Do whatever. Don't talk to your friends. Take some notes where you can revise multiple subjects just to pass time. You know everything, but just to pass time. Don't talk to your friends, honestly. Yes, we will definitely meet. I also want to meet you. I have traveled 3 times in December. Everywhere I was meeting students non-stop. All the airports, I was transiting through multiple airports. FMG students, PG students, everywhere you find. I met a student who was a former FMG student, now doing PG at AIMS Rishikesh also. So this is another something that we should take home. Ki FMG is easy. The moment we clear, we have to look at PG also. Right? I shared on social media also. His wife, also a practicing doctor, was a former FMG student of mine. So this is what I want to see. All of you clear the exam. We'll meet again. Don't worry about anything else of now. गिविंग एग्जाम विद 100% एफर्ट इज इंपॉर्टेंट. रिजल्ट मायने ही नहीं रखता. रिजल्ट से फर्क ही नहीं पड़ता. उस वक्त देखेंगे जब रिजल्ट आएगा. अभी आप सिर्फ एग्जाम को ऐसा दे दो कि वंस यू कम आउट ऑफ द एग्जामिनेशन हॉल यू से इससे ज्यादा मैं कर ही नहीं सकता था या कर ही नहीं सकती थी. दैट शुड बी. यस डॉक्टर शंकर द ट्रिप वॉज अमेजिंग. आई हैव बीन टू उज्जैन ऑल्सो, सोमनाथ ऑल्सो इन लास्ट 3 weeks. आई कवर्ड बोथ द ज्योतिर्लिंग्स. Don't worry if some slot in the paper goes wrong. Just imagine how many slots of your questions are there in the paper. 6 slots. Out of 6, mostly students do 3 very good, 2 average, 1 bad. So even if you are doing 2 to 4 average, easily you will clear the exam. Trust me. Trust me. आशीर्वाद हमेशा है डॉक्टर शंकर. You will definitely clear the exam. Thank you. Keep on studying. Keep on working hard. YouTube friends also, please keep on revising. Don't waste time. Next 4-5 days, if you just do. Samir Raina, yes, he's my favorite. Samir Raina, I attended his show in Delhi. It was crazy in his own world. In his own words, crazy, crazy, crazy. 2 hours he spoke non-stop. I've never seen such a person who can engage 12,000 people in a single go. Amazing. No other comedian is even close to him. No other comedian. All were looking kids when he was speaking on the stage. So this is how you should become like a doctor. Everyone's one should look at you. मी एंड फैन ऑफ कुणाल कामरा रहने देते हैं भाई. मेरी नहीं बन सकती उससे. राइट. ओके. Your phones, whether you can bring or not to the center, you will have to ask from your seniors and also look at the prospectus. I think they'll tell you whether they deposit the phones outside. I think phones, friends, can anyone suggest? A friend is asking. No, at the center, when you take the phone, what do they do with the phones? They keep it in lockers or you have to take care? Yes, you can deposit. Yes, you can deposit outside. No lockers are there. Why take a risk with jewelry? Do not take jewelry. See, I was at an examination center recently, not for FMG, but for some other exam. All the boys, girls who were having jewelry, they were struggling because they had no place to keep those gold jewelry and they were asking that please take off. So that was at a problem. Mobile bags won't make a difference even if God forbid someone loses. But why take mobile this gold jewelry or too much of a cash, right? क्यों लेके जाना है? Vladimir Putin is asking ज्वेलरी लेकर ही क्यों जाना है? Trump will ask you very soon this question, Vladimir Putin. Depends on the center. At few centers I've seen, they create provision on a paid basis or unpaid basis for keeping the bags, but depends on the center. Adolf Hitler is also there in the chat box today. Cover yourself well. If you are in Delhi or North India, winters are good. Okay, 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 going. Not too good, but it is there. Cover yourself well. Yes, Dr. Rushi, we will meet at Cerebell Hum. Donald Trump is there. Modi, everyone is there. Raftar is also here. This I don't know whether they will allow jacket or not. I don't think they should refuse. Thank you so much, Dr. Abhi. Yes, we will definitely meet after the exam. PYQ seems so easy. END are hard because PYQ is actual exam. END GT is to help you cover extra things. PYQ जैसा ही exam आएगा. Water bottle I've seen it is center wise. Most of the centers they allow. In some they don't allow. Mostly they allow, but in many they don't allow at all. Right? But they will provide. Water is there at most of the centers. Just check in the prospectus what minimum you have to carry. Just check in your admit card what minimum you have to carry. Those things you cannot miss. One of our friend is suggesting brain. हाँ brain जरूर लेके जाना. छोड़ मत जाना. डॉक्टर अली आई विल कम टू सिवान आफ्टर योर एग्जाम. आपको मेरा वहां पे काम करवाना है. सिवान में वर्क पेंडिंग है काफी सालों से करना है मुझे इसे. Yes, camera is there. Friends, what I will suggest in the exam, do not look too much sideways. Camera is without sound. When a student is looking too much sideways, they make a presumption student is cheating. Look straight while attempting the exam. Students have received legal notices also only for this, and their result has been withheld. So too much movement should not be there. Freeze like a dummy and just keep on looking at your screen and attempting the paper. Ahmedabad, I was there last week. First week of January, I was there. Ahmedabad and Dio, I was there. Yes, few centers have camera on monitor also. That makes it even more risky. You should look at the monitor only. Consider monitor as your boyfriend, girlfriend during the exam. 100% dedication. It's not that December is easier than July. Both exams are same. No change in result in any of the exams. Absolutely same. Yes, I have been to all the mountains in the country, almost all Northeast, Uttaranchal, all almost Himachal also. Yes, we will meet definitely in Cerebellum. Yes, thank you, Dr. Ankit Prajapati. Next time I'm in Ahmedabad, definitely I will let you know. Yes, all of you use such wonderful names. Why do you want to hide your name which your parents have given, which are such wonderful names? Why do you want to hide those names? In app also, in YouTube also, such strange names are appearing. All the world political leaders are attending PSM today. Rajkot, I've been there multiple times, Dr. Dhananjay, for classes. Let us see if next time it works out. Okay, Dr. Vipul Pandey, all the best. Udaipur, I was there last year. Udaipur, I was there last year. Yeah, WhatsApp, I'm not able to reply to all because I'm getting now 200 to 400 messages per day. Mostly I'm in class or meetings or cerebellum work. I hardly get time to check WhatsApp. Maybe 10-15 messages I'm able to reply. Cerebellum के ही कम से कम 200 ग्रुप बने हुए हैं मेरे with the staff and the faculty and the other people. Okay, center name. Have you got your center names? Friends, have you got your center names? Breast milk is richer in lactose, iron, water, calcium, phosphorus ratio. Cow's milk is richer in protein, fats, energy, and absolute amount of calcium, phosphorus. Okay, only cities have been given. 14th it will come. Okay, Dr. Tanu is saying Noida. Okay. I think friends, what they are doing, not just your exam, all the exams of India, they give the city, then they allot you randomly in that city. Maybe some examination centers, there are some others trainings, others examination centers. I don't know how it will come. किस ऑप्शन में तुक्का मारना है जिसमें आपको चारों के बारे में कुछ नहीं पता. If you have no idea about the four choices, make a random guess. But if you have doubt between two or three, give some time. Go by your first hunch. Go by your first hunch. कोई ऑप्शन बेस्ट नहीं होती तुक्के के लिए. रैंडमाइज करके बनाई जाती है चॉइसेस भी एग्जाम में, तो सबका इक्वल चांस होता है. ओके, आयोन टीसीएस सेंटर. ओके, लेंदी आंसर ऑलवेज करेक्ट नहीं होता. सेंटर बहुत दूर दिया है यार. दिस इज अ प्रॉब्लम. बट आई थिंक नेशनल बोर्ड के पास भी प्रॉब्लम है. दे कीप ऑन अलॉटिंग. आई डोंट नो इन व्हाट सीक्वेंस दे अलॉट. So 80-90% of the students they are able to allot properly, but 10-20% students have to always struggle. This time, Dr. Asif, you will clear with more than 180 marks. Break में Dr. Akriti, don't talk to other students much. Better is if you are having some notes with you, just go through it. You have to pass the time. You know everything. Just pass the time. If you are having multiple notes, read through 2-3 topics. Goodbye, Dr. Rohit Sharma. You played well yesterday in the match also. But थोड़ा और लंबी इनिंग्स खेलो. Dr. Chandrasekhar, you will also pass the exam easily. Dr. Jaya Bachchan is asking, कानपुर में किसका है सेंटर? जया बच्चन जी, आपको तो कोई भी रिप्लाई नहीं करेगा. अमिताभ बच्चन विल ऑल्सो नॉट रिप्लाई, वोंट रिप्लाई. ऐश्वर्या इज लाफिंग. शी अंडरस्टैंड्स. डॉक्टर अमर, डोंट वरी, यू विल इजिली स्कोर अबव 180 दिस टाइम. ओके, डॉक्टर अर्पित हैज अ सेंटर इन गोवा. एंजॉय भाई, एग्जाम दो. गो टू बागा बीच, एंजॉय. एग्जाम देने के बाद ब्रेक में नहीं जाना है. 190 plus is a very good score you have been getting in mock. Maintain it till exam last minute. Yes, blessings are always there, Dr. Astha. All of you should talk to your parents the night prior. Their blessings are equally important, rather more important. Okay, Rolex is saying we'll both wear Rolexes in cerebellum. ठीक है, done. See you, Dr. Astha. All of you just relax. Keep your mind relaxed. Keep on reading for next 4 5 days. Try to see how much you can concentrate. It's okay. But try to sleep, maintain diet, maintain hydration. Dr. Malvika, all the best. See you soon, Bat Panther. Dr. Nishant Pandey, see you. Yes, if you we are sure you are coming with good result, we'll have to actually book a very big auditorium. Let's see how much group size this time. Don't worry, Dr. Shubham, for next 4 5 days, just keep on practicing questions and notes. Make a mix of notes plus questions. It should help. Yes, Dr. Aftar, first attempt is also a very good attempt. Most of the students actually passed in first. So just have confidence on yourself. GT, yes, you can give. YouTube, you're asking. GT, yes, you can give. You have 4 days. Try to give at least 2 more if you have given only one GT. सब्सटेंस नहीं मिलेगा पार्टी में. सब्सटेंस नहीं मिलेगा. डॉक्टर अमित पांडे. पांडे जी अभी से सब्सटेंस के बारे में सोच रहे हैं. मॉक 3 219. भाई मेंटेन इट इजिली. विल क्रॉस 200 इन FMG ऑल्सो. थैंक यू डॉक्टर प्रज्वल सिंह. यू विल स्कोर गुड. बेस्ट विशेष. जस्ट ट्राई टू स्टे रिलैक्स्ड. 5 10 क्वेश्चन लाइन से गलत भी हो जाएं. रिमाइंड योर सेल्फ देर आर 300 क्वेश्चन इन द पेपर. देर विल बी 20 25 क्वेश्चन इन अ गो जो आपके सही होंगे. टाइम मैनेजमेंट, टाइमर आपके सामने होगा, आपको ध्यान रखना है. राइट, स्लॉट ऑटोमेटिक सबमिट हो जाता है तो उससे पहले करते जाओ क्वेश्चंस. बहुत ज्यादा सोचना मत कि लास्ट में करूंगा. तो स्लॉट वाइज जब सबमिट होते जाए स्लॉट में टाइम वाइज करते रहना. फूड सजेशंस ऑन एग्जाम डे. डू नॉट गो फॉर वेरी हैवी फूड लाइक छोले भटूरे इन द मॉर्निंग. ड्राउजीनेस होगी, नींद आएगी. Regular food that you eat on a daily basis. PDF, yes, I will. The moment we shut down the session, I will share the annotated PDF with the team. It will be shared in the Telegram group also immediately. I'll call them up. Yes, Doc Sab, that is really good. यार सेरिबेल हम में पेरेंट्स अलाउड नहीं है डॉक्टर जोशी. बिकॉज देन इट बिकम्स डिफिकल्ट टू मैनेज. बिकॉज वी आर हैविंग सो मेनी स्टूडेंट्स. विथ पेरेंट्स इट बिकम्स डिफिकल्ट इन Delhi. With Delhi it's very difficult. Parents will meet separately. कुछ भी खाओ यार, except cannabis, eat anything. चलो, I think this is time for you to now go back, study. I think you have a session at 7 o'clock, if I'm not wrong, with Dr. Gaurav Nagpal sir. You can watch recall also. Make a mix. If you're getting confused next 3 4 days, notes plus marathon video you can watch at a faster speed. Do some PYQs. क्वेश्चंस करते रहो. इट विल गिव यू कॉन्फिडेंस कि एक्चुअल एग्जाम इज क्वेश्चन बेस्ड. आई एम गोइंग ऑल ऑफ देम. डॉक्टर जायद, दैट इज अ वंडरफुल स्कोर. मेंटेन द मोमेंटम टिल द एग्जाम. आई एम इन यंग एज ओनली डॉक्टर शिवा. डॉक्टर गणेश, यू विल क्लियर द एग्जाम इजिली. आपके पास इतना टाइम नहीं होगा कि अब आप लैब 1 के पूरे पीडीएफ रिवाइज कर पाओ. लेकिन कोई वीकर सब्जेक्ट होता तो उसको फटाफट फ्लिप कर सकते हो. शॉर्टर सब्जेक्ट्स में कर सकते हो. मे बी नॉट फॉर द बिगर सब्जेक्ट्स. यस, डॉक्टर अंकित प्रजापति, 193 इज वेरी गुड. कंटिन्यू, मेंटेन द मोमेंटम. मेंटेन द मोमेंटम. ओके फ्रेंड्स, बाय बाय, टेक केयर. एग्जाम अच्छा करना. बेस्ट विशेस, आशीर्वाद दिल से, शुभकामनाएं. टॉक टू योर पेरेंट्स द नाइट बिफोर. हैव कॉन्फिडेंस इन योर सेल्फ. कुछ क्वेश्चन गलत जाते हैं तो टेंशन नहीं लेना. रिमाइंड योर सेल्फ, इतना पढ़ा है, कितने ही क्वेश्चन गलत हो जाएंगे. राइट. सो कितने भी गलत हो जाएं, इजिली विल स्कोर 180 to 200 इन द पेपर. टेक दैट थॉट इनटू द एग्जाम। एग्जाम खत्म होने के बाद जो मर्जी सोचो, बट एग्जाम के लास्ट मिनट तक बनाए रखना है। एवरी मार्क मैटर्स। सो फ्रेंड्स, थैंक यू सो मच, टेक केयर, बाय बाय, ऑल द बेस्ट, जल्दी मिलेंगे। See you at Cerebellum. Best wishes from me, Dr. Vivek Jain, Team Cerebellum also. Stay on course, keep on studying. Wish best of luck to all of you right from Dil se. Thank you, friends.
हेलो, हैप्पी न्यू ईयर, गुड इवनिंग। सॉरी यार, बहुत लेट हो गया। आई नो वी लॉस्ट 15 मिनट्स। हेलो हेलो हेलो, हैप्पी न्यू ईयर, हैप्पी न्यू ईयर। सुबह के चाय, गुड मॉर्निंग चाय, गुड मॉर्निंग टी टू एवरीवन। ठीक है, लेट अस स्टार्ट। लॉट ऑफ गुड इवनिंग, वेरी सॉरी। ओ हैप्पी बर्थडे आपको भी, हैप्पी बर्थडे हरिवंश राय बच्चन जी। कौन सी विस्की चाय पी रहा हूँ यार, भागते भागते आया हूँ। चलो चलो चलो, जल्दी आ जाओ, फटाफट करेंगे। हाँ, somebody was saying कि please take the high value topics first and ये वो करके। बेटा, all topics are high value topics. Important is we have to cover whatever possible। ठीक है, चलो आ जाओ जल्दी। हाँ, प्रीवियस टॉपिक जल्दी छोड़ देना सर। जल्दी कैसे छोड़ दूं यार। हाँ, जोगा जगराता, हाँ ये हुई ना बात, आज जोगा जगराता। दैट इज द एब्सोल्यूट टर्म। चलो लेट अस स्टार्ट। ठीक है, इनफ फैंकी फैंकी, बहुत देर हो गई। सोचा था चाय का भी एक वो बिस्किट चाय का एक मेम डालेंगे, ना टाइम मिला ना कुछ। एक्चुअली आई केम बैक फ्रॉम वेकेशन, सो लॉट ऑफ पेशेंस टुडे। वाज एब्सोल्युटली लास्ट में बिल्कुल मना ही करना पड़ा। सेम पीडीएफ है लैपटॉप वाली, यस, बिल्कुल सब कुछ सेम ही रहता है। उससे रिवाइज करना आसान रहता है। ठीक है, सो वी हैव डन दिस इन मैराथन 1 आल्सो। नाउ दिस इज अ मैराथन रिवीजन। ठीक है, पेपर लीक करने को बोलते हो, सही बात है। आज ऑफ फर्स्ट लेट अस स्टार्ट विद द टॉपिक ऑप्टिक्स। Session is going to be from 7:45. Now it is. We'll take it to 9:30. Then we'll take a dinner break. Please allow a dinner break. ठीक है, 9:30 to 10 is going to be a dinner break. And 10 to जगराता। ठीक है, रात भर पढ़ेंगे सुबह तक। बिल्कुल। हाँ, रशिया गया, बिल्कुल सही। जाने का मन तो रशिया था, जाना था जापान, पहुंच गए चीन, समझ गए ना। हाँ, आ जाओ। सो सी, दीज आर द इम्पोर्टेंट टर्म्स। ठीक है, विच आर इंपॉर्टेंट फॉर यू। लेट अस स्टार्ट। आ जाओ, फोकस नाउ। ठीक है, इनफ ऑफ जोक्स, फोकस, बाकी तो सुबह सुबह करेंगे। नाउ emetropia is absence of refractive error, please remember. Ametropia is presence of refractive error. And iso, we have done this repeatedly, and iso is asymmetrical refractive error, that difference. So basic asymmetrical refractive error is called as anisometropia. What is significant, you should remember. What is significant is 2.5 diopters is significant. That is the significant. Yes, खाना खा के आए, बिल्कुल बढ़िया। नोट इन ब्रेक, फिर बिल्कुल ऐसा ही करते हैं। चलो, एन आई सी कोनिया, डिफरेंस बिटवीन द इमेज साइज। हाउ मच इमेज साइज इज significant? That is 5% is what is significant. Please remember this. Anisocoria, coria is pupil, difference in pupil size. Anisopia, opia is vision. ठीक है, myopia, my small vision, myopia, that is opia is vision. So anisopia is difference in vision. Okay, and astigmatism is difference in refractive error in different axes in the same eye. Do not get confused between these two terms, anisometropia and astigmatism. This is between two eyes. This is in the same eye in different axes. This is astigmatism. These are the two terms which people get confused. So this is how the question is going to be. If it is two diopter in one eye, six diopter in the other eye, so these are two eyes, then it is going to be anisometropia. Okay. If the question says two diopter in one axis, six diopter in the other axis, in the same eye, then it is astigmatism. Okay. Please remember this terms, do not get confused between these two. ठीक है, बड़े आराम से बेटा, चिंता नहीं करो। सो दिस आर द क्वेश्चन केम इन Jan 24, July 24, इट हैज कम। 25 में भी आया है, 24 में भी आया है, इंशाल्लाह 26 में भी आएगा। ठीक है, -2 right eye, +1 left eye, 6-year old. So this is anisometropia. That is the correct answer. Okay. Jai Shri Ram. बिल्कुल। Refractive indices we have done. So the most important surface is most important refractive surface is the air cornea interface. air cornea interface because of the refractive indices. So these are the various refractive index. Air is 1, cornea is 1.37, aqueous is 1.33, lens is 39. Lens has two parts, okay, cortex and the nucleus. Cortex is 38 and 40. Inka average is 39. Okay. And vitreous is same as the aqueous, that is 1.33. Okay, very good. Now, what causes refractive error? We should be knowing that the axial length, okay, change in size of the eye, size of eyeball. This is what causes the most of the refractive errors. Okay, so do not get confused between these two things. That cornea is the most important surface which is causing the refractive error, but errors happen because of the axial length. Okay, curvature is the second most common. ठीक है, समझ में आ गया? तो errors जो होते हैं, these are because of the axial length, but the surface is the most important, is the cornea surface. Okay, refractive index, aging of the lens. This is seen in the nuclear cataract. Nuclear cataract. This is a second site where there is change in the refractive index of the nucleus. Yes, in the elderly. Positional, this is the most rare. Okay. Coming to different types, refractive error types. One is myopia. My is small. Opia is vision. Okay. Hyperopia. Hyper is the rays are going beyond. Okay. The rays are going beyond the retina. See here, they are going beyond the retina. And astigmatism, different refractive index in different axis. Okay. Correct. Now, the other question that can come is on concave lenses, which are given minus sign. Then you have the convex lenses, which are given a plus sign. Then you have the cylindrical lenses, which can be both plus and minus, which can be both plus and minus, that is cylindrical lenses. Now, pathological myopia, it is because of the change in size of eyeball. Okay. So what happens in this? The increase in size causes thinning of the various curvatures, whether it is sclera, whether it is choroid, whether it is the retina. Okay, sclera, choroid, and the retina, all the layers are getting thinned out. So there is thinning, scleral thinning. There is choroid atrophy. There is thinning, again thinning. Okay, then there is fuchs spot. This is again thinning of the fovea, leading to hyperplasia, hyperpigmentation, hyperplasia. And simultaneously, there are these two degenerations. These are the retinal thinning. Okay. What will thinning lead to? Retinal thinning. What will this lead to? This will lead to a hole, and this leads to RD. RD is retinal detachment. What type of detachment? It is going to be obviously with the hole. So hole wala detachment is kaun sa? Rhigmatogenous. Okay. So the question comes, what kind of RD is seen in myopes? It is rhigmatogenous. If the same question comes, what type of RD is seen in diabetics? Then the answer is tractional RD. Okay. Okay. It is a tractional RD because there is traction. Absolutely good. Now, the next question that comes is, what is the strabismus? What is the squint that is seen in myopes? It is exo. Because see, the eyeball is big. When the eyeball is big, it tends to move out. Okay, there is exophoria or exotropia. Okay, what type of cataract? It is a complicated cataract. It's a complicated cataract. Okay, and because of the thinning, what does thinning of sclera lead to? It leads to staphyloma. It will lead to staphyloma, characteristically at the posterior pole. This is the posterior staphyloma. This has come as a question, which is seen in pathological myopia. Okay, staphyloma is out bulging. See here, Notice this out bulging. This is bulging out along with the uveal tissue. Along with the uveal tissue. Okay? This is the posterior cephaloma. Okay? Next, we come to the next topic is astigmatism. Astigmatism is different refractive error in different axes. Okay. As you can see, cornea is spherical in shape. That is how the normal cornea is at birth. At birth. But then the cornea becomes oval shape because of the lid pressure. And this is what leads to astigmatism. Okay. So this is what will lead to astigmatism. This oval shaped cornea leads to astigmatism. Two types of astigmatism are regular and irregular. Okay. Regular is well defined axis. Okay. And there is no well defined axis in case of irregular astigmatism. Okay. Correct. So regular is of two types, with the rule and against the rule. है This Vivek Jain has asked us to remember कि with the rule is like this, where the vertical is steep, horizontal is flat. Okay. Vertical is steep, horizontal is flat. So vertical steep, vertical steep and horizontal flat. Horizontal flat. This is with the rule. If it is opposite, vertical flat, if the vertical is flat and horizontal is steep, then it is against the rule. That is how you keep the egg. Okay. So this is one method. Second is this one, which is minus at 180 and plus at 90 and minus at 90 plus at 180. So you always write minus like this. So minus at 180, minus at 180. This is with the rule. Plus at 90. This is also with the rule because you always write plus like this and this. So this is how you are normally writing this. So this is with the rule. Okay. Against. Have you ever seen somebody writing like minus like this? Minus at 90. Nobody writes minus like this. And nobody writes plus like this. That write horizontal first and then cross. So plus at 180, this is also against the rule. Correct? So this is one. Very good. So these are two types of astigmatism on which the question can come. How does this come in diagrammatic form? This is the diagram. So Sturm's conoid is basically the ray diagram. It is ray diagram of astigmatism. Ray diagram of astigmatism. Okay. Yes, absolutely right, Dr. Isha. कि एक याद कर लो, अगर if you have remembered this one, तो opposite will always be against the rule. You can do that also. That is very good. So, ray diagram of astigmatism is this one, where you have vertical rays following one focus. This is one focus, as you can see, and the horizontal rays forming the other focus. See here. What is the gap between these two? The gap between these two, this is what is called as the conoid of Sturm, also called as the Sturm's interval. Also called as Sturm's interval. Okay. And the area between these two, here, this is what is called as the circle of least confusion. That is there. Correct? Okay. Very good. That is absolutely between these two. ये इमेज बेस्ड आया था. This comes as an image based question in NEET also and in case of your FMG also. Now see, the retina, if this is the cornea, okay, this is the cornea, the rays are getting focused. The patient can have retina here. So one point is falling focus, the other point is in focus, in front of the focus. Okay. So this is a astigmatism, which is simple astigmatism, where one point is falling on the retina, the other point is falling before the retina. So this is simple astigmatism. Okay. Compound is when the retina is here. So both points are in front of the retina. That is compound astigmatism, compound myopic astigmatism. Okay. What can be the other option? The other option is the retina is here. So one point is on focus. The other point is beyond the retina. Okay. That is simple hyperopic astigmatism. Okay. And the other possibility is ki retina is here. So both the points are beyond the retina. That is compound astigmatism. Okay. And the third option is that the retina is here. One point in front, one point behind. That is mixed astigmatism. Okay. So retina can be at any position. So this is what is shown here in this diagram. So simple myopic, one point on the focus, one point in front. Simple hypermetropic, one point on the focus, one point behind. Okay. Compound myopic, both the points are in front, retina is here. Okay. Compound hyperopic, both the points behind and retina is in front. And mixed is one point in front, one point behind, and retina is between these two. This is what is called as a mixed astigmatism. ठीक है, correct है, understood. So very simple. Simple का मतलब होता है one point is on the retina, the other point is off. ठीक है, good job. Excellent, guys. Excellent. So what does this given image depict? This was the question FMG 2020. Okay. What does it depict? This is basically telling you about a regular astigmatism. It's a regular astigmatism. In case of an irregular, how will the ray diagram be in case of an irregular? Irregular may there will be multiple points. Not single point, but multiple points. So there are multiple points. This is how irregular will look. करेक्ट है, समझ में आ गया, वेरी गुड. चलो आ जाओ. नेक्स्ट, -1 diopter sphere, minus at 180. What type of refractor is this? Minus at 180. Minus at 180. Yes, this is with the rule astigmatism. Absolutely good. This is with the rule astigmatism. छा गए मेरे शेरों, बहुत बढ़िया, वेरी गुड, एक्सेलेंट. एफेक्या बाबूराव गणपतराव, ठीक है, एक्सीलेंट. साइंस ऑफ एफेक्या पे क्वेश्चन आया है. दे हैड गिवन यू साइंस ऑफ एफेक्या, द पर्सन इज प्रेजेंटिंग विद अ लिम्बल स्कार, ठीक है, अ डीप एंटीरियर चेंबर, ठीक है, टू Purkinje images, only two Purkinje images are seen. There is iridodonesis, okay, there is jet black pupil, and patient is using a +11 diopter spectacle lens. +11 diopter spectacle. This is a thick lens, thick convex lens. Patient has a hyperopic error. Okay. So this is what is aphakia. What is the condition? It is a aphakia. The same question can come if the patient's scenario has been given and they're asking you what is the ideal choice of treatment. What is the ideal choice of treatment? Then it is an intraocular lens. This is the ideal choice. Okay. More specifically, a more correct answer will be posterior chamber in the bag IOL. In the bag IOL, that is PCIOL. Very good. That is PCIOL. Okay. Spectacles are least preferred because they cause 30% magnification. Remember this. Okay. Spectacle are least preferred because they cause magnification. As you can see here also, if you see, the eyes of the person is appearing huge. Look at the eyes. They are appearing very, very big. So this is very, very, yes, they look weird because of this, because of magnification. Okay. There is color change. There is jack-in-the-box phenomena. There is roving ring scotoma. These are the various changing it is there. Okay, 30% magnification. लेकिन पर डाप्टर नहीं है बेटा, इट इज जितना भी होगा उसका 30% बड़ा दिखता है. नाउ रेटिनोस्कोपी is an objective method. It is an objective method of finding the refractive error. And this is the question which is there. Refractive error is equal to retinoscopic value minus 1 by distance and minus the cyclophysics used. Two questions that are commonly asked. What is the normal working distance in OPD? What is the normal working distance in OPD? It is 66 centimeter or 2/3 meter. 2/3 meter. This is the normal working distance. But 1 meter is for understanding. But in OPD, the normal distance is 1 arm length. So 1 arm length from the arm, from the tip to the arm, that is 1 arm length. That is the distance. Okay, beta. Now, second is the MCQ that comes is on the cyclophysics used. Cyclophysics are A, C, H, T. A, C, H, T, A, atrophy. C, cyclopentolate. Cyclopentolate. H, hometropy. And T is tropicamide. And how much is subtracted for them? It is 1, 0.75, 0.5, and 0.25 is the value that is subtracted here. Okay. So that is the mnemonic ACHT. You know the ACTH? Here the mnemonic is ACHT. Okay. This is how the question can come. Next, what are refractive surgery eligibility criteria? So, eligibility criteria for refractive surgery are age more than 18 years. This is the most important. And stable refraction for at least 1 year duration. These are the eligibility criteria for any refractive surgery. Okay. This is for cornea-based surgeries. Cornea-based surgeries are allowed only up to myopia of -12 diopters and astigmatism and hyperopia of 6 diopters. This is what is the limit for the cornea-based surgeries. Okay. If it is beyond this, then you can go for lens-based surgeries. And if required, you can combine both the cornea and lens-based. And this is what is called as bioptics. This is what is called as bioptics. Okay. So these are various cornea-based surgeries, lens-based surgeries, and combined surgeries are there. RK is incision surgery. It is incision surgery. PRK and LASIK are one where we are using excimer surgery. And smile and silk is where we are using the femtosecond laser. Okay. There was one question somebody had asked, how to remember, sir, where what laser is being used? Okay, how to remember, sir, where which laser is being used? So I was thinking about some mnemonic by which I can remember. So see, whenever somebody wants to get a LASIK surgery done, patient is excited. So patient will get a excimer surgery. Okay. Excimer for PRK or LASIK. So excimer for excited. याद करने का तरीका. Okay. You can remember it like that. And whenever you get second chances, girlfriend को propose किया, girlfriend rejected first time, but girlfriend is giving you a second chance. ठीक है? So what will you do? You'll smile, na? I'm very sure you'll smile if you get a second chance. है ना? So this is what is second chance. You is smile surgery. ठीक है? So this is how you can remember femtosecond and excimer. ठीक है? So ऐसा करके याद कर सकते हो if it is possible. अब हमें तो याद रहता ही है. ठीक है? But I think if it is there, good one. So lenticular surgeries are clear extraction. Phakic IOL is ICL. Phakic IOL is same as ICL. Implantable contact lens. The MCQ that comes is, what is the anterior chamber depth? बेटा अब सिल्क क्या बताओ, गर्लफ्रेंड सिल्क अपने आप याद कर लो, ठीक है। द स्किन इज सिल्की, ठीक है, इजी रिमेंबर। सॉरी बेटा, आई हैव टू टेक दिस कॉल, जस्ट हेलो, या मैं क्लास में हूँ, अभी लेक्चर ले रहा हूँ, ठीक है, रात को 12:30 1 बजे तक। मैं देखता हूँ बीच में, जब डिनर ब्रेक होगा तो बात करते हैं, ठीक है, ओके बाय। Sorry. So anterior chamber depth, ठीक है, that is the, what is anterior chamber? It is the 2.8 millimeters is the minimum anterior chamber depth for doing a ICL surgery. Very good. हाँ बेटा, 12:30 1 तो बजेंगे ही. Refractive error control options are these ones. So first is this, second is this, and third is this one. So these are low dose atropine. It comes as 0.01% or 0.05%. These are the two strengths in which the low dose atropine comes. So atropine basically relaxes your ciliary muscle, allowing the axial length to be remaining stable. Okay. Second is this one, which are myopia control glasses. Myopia control glasses, these are there. And third is this one, which is ortho K lenses. It's called as ortho keratology. These are hard lenses, one, and these are worn at the night time. Night time you wear them. They have a pressure effect. As you can see here, there is a pressure effect on the cornea by which they control the size of the eye. Okay, this is what is there. So, optometrists have long lives. बिल्कुल, वेरी गुड. सो वी कम टू द एंड. हाँ, जिसको यूज करना है एट्रोपिन यूज कर सकता है, ठीक है, बट बेटर वुड बी कि किसी ऑफ्थेल्मोलॉजिस्ट से बात करके करो, खुद से ऑफ्थेल्मोलॉजिस्ट मत बनो, ठीक है. बैकग्राउंड लाइट, हे भगवान, तुम्हारी यार बत्ती, बत्ती जग गई. चलो, हाँ आ जाओ. नेक्स्ट इज एम्ब्रियोलॉजी ऑफ आई. Very important topic on which the MCQs can come. So whatever you see on the surface comes from the surface, whether it is eyelid, vitreous ko we can let it be. So we can just cut vitreous from all of them. Okay, vitreous is from all parts. Vitreous from all parts. So see, surface पे जो है, whether it is the skin, the cornea, the conjunctiva, the lacrimal gland. So everything that is there on the surface is coming from surface ectoderm. So epithelium of cornea, epithelium of conjunctiva, epithelium of conjunctiva also. Okay. So skin, cornea, conjunctiva, and yes, lens, because we have done this. This is how the lens goes inside. So there is a lens procode. This goes inside, becomes lens pit, and then becomes a lens vesicle. So lens procode, lens pit, lens vesicle, and finally we get the lens. Okay. This is the optic nerve, optic stalk. Becomes the optic cup. And then we get a optic nerve like this, which is correct. Okay. And the inner layers, this is going to be 9 layers of retina. And this one gives the retinal pigment epithelium, which is on the outer side. That is why the 9 layers, they separate from the retinal pigment epithelium because of this space. Because of this space, the detachment occurs between the 9 layers and the pigment epithelium. That is why they separate. RD is in between these layers. This is what has come as a MCQ. Okay, correct. Now, so neuroectoderm. Neuroectoderm. What does neuroectoderm give rise to? Gives to retina, optic nerve, iris, and ciliary body. See here. Can you see? See? So this part, this purple part, which is there, it is going like this, becomes like this. Okay. And this is how the retina, pigment epithelium, retina, the ciliary body. This is the ciliary body. And this is the what is going to give the iris. So iris, ciliary body, retina, and optic nerve. This is all coming from the neuroectoderm. Just remember neuroectoderm, it is coming like this. Very good. Now, in mesoderm, you just remember M and muscles, the extraocular muscles. This is what will come as MCQ. And finally, we have the crest. Crest stands for, see here, cornea, CR, stroma, S, endothelium, E, and trabeculum meshwork. So, corneal, endothelium, stroma, sclera, and the trabeculum meshwork. Go back to C, you have the ciliary muscles and ciliary ganglion. So this is very easy to remember if you just remember the mnemonic crest. Okay. Just ignore the chat, Dr. Ravi. आ जाओ, आप पढ़ाई पे फोकस करो. Just ignore the chat. ठीक है. आज those who are focusing, focus on this. Otherwise, just ignore the chat. Okay. We don't have time to do hanky panky. आज उस चीज का टाइम नहीं है. आज we are focusing only on completing the marathon. जो फोकस करेगा वो पास होगा. Absolutely. So, anatomy of lens, we have done this. This is how the lens looks like. It's a biconvex structure. One surface on the posterior part, one surface on the anterior part. Wherever the two hands are touching, that is the equator. Okay. Posterior surface has no cells, anterior surface has cuboidal cells. Equator has columnar cells, which are giving new fibers. So this is how it is. So anterior surface, posterior surface, cells here, no cells here. Okay, this is the front of the lens, anterior pole. So this is the anterior pole. And this one is the posterior pole. And equator is the one which is giving the new fibers. Center has the oldest fibers. Center has the oldest fibers. Okay. Berger space, which is here. This is the Berger space. Retrolental space behind the lens and in the vitreous. And canal of Hanover and canal of Petit. Petit is here, which is like this. Canal of Petit, Petit is here. Canal of Hanover is here. Hanover is here. Okay. This is the canal of Hanover. Okay, this is Petit. Okay. These are the very good. Next, coming to classification. Before classification, please remember that lens is avascular and metabolism is anaerobic. Lens is avascular, metabolism is anaerobic. The respiratory quotient of lens is 1. Respiratory quotient of lens is 1. These are the other MCQs that can come. Starting with congenital cataract, then aging, that is senile cataract. Trauma cataract, that is blunt trauma. Metabolism, abnormal metabolism, the sugars, the copper, and myotonia dystrophy will come to galactosemia. These are the metabolism cataracts. Radiation is because of the heat waves. You can get the glass blowers cataract. Okay, radiation is by the infrared rays. We get a glass blower or iron workers cataract. This is a posterior subcapsular cataract. Okay, complicated cataract as a complication of the disease. The mnemonic was the tiger and BAPP. We'll talk about them. Pretty toxic. As a toxicity of drugs such as amiodarone, busulfan, corticosteroids, okay, dexamethasone. So these are drugs which are there. Okay. हाँ, infrared rays, beta heat rays होते हैं ना, infrared heat. Okay, because of that. So, congenital cataract, starting with this. Blue dot cataract, this is the most common overall. This is the most common visually significant cataract. Lamellar, also called as the zonular cataract. They're the same. Most common, but this is visually not significant. Visually not significant. This is an incidental finding. It's an incidental finding. Okay, correct. Blue dot cataract, also called as cataracta punctata caeruleum. And cataracta punctata caeruleum, no treatment is required. Zonular is because of the infection or radiation. Which infection? Torch infections. Okay, radiation, vitamin D deficiency, and autosomal dominant inheritance. These are the various types. Hypercalcemia, absolutely good. Next is congenital cataract management. This question has come in NEET PG where they are given an image of leukocoria. So cataract is also a differential diagnosis of leukocoria. Leuco is white. Chorea is pupil. Leuco is white. Chorea is pupil. What is the ideal treatment? It is immediate. Okay, it is immediate treatment. Why do you require immediate treatment? To prevent the stimulus deprivation amblyopia. Stimulus deprivation amblyopia. That is why you will do immediate treatment. Okay. What is the treatment? Treatment is lens aspiration plus primary posterior capsulorhexis plus partial anterior vitrectomy and plus the intraocular lens. So please remember, you have to remove the anterior capsule, you have to remove the lens, you have to remove the posterior capsule also, and you have to remove the anterior vitreous also. Okay, and then put a lens. Now, next MCQ that comes is on power of IOL. Power of IOL. If the child is more than 8 years, you put the normal power. Whatever calculation you have done, you put the normal power. If the child is between 8 to 2 years, you do a 10% under correction, 10% reduce. And if the child is less than 2 years, you do a 20% under correction. So you reduce. Okay. Why? Why? अमिताभ बच्चन, तुम्हारी टॉन्ट मैं समझ रहा हूं. ठीक है, डोंट वरी. Why do you do this? MCQ. Why this is done? This is for the future myopic growth, myopic shift. For the future myopic shift. Okay, because the eyeball is increasing. Yes, absolutely good, Dr. Shreyas. Very good. आजा बेटा थोड़ा और ट्राई करते हैं. डॉक्टर अमिताभ बच्चन आ जाओ. Cortical cataract and nuclear cataract. These are the two types of senile cataract which are seen. It can be classified as immature, mature, and hypermature also. You have the liquefied cortex, and you have the sunken nucleus. Sunken nucleus that is there. Okay, very good. This is a more type of Morganian cataract. Yes, this is the Morganian type of hypermature cataract, which is shown in the diagram here. Next, we come to traumatic cataract, seen with blunt trauma. This is how the rosette cataract looks like. Okay. Rose-like picture. Okay. Rose-like. And the complicated cataract looks like this. Please notice the difference between these two. This has a granular appearance. As you can see, this is what is the breadcrumb appearance. Okay. There is axial spread. Here it is also looking like a flower. But here the spread is axial. It is spreading in the all axis. Okay. Polychromatic luster. Polychromatic luster means poly is multiple, chromatic is colors. So multiple colors are seen, blue-green shades. ठीक है, and posterior subcapsular location. It's a complication of other intraocular diseases. It's a complication of other intraocular diseases such as tumor, inflammatory diseases, glaucoma, endophthalmitis, and R is retinal disease. R is retinal disease such as RP and RD. Retinitis pigmentosa and detachment. So टाइगर आएगा तो कॉम्प्लिकेशन होगा ही होगा, है ना. और इफ यू सी द टाइगर किसको बुलाओगे? यू विल कॉल फॉर BAPP. You will call for your papa, BAPP. So you will always remember this. Very good. Okay. So the two types of cataract, I hope you will be able to solve the MCQs on this. Good. Now we come to various metabolic diseases. Okay. There is snowflake cataract, as seen here. Diabetes, as you can easily remember, snowflake, sugar disease, sorbitol metabolism. So SSS. So snowflake, sugar disease, diabetes, and sorbitol metabolism. Sunflower cataract, Wilson disease. Sunflower cataract, seen in Wilson disease. See this image. So as you can see here, you can see the rays like sun which are going out. This is sunflower cataract. Okay. Next is oil droplet cataract, galactoil, okay, galactosemia, oil droplet cataract. Now, this is a reversible type of cataract. Reversible type of cataract. One MCQ has come on this. The other MCQ that has come is on galactosemia is which enzyme? So there is GK, galactokinase 1, GK1, and the other is on GPUT. So GK1 and GPUT, these are the two enzymes which can lead to this galactosemia. Okay, very good. Christmas tree cataract is myotonia dystrophy. That should be easy. Okay, very good. So these are the various questions that can come as an image-based question. Now, very important topic is Wilson's disease. So see this. Wilson's disease, okay, where you have the sunflower cataract. This we have already done. Next is KF ring. This is Kesher-Fleischer ring. KF ring. This is seen in the cornea. Which layer of cornea? In the Descemet's membrane. Descemet's layer. In the center or in the periphery? In the periphery. In the periphery of the cornea, you see this Kesher-Fleischer ring, KF ring. One important MCQ that has come is, what is the best diagnostic tool? It is copper level in the liver biopsy. If this is not given, then what is the best option? Then the best option is ceruloplasmin levels. Ceruloplasmin levels. This is the next option. Okay, if this is not there. It is on gene ATP7B, on chromosome 13. It's autosomal recessive in inheritance. It's a disease of copper metabolism. The drug that is used in D-penicillamine, and trientine. These are the drugs which are used in Wilson's disease. I hope any question of Wilson's disease you will be able to answer. Okay, good, excellent. Face of panda sign, wing beating tremors. Okay, it's also called as hepatolenticular degeneration. Hepatolenticular degeneration. That is the other name of the Wilson disease. Very good. Next, clinical feature for cataract is gradually progressive, painless decrease of vision. It's a painless. It is painless decrease of vision. Then you can have polyopia, multiple images, and then you can have colored halos. MCQ has come on this, in which they asked what is the test for differentiating colored halos of cataract versus colored halos of glaucoma. The test name is the FinChem test. The FinChem test. Okay. What is the instrument that is used? The instrument is stenopic slit. Okay. When you apply the stenopic slit, there are two possibilities. The colored halos persist and the colored halos disappear. If they persist, then it is glaucoma. If they disappear, then it is cataract. Okay. This is what can come as an MCQ. FinChem test. Very good. Excellent. Now, in preoperative evaluation, we basically have to check for the keratometry, that is the corneal curvature, and the axial length. The axial length. Why do we require these two? These two you require for biometry. What is biometry? It is IOL calculation. IOL power calculation is called as biometry, for which you require keratometry and axial length. These are the two important preoperative evaluation that you have to do. Okay. Others are checking the fundus, checking the retina, fundus, the retina, the intraocular pressure, okay, the cornea clarity, cornea clarity. These are the other tests that are to be done. Okay. Now, if you talk about types of anesthesia, you can have general anesthesia, and you can have a local anesthesia. Local can be topical. What drug is used in topical? It is MCQ proparacaine. Proparacaine. Okay. What is used for blocks? Topical, and you can have blocks. What do you use for blocks? You use lignocaine, and you can use bupivacaine. What are the adjuvant drugs? What is the additional drug that you use? Additional drug you use is hyaluronidase. This you need to mix for better penetration, and also you use epinephrine. Okay, these are the drugs which are added. Okay, so these are the adjuvant drugs. What are different types of blocks? Are retrobulbar. Retro is behind, bulbar is eyeball. Retrobulbar. Peribulbar. Beta lignocaine 2%, bupivacaine 0.5%. Okay. Retrobulbar, peribulbar, and your subtenon block. Retrobulbar, peribulbar, and subtenon block. MCQ that comes is, along with retrobulbar, what do you use? You have to use a facial nerve block. Facial nerve block is required along with the retrobulbar block. Okay, so this can come as an MCQ. Next, types of surgeries. What are types of surgeries? We've done this. There is ICC. ICC is intracapsular, where you remove lens in toto. You remove. And ECC, where what is the important part? Capsule is preserved. Okay. Capsule is preserved. So basically, in various types of ECC, you are preserving the capsule. So ECC can be of different types. Conventional ECC, where the incision is 10 to 12 millimeter incision. SICS, where it is 6 to 8 millimeter incision. Phacoemulsification, where the incision size is 3.2 to 2.8. Okay. MICS, micro incision cataract surgery, where the incision size has gone down from 2.2 to 1.8. And flax is which laser is used in cataract surgery? The MCQ that comes is the femto second laser. So even in cataract, so for if the MCQ comes, what is the laser that is used in cataract? Okay, how to remember which laser? The patient will get second vision. That is how you can remember. So patient had lost the vision. Now the patient will have a rebirth. So regain of vision. So easily you can remember for cataract we use which laser? The femto second laser. He is going to get the vision second time. First time he got the vision at birth. Second time he is getting the vision by the surgeon. कभी घमंड नहीं किया, ठीक है? But still it is there. ठीक है? That is how you can remember. Okay. Correct? Understood? Now, the next MCQ that comes is suturing is done where? Suturing is done here. Suturing is always done in this big incision. Okay. Suture here is plus minus. Suturing may be done. Suturing may not be done. In rest all, the suturing is not done. The suturing is not done. Okay. These are the MCQs that you can get on different types of surgeries. Okay. Correct. Next. This is how the diagram of the SICS surgery. This is the image-based question. If it comes on SICS surgery, as you can see, there is a scleral tunnel. This is a scleral tunnel. And what is the instrument that is being used? This instrument is the wire vectis. Wire vectis. Okay, this is the instrument that is being used here. The wire vectis. Okay, very good. Now, smarty fellow. Okay, good. So now for calculation of intraocular lens, we have done what is the biometry? Biometry is power calculation. Okay. Now, which formula to be used when? हेलो। हाँ, मुझे बाहर ही निकाल दिया यार तूने तो यार। कमाल करते हो। सडन लॉस ऑफ विजन। सडन पेनलेस लॉस ऑफ विजन हो गया ये। हाँ। पेन हुआ किसी को? पेन तो नहीं हुआ किसी को? सडन ऑनसेट पेनलेस लॉस ऑफ विजन। सर यूज ओल्ड पीडीएफ प्लीज। अरे ओल्ड क्या? वी आर यंग सो वी यूज द यंग पीडीएफ। ठीक है चलो। पेनलेस। मुझे तो बहुत पेन हुआ यार। आ जाओ इधर। फोकस। सेकंड विजन आ गई। सेम यार, आई ऑल्सो मिस ऑल ऑफ यू। आ जाओ इधर। सो बायोमेट्री इज पावर कैलकुलेशन। पावर कैलकुलेशन। ठीक है। सो सी, आयल कैलकुलेशन इज चाइल्ड, दिस एमसीक्यू वी हैव डन। आ जाओ, फोकस फोकस हो जाओ। ठीक है, आयल कैलकुलेशन इज चाइल्ड वी हैव डन। नाउ फॉर अ नॉर्मल साइज eyeball, for this is the SRKT. SRKT is for the normal size eyeball. How do you require your holidays to be? You want long holidays, so holiday formula. And you want to question have short question, short answer. So you want question which should be short, and short question, short answers. Okay. Now, one question that can come is that now you have a universal formula. Universal formula. The name is Barrett's universal formula. Barrett's universal formula. That is there. Okay, correct बेटा? Very good. बच्चे बोल रहे हैं प्लीज यूज लैपटॉप पीडीएफ सो डोंट नीड टू राइट एवरीथिंग टू सेव अस टाइम। अरे मेरा बच्चा, देयर आर मेनी स्टूडेंट्स हु हैव नॉट सीन दिस, सो फॉर देम इट विल बी अ डिसएडवांटेज। ठीक है बेटा, देखो नो सर हो गए ना शुरू। ठीक है, नो सर कंटिन्यू, देखो आ गए नो सर वाले। सो बेटा ऐसा पॉलिटिकली क्वेश्चंस मत बोलो कि आई कैन यूज दोस। आ जाओ। लेट कोई बात नहीं, तुम्हारे पास है ना पुराना वाला, यू यूज दैट। ठीक है, आई नीड नॉट यूज दैट, यू कैन यूज दैट, यू नीड नॉट राइट। ठीक है, आ जाओ। अरे यूट्यूब पे चालू है मेरा चैनल। मेरा खुद का चैनल बन गया यूट्यूब पे। वेरी गुड, आ जाओ आ जाओ। खुद देख लो, हाँ वेरी गुड। तो खुद देख लो ना, जिसके पास प्रीवियस, ऑल दोस ऑफ यू हु हैव द प्रीवियस पीडीएफ, इट इज इजी फॉर यू। ठीक है, यू कैन जस्ट राइट इफ आई एम टेलिंग यू एनी एडिशनल पॉइंट, अदरवाइज जस्ट कीप मेमोराइजिंग देम। ठीक है, आ जाओ। सो दिस इज हाउ अ मोनोफोकल लेंस लुक्स लाइक। फोकस। ठीक है, डोंट स्ट्रेस योरसेल्फ बच्चा, आ जाओ। Monofocal lens. This is a toric IOL. Remember to identify this. This basically tells the axis of astigmatism. Axis of astigmatism. This is what toric IOL. Correct. This is what is a multifocal IOL. The recent ones are also called as a trifocal IOL. Multifocal and trifocal. And this is an accommodative IOL. Accommodative IOL, not very successful. Not successful till date. ठीक है, वन थिंग। मल्टीफोकल IOL, ठीक है, ओनली यूज्ड इन pristine eyes, pristine clear eyes, those who do not have any corneal disease, no retinal disease, not diabetic, so it can be used in those, and the side effect is going to be yes clear. Absolutely good. Now a recent new lens, a new technology lens, which is a monofocal lens. Monofocal lens variant. It is an EDOF lens. If the MCQ comes on EDOF lens, then this is a extended depth of focus lens, EDOF lens. These are a monofocal lens variant. These are EDOF lenses. Okay, they are monofocal lenses, but they provide a certain depth to the vision. Okay, so your near vision, your intermediate vision, okay, provide better intermediate vision than the normal monofocal lens. Okay, they provide better intermediate vision than the normal focal. They will also require reading glasses. So MCQ that comes is, you can get the MCQ that is there, is that here reading glasses required. Here also reading glasses required. And here reading glasses not required. Reading glasses not needed. Not needed in case of a multifocal or a trifocal lens. But the only condition is that the eyeball should be absolutely clear. Only then you can use this. Okay, very good. Next is the complications of cataract surgery. What is the most common complication? It is a PCO, also called as the secondary cataract, also called as the after cataract. What are the two types of PCO? Types of PCO. One is your L-Schnick's pulse. L-Schnick's pulse. And other is your Sommering ring. Sommering ring. L-Schnick pulse is the one which is the more common one. L-Schnick pulse is the one which is the more common one. What is the treatment for this? What is the treatment for this? It is ND-YAG laser. ND-YAG laser capsulotomy. Capsulotomy. ND-YAG laser capsulotomy. That is the treatment. Okay. This is the most common complication of a cataract surgery. What is the most dangerous complication? Infection. Especially if the infection goes into the vitreous cavity. What is this called as? This is the endophthalmitis. Endophthalmitis. Now, there was an MCQ and they asked the organism. Organism. Organism is the Staphylococcus species, which is coming from where? It is the normal commensal. It is the commensal in the conjunctiva. So, what is the most important step in prevention? It is the use of povidone iodine. Povidone iodine 5% in conjunctival sac. In conjunctival sac. Okay, just preoperative. Just preoperative. That is the most important step in prevention that is there in conjunctival sac just before the surgery on the conjunctival sac, not inside the eyeball. Okay, do not inject it. It is not injected. Okay. It can come as this image-based question. This kind of image can be given. This is the pupil which is dilated, the lens that you can see. Okay. Can you see this curve? This is denoting this. This is denoting this curve. See? This is the lens and this curve. Okay, this is what you are seeing here. This is what you are seeing here. Okay, this is how the lens is going. So center lens, and you see these pearl-like things. Correct? Very good. Ectopia lenses, we have done this. Marfans, up and out. Marfans, wheel marchesani. W is downward. And march is forward. Okay, march is forward. Then there is homocystinuria. H going in. Homocystinuria. And then you have Ehlers-Danlos. E is everywhere. This is Ehlers-Danlos. These are the various conditions for ectopia lentis. Okay, very good. Easy to remember. Which of the following should be kept in mind while placing intraocular lens in a child? The myopic shift. The myopic shift. This is correct. Okay. Next, we come to the glaucoma. Let us start with glaucoma. Okay. Very good. Excellent. 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 Glaucoma is a triad of the intraocular pressure, optic neuropathy, and visual field defects. Visual field defects. Correct. So, because of the increased pressure, there is damage to the optic nerve, and this damage presents with a characteristic visual field changes. So, the characteristic is that there is a special type of optic nerve change with a special type of visual field. Mostly it is because of the pressure. Sometimes it can be seen in normal pressure also. This is what is called as a normal tension glaucoma. Correct. So the three things are IOP, optic nerve disease, and visual field defects. The only thing that you can change is the IOP. Rest other factors, whether it is the gender, whether it is the race, whether it is genetics, whether it is age, you cannot change. Okay, rest all factors are non-modifiable. Only IOP is changeable. Okay. So that is why we need to understand what is the IOP. The IOP is 60 plus minus 2.5, or you can remember 10 to 21 millimeters of mercury. This is the normal IOP. So 10 to 21 millimeters of mercury, this is normal IOP. Aqueous production is happening at the ciliary processes. Ciliary processes is where the aqueous production is happening. These are the mechanisms. The three mechanisms. D is equal to thus. So remember the thus: diffusion, ultrafiltration, and secretion. Out of this, secretion is the most important one. The aqueous, once it is from this place, it goes like this and divides into two parts. The trabecular part is called as the trabecular outflow and the uvuscular outflow. This is the 90% drainage, which is happening to the trabecular meshwork, and 10% is going back into the ciliary body. The normal ratio is 90 and 10, but at some places it is given as 80 and 20 also. So don't worry about it. Okay, it is the same. Now, aqueous drains from here into this is the Schlepp's canal, and from Schlepp's canal it goes through these channels and goes into the veins. Goes into the veins. This is how the aqueous outflow is happening. Correct. Now, how do you measure the pressure? Okay, this is the measurement. Measurement of IOP can be done by shear sonometry. Shear sonometry is a indentation. Indentation tonometry. Easy to remember if you look at the finger, and if I'm telling you that I am indenting, so this is what is dent. So when you indent, this is what is the indentation. Okay. Applanation is when you make it flat. Applanation is when you make it flat. So this is applanation. Applanation is flattening. Okay. So indentation is short sonometer. Applanation is Goldman applanation tonometry. This is not portable. This is not portable. This is portable. Okay, this is portable. This can be easily carried anywhere. The not portable is slit lamp mount. As you can see, it is on the slit lamp. This is a slit lamp use. Okay. Based on Imbert-Fick law, that is pressure is equal to force per unit area. This is again an MCQ. Perkins handheld tonometer, again a type of applanation tonometry. But this is portable. But this is difficult to learn. Difficult to learn and use. It is difficult to learn and use. Okay, yes, difficult to master. Tono pen. This is used in scarred or edematous cornea. Scarred and edematous cornea, we use toropen. What is the principle? The principle is Mackay-Mark principle. So that is why sometimes you can get the MCQ as Mackay-Mark tonometry. Okay, Mackay-Mark tonometer. Correct. Non-contact tonometer. This is the commonly one which is used in OPD. Uses air puff to flatten the cornea. This is what is the OPD tonometer. Okay, not NCT. So you can get this as NCT. If the MCQ comes up, which of the following is used in OPD routinely? It is the NCT, which is normally used in OPD. Correct. Very good. After test changes, Zoom user. Chalo, I'll try. Now, please see these two. This is the optic nerve. This is the cup. So this is the cup. This is the disc. Okay, can you see? Cup and disc. See in this diagram. Now this is the cup and this is the disc. Can you see? Can you appreciate that increase in the CD ratio? Yes. Increase in the CD ratio. Very good. Yes. So what are the different signs? So there is increase in CD ratio. What is the normal CD ratio? Normal CD ratio is 0.3:1. Okay. What is suspicious? Suspicious is 0.5:1 or more. 0.5, yeah, is more. Increase in CD ratio. Okay. Asymmetry between two eyes. Asymmetry between two eyes. One eye has 0.2, other eye has 0.5. Even though 0.5 is suspicious only, it is not glaucoma. But still, because there is difference between the two, that is why it is problematic. Asymmetry between two eyes. Correct. Next is what? A thinning of NRR. Thinning of NRR. See here, beta. The C denotes the NRR. What is NRR? That is the neuroretinal rim. Okay. So nerve fibers are less. The thinning of NRR. What is next? Next is the laminar dot sign. Laminar dot sign. You will see holes like this. This is what is laminar dot sign. These kind of holes, they appear. Okay. And next is a deep cup. Deep cup. Okay. Now, beta, Beoneting sign is this one. Vessel sign. Okay. So there is nasal shifting of vessels. Nasal shifting of vessels. Next is the Beoneting sign. Beoneting sign. These are the other two signs which are there. Okay. And peripapillary signs are the loss of nerve fiber striations. That is one. And second is a splinter hemorrhage or a superficial hemorrhage. Superficial hemorrhage at the margin. At the margin. So if you have a bleeding here, if you have a bleeding like this, okay, this is what is called as a splinter hemorrhage or a superficial hemorrhage at the optic disc. Okay, these are the various signs which are there. These are the optic disc changes. Okay. Next is the visual field changes. These are there. So first is this one. First is a non-specific sign. non-specific sign, which is a isopter contraction. Isopter contraction, that is the first sign. Next is a paracentral scotoma. Such kind of scotoma, this is the paracentral scotoma in the Jerem's area. How much is the Jerem's area? Jerem's area is the central 20 to 30-degree field is the Jerem's area. Okay. What does this denote? This is the normal, okay, optic nerve. Okay. So this is a normal optic nerve. This is the blind spot. This is there in all of us. Okay. This is the blind spot. Okay. Correct. Now, seedal scotoma. What is seedal scotoma? Seedal scotoma is a sickle-shaped scotoma. Sickle-shaped scotoma. That is seedal scotoma. Okay. So this was second. This is third. This is the fourth. Arcuate scotoma, also known as a Jerem scotoma. See, arc-shaped scotoma. You know, arc shape, it is like an arc. That is why it is called as arcuate scotoma or a Jerem scotoma. Next is double arcuate. So one arc above, the other arc below. Okay, this is double arcuate scotoma. So this one is the next one. This is fifth one, double arcuate scotoma. And Rones nasal step. So when the two arcs are not meeting, this is what is called as the nasal step. Appreciate this. This is what is called as the nasal step. And this is a temporal step. So the inner one is temporal. The optic nerve is temporal. This is temporal. Okay. And this is a temporal step. This one is the nasal step. So nasal. And this one temporal. Okay. You can have a, but they will give you this kind of image. They can give you an image and they can ask you what is this, or they can ask you which is the first change that is occurring. So first change that is occurring is this one. This is the first change that is occurring. Okay, because this one is non-specific. So this you will not mark this. The first change is this one. Okay, but this is how you can get. So here you are getting, yes, here you're getting another thing which is a tunnel vision. Center vision is a tunnel vision. Okay. And finally, the temporal line of vision is the last to be lost. This can come as an MCQ. Which is the last visual field to be lost? It is a temporal field. Okay. Very good. Now, how do you check for these fields? The test is perimetry. Humphrey test, it's a gold standard. This one is the gold standard, is the Humphrey test. It's a type of static perimetry, and Humphrey is a automated static perimetry. Okay, this is the MCQ that can come. Okay, confrontation method. This is a kinetic perimetry. This is a OPT method. OPT method, in which you ask the examiner to sit out in front of you and the examiner test. That is a confrontation method. This is the OPT method. That's a kinetic perimetry. Okay, very good. Next is gonioscopy. What is this? To visualize the angle of anterior chamber. To visualize the angle of anterior chamber, we do gonioscopy. Why do you need to visualize? What is the reason that you want to visualize? See here. To see this, whether the angle is a normal angle, whether it is an angle closure. So when you put a gonioscope here, when you put a gonioscope like this, okay, you can see whether the angle is open like this or whether the angle is closed like this. Whether the iris is closing the trabecular meshwork, whether the trabecular meshwork is clearly open. So this is where you use a gonioscope. Understood? So to see this part, you do. Okay. So basically to differentiate a normal angle from an angle closure, you need to do this. Have you understood how gonioscopy is done and how it is to be seen? Very good. See here. So come back. So what are the various methods? Gives a direct view. Patient must lie. Good magnification. Okay. So Cope, Richardson. So RK, basically RK is direct. RK is Richardson and Cope is RK. And Ranbir Kapoor is direct to girls. Okay. And Swan Jacob. These are there. Goldman, Zeiss, Posner Sussman. These are the indirect ones. These are the indirect ones. Where you use patient must be at the slit lamp. Used in OPD. So this is used in OPD. This is used in surgery. So MCQ can come like this. So obviously in surgery you want a good magnification. In OPD, somewhat less magnification will also do. So that you can remember these things. Okay. Next is congenital glaucoma. This is ophthalmos. This is ophthalmos. Okay. So there is, what is the pathogenesis? There is trabeculodysgenesis. Trabeculodysgenesis, that is abnormal genesis of the trabecular meshwork. What is this membrane called as? This membrane is called as the Barkan's membrane. This is the Barkan's membrane which is there. And the triad is BPL, Bumpelat, blepharospasm, photosensitivity, and lacrimation. The patient presents with a megalocornea. As you can see here, there is a hazy cornea which is enlarged in size. It is almost occupying the entire palpebral aperture. The eyeball size is increased. What will happen to the lens? Lens will subluxate. What is the anterior chamber depth? It's a deep anterior chamber. It's a deep anterior chamber. Why this is happening? Because there is a block here. Aqueous is coming, but the block is there. So the aqueous is collecting here. The eyeball has become like a balloon. It is expanding in size. Okay. So this is what is happening in the ophthalmos, in the congenital glaucoma. What are the signs that are seen? So as you see, there is a cloudiness. There is hazy cornea. Okay. There is hazy cornea. Halves try. See here, H for halves, H for horizontal. Horizontal tears in descemet membrane. This is halves striae. And horizontal diameter is increased. This is what is called as megalocornea. Correct. Very good. Okay. Next is your blue sclera. Blue sclera, please remember this. Anterior chamber is deep. How is the sclera? Sclera is blue and antechamber is deep and spontaneous subluxation of the lens. And next is spontaneous subluxation of the lens. Spontaneous lens subluxation. These are the signs. Now, if I ask you the treatment, what is the management? If I ask you about the management, treatment is surgical. Please remember, surgical is the definitive treatment. Medical treatment is only till diagnosis is confirmed. Now, what is the MCQ on medical treatment? What is the drug of choice? Drug of choice are beta blockers. Drug of choice. What is contraindicated? Alpha agonist like brimonidine are contraindicated. Why? Because they cause CNS suppression, which will lead to what? CNS suppression will lead to your respiratory suppression, your cardiac suppression, okay, and even death. Even death can occur. Okay, very good. Surgical treatment. Goniotomy was once the treatment of choice, but what is the problem with goniotomy? Goniotomy needs a clear cornea. Needs clear cornea. But how is the cornea here? Cornea is usually hazy. If the cornea is clear, then goniotomy is the treatment of choice. Take care. But because cornea is mostly hazy, then the treatment of choice becomes the trap on trap. What is this? This is trabeculotomy with trabeculectomy. Trabeculotomy with trabeculectomy, that is a treatment of choice for surgery. Okay, correct. Otherwise, you can use the other methods, which are glaucoma dredge devices. Okay, that could also be done. Okay, correct. Implants. We'll talk about implants later. Now, glaucoma in adults can be either primary or can be secondary. Secondary as in secondary to other causes. Secondary to other causes. Primary, we know. Primary means that there is no cause. Okay. So primary can be primary open angle and primary angle closure. So primary open angle and primary angle closure. This will depend upon the gonioscopy. So gonioscopy is basically required to differentiate whether it is an open angle or angle closure glaucoma. Okay. Now, understand the term hypertension. When the IOP is high, but no optic disc and no visual field changes. So see here, this is not glaucoma. Okay, this is not glaucoma. It is called as hypertension. So do not confuse glaucoma with only IOP. Whenever there is optic disc cupping with visual field changes, only then you use the term glaucoma, even if the IOP is constantly low. So this is what is called as a normal tension glaucoma. So glaucoma is basically an optic nerve disease. The reason is IOP in most cases, but sometimes IOP can be normal also. Okay, good. Now, coming to second type, angle closure glaucoma, narrow angle. This is where the MCQs come. Okay, it's like acute congestive glaucoma. It presents with an attack. It presents with an attack. IOP rises rapidly to very high levels, marked congestion of eyes. See here, mid-dilated oval pupil. Okay, MCQ, vertical MCQ. Okay, hazy cornea, MCQ, shallow anterior chamber, MCQ, especially in patient when patient has gone to see a movie. Okay, movie theater. This comes as an MCQ. Okay, so this is how the patient is presenting: a narrow angle, attack, hazy cornea, current halos, severe headache, rapid rise, sudden rise. Okay. So failure to lower IOP will lead to loss of eyesight. What is the immediate management? It is lower the IOP by use of what? The hyperosmotic agent such as the mannitol. And then you can use pilocarpine later. So see, then first you have to lower the IOP and then you use topical. Okay. What is a definitive treatment? Is iridotomy or surgery? What is the laser used? Which laser is used? It is the ND-YAG laser. We'll do this laser अभी. ये क्या भी करेंगे? ND-YAG laser. Correct है? Okay. So this is how the open angle is and angle closure is. We have done this. We have understood this. Okay. So this is the Vokes triad, where there is a oval pupil. There is sphincter atrophy. Sphincter atrophy. And this is what is called as the glaucoma flecken. This is the triad which is seen after angle closure glaucoma attack. After angle closure glaucoma attack. Okay, very good. सनफ्लावर का अटैक नहीं बेटा, सनफ्लावर नहीं है. सनफ्लावर में आपको they will show you the entire pupil. Plus, please remember, whenever you get an image-based question, please read the adjoining history, adjoining question that has been given. The description that is given, that will be very, very clear. Okay. Good. So see here, present with onset, sudden onset of pain, redness, decreased vision, hazy cornea, mid-dilated pupil, shallow anterior chamber. This is an acute angle closure glaucoma. Correct? I hope you'll be able to answer this. Very good. Same to same आ जाए तो क्या मजा आ जाए. Next is secondary glaucomas, as we had talked about, secondary to other causes. So one is pseudo exfoliation glaucoma. Can you appreciate this target sign? One circle, second circle, third circle. Okay. This is what is called as the target sign, which is shown in the image above. Sample is line seen at the angle. Source exfoliative material is not known. So there is exfoliative material. MCQ. Also there is zonular weakness. Zonular weakness that is seen. Target sign shown above. Sample is line. This is also MCQ. And this is also MCQ. What is sample line? Sample line is basically an extra line in front of the shawl base line. Correct? Next is neovascular glaucoma due to VEGF production. Rubeosis iridis as shown above. Okay. Anti-VEGF injection and definite treatment is PRP. We have done this in our diabetes. You have to burn the retina. You have to kill the retina. Okay. Next is pigment dispersion syndrome. As you can see here, this is the pigment which is getting deposited. This is the Krukenberg spindle. This comes as MCQ. Okay. There is iris pigment shed and blocks of reticular meshwork. There are trans illumination defects. Trans illumination defect in the iris. Okay, because the iris pigment is shed, so this will lead to a trans illumination defect. Okay. Sample is line seen here also. So sample is line seen in two conditions. One here and second in the pseudo exfoliation glaucoma. Next is malignant glaucoma seen after any intraocular surgery. Aqueous misdirection syndrome. Drug of choice is atropine. This is an MCQ because atropine will relax the ciliary body and bring it back to the normal position. So this is what is very good. Next are these two lens-induced glaucomas. Phacomorphic. Morphic is morphology. And phacolytic. Lytic is lysis. Lytic is lysis. Morphology में the anterior chamber is shallow. Here the anterior chamber is deep. Anterior chamber is deep. Because of the lysis, there is leakage of lens protein. Lens protein is a sequestered antigen. Sequestered antigen. And then there is an antigen antibody reaction. This is what blocks the trabecular meshwork. Antigen antibodies, the swollen up macrophages, they block the trabecular meshwork. Okay, so the treatment is going to be steroids. You lower the IOP and you remove this lens. Here, what is going to be treatment? Treatment is going to be you have to do mannitol. You have to give mannitol here. So you have to use mannitol to bring down the IOP. When the mannitol is given, this lens moves back, the anterior chamber deepens, and then you remove this cataract surgery. Okay, then you remove the cataract which is there. Okay, these both are seen in hypermature cataracts. Hypermature cataract can lead to these two types of conditions, phacomorphic and phacolytic. Most important feature is the depth of the anterior chamber. Correct. Coming to glaucoma, finish करके फिर dinner break. Management of glaucoma, medical management, surgical, and lasers. Out of this, medical and laser are important. Let us talk about medical. Anti-glaucoma drugs decrease aqueous production. A, B, C, alpha agonist, beta blocker, common contrast inhibitors. Increase the trabecular outflow. That is the conventional outflow. Trabecular is the conventional outflow. That is ROCK inhibitors and myotics. Myotics and ROCK inhibitors. Increase the uvascular flow. That is your PG analogs, which are nowadays the drug of choice. So if MCQ comes, what is the drug of choice nowadays? It is the prostaglandin analogs. Why? Because why are the PG analogs the drug of choice? Drug of choice is because they have an OD dosage, once a day dosage, once a day dose. They are very efficacious. Efficacy is very high. Okay. Once a day से क्या advantage होगा? The compliance is good. Okay. Next, they have a good memory. The memory is good. That is, even if you skip a dose, the IOP does not increase. That is a good memory. Okay. So that is what is there. But they are contraindicated in patients with inflammation. Patients with inflammation, such as in uveitis. Such as uveitis. Next is post-surgery. Post-cataract surgery. Next is patient with retinal disease. In patients with retinal disease, you avoid using this. Okay. In patients with aphakia, you will also avoid using this. So these are the conditions where you will avoid the use of prostaglandin analogs. Okay, good. Next, we talk about the alpha agonist, that is apregnonide and brimonidine. We have done this MCQ. Causes death, causes sedation. Causes sedation. So you avoid in truck drivers, heavy vehicle operators. Okay, truck drivers, train drivers, you will avoid this. Okay. Beta blockers, timolol, butoxolol, limonol, common contrast inhibitors are acetazolamide, brinzolamide, dorzolamide. Diuretics are mannitol hypercholesterol. Page analogs, LTBT. Okay, these are the first line treatment. We've done this. Why they are the first line treatment? Correct. Myotics are pilocarpine and ROCK inhibitors are nitarsodil and ripasodil. These are the various drugs which are used. Okay. I'm very sure you have done this by now in your pharmacology also. Avoid using. We have done this question. Okay. What is the side effect of PG analogs? It causes hyperemia. Hyperemia. Okay. Hyperemia is the side effect of PG analogs. What are the other side effects? What are the other side effects? There is elongation of eyelashes. Elongation of eyelashes, eyelash growth. What else is there? Change in the color of iris. Heterochromia. Heterochromia. Periocular pigmentation. Periocular skin pigmentation. That is there. Then apart from this, you can get a orbitopathy also. What is orbitopathy? there is loss of orbital fat. So it looks like a sunken eye. Sunken eye effect. गड्ढे हो जाते हैं आंख में. ठीक है. Loss of fat. Yes. So there is orbitopathy. Okay. Good. हाँ. Uveitis worsens. Keratitis worsens. But PG analog will not cause uveitis. PG analog will not cause keratitis. It does not mean that the patient has this. So it will worsen, but the patient does not have this. That will not cause. Okay, understood this. Correct? Orbitalitis भी ऐसा ही है. समझ आ गया? Very good. Now, lasers in glaucoma. See, trabeculoplasty. So you have to modify the trabecular meshwork. It is to be done by open eye glaucoma. There is shrinkage trabecular meshwork done by argon diode laser. That is trabeculoplasty. Anti-YAG laser, irid, otomy. Otomy is whole. Plasty is modify. Plasty is modify. Whole, you need to make an angle closure glaucoma. Okay. And this is done by anti-YAG laser. Bypass the pupillary block. This is how the hole is created. This is how the lasers are done on the trabecular meshwork. ठीक है. हाँ, hyperemia कराए. बिल्कुल सही प्रत्युष. Absolutely good. Now, these are the various lasers that I had shared in the morning also. So anti-YAG laser, I was thinking about a mnemonic, how to remember this. Excimer तो याद हो गया. Excited, ठीक है. Excited to get rid of glasses. Okay. Second is second chance. So second chance में आप smile करोगे. Okay. And you have a silky skin. This is second chance. And similarly, you have flax. That is the second time the patient is getting vision. This is how you can remember. Okay. Now, YAG I was thinking. So, PYAG. है ना? ND Prayag. ठीक है. Those who have heard about Dev Prayag. ठीक है. Dev Prayag. Hindu. है ना? Very good. So, yes, Prayagraj. So, YAG. So, PCO and PI. So, PCO and PI. That is PYAG. PYAG करके याद, देव प्रयाग करके याद करते हो. ND देव प्रयाग ऐसे करके याद कर सकते हो. इफ यू कैन रिमेंबर दिस, देव प्रयाग. ठीक है. डबल फ्रीक्वेंसी. सो PRP. PRP. 2 times you are having P. So double frequency. Double frequency YAG. Double frequency YAG किसको याद रहे. ठीक है. These are some of the lasers which you need to remember. If you can remember their wavelengths, very good. It is required. 193, 1053. Everything is given in this screen. ठीक है. ओके. याद पीने के बाद. भाई पीने पानी की बातें मत करो. Absolutely good. Let us take a dinner break. ठीक है. Let us take a dinner break. Hopefully, after dinner, my writing will also improve. क्योंकि I came directly from my OPD and directly sitting here. ठीक है. Hopefully after. अरे नहीं भाई, कुछ खा लेना तो. पानी भी नहीं पिया आज तो. हाँ, वेकेशन से तो आए थे भाई, पर आते ही तरह काम करना पड़ेगा. ठीक है. सोना नहीं था. हाँ. तो ये क्या पी रहे? पानी. अब भी पानी पिया है भाई. बिल्कुल सही है. सो लेट अस टेक अ डिनर ब्रेक एंड लेट अस कम बैक बाय 10 o'clock. फटाफट आ जाओ. हाँ, उसके बाद तुम्हारे वेकेशन ही वेकेशन है बाकी चल के तो. ठीक है. जल्दी जाओ, जल्दी आओ. फटाफट जाओ.